lost my sound. Okay, let's go ahead and call the board meeting to order. And could we please have the roll call?
Supervisor Levier.
Good morning, here.
Supervisor Long. Supervisor Long. Supervisor Huber.
Here.
Supervisor Ramirez.
I'm here.
Chair Parks.
Here, thank you. Okay, let's go ahead and go to our Pledge of Allegiance. Join me in the pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. I'd like to begin by welcoming our new County Council, Tiffany North. I had the pleasure of swearing her into office, and this is a very good day to be welcoming Miss North here. She has come from the County of Riverside, where she was, I think, second in line for the county council there, and we are just delighted to be able to nab her from Riverside County, and just so appreciative for her being here with us today. So good morning and welcome, Ms. North, and welcome to the county family.
Thank you, Supervisor. I'm very happy to be here.
With that, let's go to our agenda item that is our minutes. That's item 4, and we're so glad to have you here. Do we have a motion for the minutes? And this would be the minutes of April 20th.
I'll move approval.
Okay, we have a motion from Supervisor Levier, second from Supervisor Huber. Could we have the roll on this too?
Supervisor Levier.
Yes.
Supervisor Long.
Yes, and just to note, I was here earlier for the roll call, but couldn't hear me.
Thank you. Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Here. Great. And with that, we'll go to our next agenda item, item 5, and this is our agenda review. And good morning, Mr. Powers.
Good morning, Chair Parks, board members. Item 8, receive a report on the coronavirus. A comment letter from Judy Bruce has been submitted. Item 9, public comments. A letter from Tim Totten has been submitted. Item 15, Area Agency on Aging, approval of an increase in appropriations in support of the agency's meal delivery service program. A revised board letter has been submitted. Item 21, Healthcare Agency, the healthcare plan. Authorization to increase expenditures for 5 Ventura County healthcare plan providers. A comment letter from Teresa Jordan has been submitted. Item 28, Agricultural Commissioner. Adoption of a resolution to establish 1 full-time equivalent position of Farm Community Labor Relations Assistant. PowerPoint has been submitted, as well as a comment letter from Ventura County COLAB. Item 29, Fire Protection. Adoption of a resolution to add 6 positions of firefighter. A comment letter from Teresa Jordan has been submitted. Item 32, CEO's Office. Conceptual approval of a 3rd Business Assistance Grant Program. Board letter has been submitted and requested to hear this item right after the COVID update, item 8. Item 33, GSA. Authorization for Southern California Edison to provide construction services at the Government Center campus. PowerPoint's been submitted. Item 36, CEO's Office. Receive and file an informational presentation on the occurrence of hate crimes within our communities. 2 PowerPoint presentations and a comment letter from Tim Totten have been submitted. Item 37, CEO's Office and RMA, approval of the requested 2021 redistricting process request removal from the agenda. Item 41, Supervisor Parks, adoption of a policy to protect monarch butterfly overwintering groves and support planting of native milkweed and pollinator-friendly plants on county property. A comment letter from Teresa Jordan has been submitted. And finally, item 22, CEO's office, receive and file department budget presentations, PowerPoints from Human Services Agency, Ventura County Library, Area Agency on Aging, and Resource Management Agency have been submitted.
Thank you. Did you want to repeat that? No.
What was the middle part? Yeah, right.
Well, do we have any other suggestions on revisions to the agenda or a motion to accept it as recommended?
So moved, Huber.
Supervisor Huber always beats me to the punch.
We do have a motion.
I do.
Second.
I'll second.
Thank you. And could we have the roll call on that too?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you. And now, before we get into the nitty-gritty, we have an opportunity to do our moment of inspiration, and this is always a good time at our meetings to inspire us and hopefully the community too. And today is Nurses Day, and how appropriate. We have Michelle Sayer here. She's the Chief Nurse Executive at our Ventura County Medical Center. And we want to honor our nurses, and so today we are giving our sincere thanks to our nurses for their dedication and their hard work. And this is especially so over the last year, probably some of the hardest work that they have done. They are so devoted to making sure we are cared for at our hospitals and our clinics, and you guys are our heroes. You are on the front lines every day, pandemic or not, you are there for us. And particularly with the pandemic, as well as every day, your passion for helping others is so appreciated. You know, that is your calling, and we are so grateful that that is. Ms. Sayer, I think you might have a PowerPoint too, so I'm going to turn it over to you. And this is a resolution that you see on the screen from all of our board members who signed it, just recognizing this is National Nurses Week. And so, Ms. Sayer, I'll hand it over to you. Uh-oh. Sounds like we have a little bit of an issue with our sound. Would you try to unmute yourself, Ms. Sayer, and the rest of us will all mute ourselves, and let's give it another try, okay?
Okay. Do you have me?
We have you.
Hello? Oh,
We can hear
okay,
you,
I was
we
on.
can see you, so
Okay.
please proceed.
Do you have me now?
Yes, yes, we do.
Okay, thank you so much, Chair Parks. Sorry for that little bit of confusion. On behalf of the nurses at Santa Paula Hospital and Ventura County Medical Center campuses, I want to thank you for recognizing Nurses Day and the valuable contribution that nurses make to our healthcare system. As you said, we don't need to be reminded how difficult the past year has been. But because of the unwavering support of you, the board, CEO Powers, HCA leadership, and Dr. Fankhauser, and all of hospital leadership, this past year would have been so much more difficult. The nurses at both campuses are so grateful for the many examples of support that were demonstrated over the past year and have personally told me how much they appreciated your support. It took an entire team of nurses, physicians, radiology techs, phlebotomists, housekeepers, maintenance staff, and so many other passionate and committed professionals to get us through the past year. So although we are recognizing nurses on Nurses Day, nurses could not do what they need to do without all of the other team members that make their job possible. I want to give an extra shout out to a few nursing departments that really carried more than their fair share of burden through the pandemic. The telemetry unit, also known as ICU2, was the dedicated COVID unit for a large portion of the pandemic, and were also the only trained nurses to care for our oncology patients that had to be housed on other units. These nurses rose to the occasion and then some. I also want to give an extra thank you to the emergency room nurses who constantly cared for the continuous stream of COVID and non-COVID patients, consistently demonstrating their compassion, patience, and team spirit. Nurses make a difference in patients' lives, and it is appropriate to recognize them on their special day. But on behalf of the nurses at both campuses, I want to thank the entire Ventura County healthcare team for making a difference in the lives of its nurses, especially when it matters the most. So thank you so much for this wonderful proclamation, and I will share it with all of the nurses. Thank you.
Thank you so much. Our thanks is to you and for all that you do. Do other board members would like to chime in on this? Yes, Supervisor Ramirez.
Yes, thank you, Ms. Sayer, for your comments. There's nothing we could say here or do beyond what you have done for our community. I've seen you in action. I have friends who are nurses. You put your lives on the line. You experience the trauma that so many people are distant from, and I really appreciate you. And I hope that our nursing staff that need support, not just financially and other ways, get the support they need emotionally for what they have been through. I think it's very important for all of our healthcare providers, and that we should all recognize how they've sacrificed so much for us. I appreciate it so much. Thank you.
Thank you.
And Supervisor Long?
Yes, thank you, Madam Chair. I just want to say thank you to all the nurses. It is not just a job, it is a passion. And if anyone has gone to any of our hospitals, clinics, you'll see such great care. They're making sure your visit and you are as good as you possibly can during the situation. And usually it's a stressful situation. And with COVID, just all the extra levels that they've had to do to just make sure that they're doing their job right and as safe as possible and is providing the best quality. So I just want to say thank you to each and every one of you. Just really appreciate all the effort and work that you do. Thank you.
Thank you.
And I would note too that each year they have a different theme for a Nurses Week, National Nurses Week. And this one is You Make a Difference. And I absolutely make a huge difference. And you think about our hospital system too, and how fortunate we are because we have those nurses there, and they really are kind of like the foundation of our healthcare system. Mr. Powers, would you like to comment too?
Thank you, Chair Parks. Just briefly, Michelle, thank you to all the nurses. And Michelle, thank you for your leadership. You know, being at the hospital right around the time of one of the surges, I think what struck me too was, you know, understanding the intensity of caring for COVID patients, having to gown up and change every time they go in and out of a room, the additional stress that creates. But the attitude of the nurses is what struck me. So positive, so welcoming, so confidence inspiring that, you know, we got this. This is why we're here. We're going to take great care of your family member. And I know just for the family members of loved ones who are in the hospital, that kind of attitude makes such a difference. So it's the kind of thing that doesn't show up sometimes, maybe in a document, but just the spirit that I think people feel from their passion and warmth was extraordinary. Thank you.
Thank you.
Thank you. Thank you for your comments on that too. I think about how they refer to firefighters, you know, they run into the buildings while everyone's running out, you know, and people were wanting to stay out of the hospitals in a way, and they were there for us. So, and so many of our critically ill COVID patients too. So thank you so much.
Huber, I wanted to say to the nurses, it's very, very grateful for all your dedication. It's stressful at times, and you do it with a good heart and a lot of caring, and I very much appreciate that. Thank you.
Thank you, Supervisor Huber. Okay, with that and this inspiration, let us move on then. would be to our agenda item 7, which is our consent agenda items. Do we have any ones that someone wants to pull out, or just a motion to approve? Okay.
This is Supervisor Long. I'll motion to approve and just appreciate all of staff's work on all those items that are in the consent calendar. Thank you.
Second.
Okay, we have a motion and a second from Supervisor Ramirez. Could we please have the roll call?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you very much. And now for that time that we've been putting aside on every one of our agendas is Mr. Michael Powers. So
Thank you, Chair
I will
Parks.
turn it over to you.
Thank you. Yeah, thank you. I just real quick comment on that last item on the consent. Item 25 is appointment of members to the Emergency Planning Council from Sheriff's OES. And I just want to highlight one thing there that, again, with Patrick Maynard's leadership and Sheriff Ayub, they're expanding that group to include the DAFN community, those with disabilities and functional needs, as well as community engagement, and to truly embrace the diversity of our community, so as well as our diversity officer. So I really appreciate them expanding and being all inclusive in there and just setting up that all important Emergency Planning Council. So thank you. All right. Well,
Thank you for noting that. I'm really glad that we are expanding it to include more of the communities that are affected too,
Yeah.
so that and leaders in those communities that are more vulnerable. So I'm really glad to see that. Thank you for that.
Thank
and I appreciate that call out. So we do have the motion and the second on this one, and that was approved. And now we'll go to our COVID report. This is something that we've been doing every meeting for over a year now. And we're really in a good position these days and look forward when we won't have to have these reports anymore, right?
Yeah.
I'll turn it back to you.
Thank you, Chair Parks, board members, community members. That will be a great day. And we're certainly heading on that path thanks to your support and the community's support. So just a quick overview, maybe just go right to slide 3. Just a quick summary, and then we'll get into the details. With your board support and the vaccine task force, over 644,000 vaccines have been administered, first and second doses. It's just a pretty stunning number when you think our population's about 850. 58% have received at least one dose. Over 85% of seniors 65 and over have been vaccinated. We know how important that is to your board. The health matrix is really looking good. 2 of the 3 are already in yellow. And you see the positivity at 1 and the equity at 1.1. And that's important both because they're low, but because there's not much difference between the two. It shows all the effort that your board has supported and the team has supported to reach out to our low-income communities is making a difference. Allocations are still flat from the state, and we'll hear later about announcing the J&J vaccine use can resume. We've already seen that. We're just watching the demand for appointments too, because it's softening a bit. And so we're concerned with issues regarding hesitancy. So we're going to do some more outreach and communication to the community on that. We're starting to transition to a provider and pharmacy network-based distribution model, a little bit away from our sites. And we already talked about equity efforts, and we talk about them every week, but we pack a lot in there, but it is so important to what we do, and we're seeing the good results in our equity metric there. Testing, as I said before, it's the 1-2 punch of vaccine rollout and continued high volume of testing. It is just stunning. Over the weekend, I think of those 3 days, we had 11 or 12,000 people tested still this late in the game. It just shows how much the community cares, and it's making a huge difference in our numbers. We got to support our businesses, and we know it's a priority for your board. So there's another $20 million in county business grants for the second round. And then today, later, you'll be hearing about a recommendation for an additional $30 million in assistance being proposed to all of the grantees in both the first and second round. And then, of course, we'll hear more about rental assistance from Melissa. So With that, lots of ground to cover, and we'll get right to it with our vaccine task force leader, Barry Zimmerman. Thank you.
Thank you, Mike, Chair Parks, members of the boards. Hopefully you can hear me. There's some tree trimming grinding behind me, so there's a little extra noise in the background. But just to go over some of the details that Mike highlighted here is our numbers. And as you can see, the trend in the volume through the month of April. The good thing is we have about a week left in April, and so we will be on a higher pace in total for compared to the month of March, which is a positive sign, even though, you know, we've had a lot of advocacy and effort to get vaccines, and we've been fairly flat. We've been very fortunate to see an increase in the total vaccines volume going through our system. Is our projection for the month of April. We still see a trend upward in the sense of people getting vaccines. We have seen that slow a little bit, and so efforts are going to communicate and encourage members of the public to take advantage of vaccines and to protect yourself and your family members by receiving a vaccination. Next slide, please. I just wanted to show you what activities occurring as we've transitioned over to the third-party administrator. So if you can see there, the top line is the total vaccines over the last 3 weeks that we have received, from roughly 35,000 just over to this week about 32,000 vaccines in total. What we see is that with the third-party administrator takes more responsibility in distributing vaccines throughout their network. And so that prior to the third-party administrator, the public health administered all the vaccines and distributed them throughout the entire network. We've been relieved of that responsibility and only responsible for the sites that we manage, and those are the primary community sites that are up. As a result, what we see is that more and more of the vaccines are distributed by the third-party administrator. And so the second line, or the light blue line, shows the vaccine volume that is coming just to public health. And so we've seen a decline where we represented about 83% of the total volume of vaccines, and distributing that, we're down to about 63% today. What that means is that more and more network providers, as well as the Optum sites that we've worked with the state to set up, will be administered, and they will be directly allocated from the third-party administrator. So in total, our county is receiving a consistent volume. Just our network that we manage has seen a decrease in total volumes of vaccines. So in the long run, what we'll see is that we'll start minimizing some of our community sites, because other providers and network providers such as pharmacies and other medical networks, including our clinic system, will be a point of distribution for people to access the vaccine. In the long run, I believe this is the direction. So as we get into potential boosters and these type things, individuals will be able to get access through common medical provider channels versus having to set up community clinics to address them. Similarly, like with the flu shot that is administered widely through network systems, public health does take a targeted role for underserved communities, and we will still fulfill that role. But I just wanted to illustrate what is transpiring between the third-party administrator and the volume of vaccines that come into our system that we manage at this point in time. Next slide, please. So just as a status update, and many of you are familiar with this, the vaccines have been relatively flat. Anywhere from 30 to 35,000 has been our pace. We hear from the state that we will keep this pace for the next number of weeks coming forward. We will see a slight infusion, though, as as recently been communicated, the Johnson & Johnson vaccine has been released off of the pause and now is going to be distributed throughout our system. We will offer it as an additional clinic at our community sites, no different than what we did previously, where a site may have had Johnson & Johnson as well as other vaccines. And individuals, as they sign up for a vaccination clinic, will be able to identify which vaccine is being offered at that site, and then they can choose whether or not they want to continue with Pfizer, Moderna, or Johnson & Johnson at this point. The new sites, Oxnard College Park, the College Park site in Oxnard, has been open for a couple weeks now. It is administered by the third-party administrator now, meaning they'll get a direct allocation from them based on the capacity and volume that they can handle. It is a high-volume site, so we anticipate more and more vaccines going to that location to keep up that capacity there. Very successful and very welcomed resources from the state in our system. In that same model will be considered in Simi Valley, and the target date is May 8th for that location there. Next slide, please.
Excuse me, I have a question.
Yes, please.
Excuse me, Chair.
Sure, go ahead.
I want, I recently started to try to assist someone to make an appointment for testing. And it was a little complicated because you were required to upload driver's license information. So it's not everybody can upload anything, certainly from an iPhone. But what I wanted to say was at the end of it, they said, just show up without registration. And I think that's happening too with vaccinations. Could you clarify that? Do people have to make an appointment? Can they just show up? There's some confusion, at least in my mind, about that. Thank you.
With testing, individuals can just show up with testing there. We have not advertised that all clinics are just walk-up clinics, but we do take people on a case-by-case as they walk in. The encouragement is that individuals do sign up for the vaccination clinics in order to assure that we have enough vaccines for everyone that signs up, since we are still limited in that respect. I do know that those that are trying to secure their second dose appointment and having some trouble, that they can go to a vaccination site, and we will help them register and get their second dose at this point in time. We are looking at, as we hoped, and that we were going to see a significant increase in vaccinations, and then our vaccines received to our system. Then we would have clearly advertised that we would accept all walk-ins at that point. But since we are still limited, we ask for appointments to be made.
I would also just say I read something disturbing that doesn't have to do with our county, but that thousands of people are overdue in Los Angeles County for their second dose.
Yes, so we do have, we have looked at that. There is a lag in timing from first dose to second dose. We think we're within an acceptable range of the gap between first and second dose at this point in time. We have made a specific outreach, additional sweeps of emails and communications to individuals that we've noticed that have not received their second dose. And so we're actively trying to communicate and encourage them to schedule the appointment. I do not have an exact number of how many are significantly overdue there, but we can try to run down those numbers and report back to you.
Thank you very much.
Very good. Just the next two slides are informational in nature in order to remind that we do currently, as discussed with Supervisor Ramirez, encourage all to get appointments so we can match vaccines with the number of people that want to receive a vaccination. We do take walk-ins in the sense of those for the second dose and on a case-by-case basis to help them out. We recognize that it varies from week to week, the volume of first dose appointments that can be offered because we do get these bubbles of second dose clinics coming in which we need to make them the priority, and we do make the priority for second dose in order for people to complete their whole series for the vaccination. Next slide, please. This is a reminder and a good informational slide that individuals can use, that as more and more we hear that other environments as you travel or participate in various events, that you may have to show proof that you have received the vaccine. And so this is the where you would go if you have misplaced your vaccination card that you received at the site documenting your receipt of the vaccine. So you can go to the California Immunization Registry website, and there you can request and receive documentation of the immunizations that you have received. I think that concludes my remarks for today. Thank you. Any questions in additional?
Yeah, we do have a question, Supervisor Long.
Yes, thank you, Barry. And thank you for this information. I know any type of vaccine records we lose sometimes, just even on our kids' vaccine records, and we have to call the doctor and get that paperwork all out. But I just want to confirm that we in the Ventura County are not mandating proof of vaccination for any of our locations. Is that correct?
That's correct.
Okay, quite a few people have been very concerned in regards to that, and I wanted to make sure that we talk about it. There is a lot going on the state and federal level in regards to vaccine passports and going to private companies and having proof of vaccinations. And I wanted to make sure it was clear to you that the county has not put any of those stipulations in, but that we're requesting that everyone continues to follow the guidelines of public health with making sure you're tested and not spreading COVID-19. And we are not mandating the vaccine. I know I myself received my vaccine, but that was my choice. And so I just want to make sure that there is no mandate in this county that people have to be vaccinated. And I want to make sure that that's clear. And I just want to confirm that also, Barry.
Yeah, we have not provided as the county government mandates there. However, similarly that we see in Los Angeles, that they allow certain events and activities that if you get certain seating, let's say like at Dodger Stadium, if you have vaccines and so forth, and show that documentation. So it is important for individuals to have this as a record so they can interact with businesses as they set up their policies around vaccinations.
Right, and I appreciate that because I was at the California State Association of Counties LEDGE conference via Zoom last week, and that was a very hot topic in regards to both sides of this discussion and trying to understand what counties are doing what. So I wanted to clarify because I've received quite a few emails in regards to this and wanted to make sure that we discussed it. The question so thank you, that's one item. The second item I had questions on is I appreciate the pop-ups. So with our vaccine process, I understand that it's harder or we're getting less demand for people to get the vaccine. And so the pop-up vaccine locations are there and you don't have to have an appointment, right?
That is correct. There's a number of different types of community pop-up events that we have scheduled out, and some of this will be covered in our efforts of the equity populations, but they're partnering with churches, other organizations, as well as just us setting up in a community there. Primarily, those events are open and they are first come, first serve environments in which you can walk up, register, and receive the vaccine there. That is a purposeful activity in order to penetrate into communities that may have less access or knowledge about it, to make it easier for them to gain access to the vaccine.
Okay, great. Because as we think of, I heard you say we cannot open up our vaccine sites to just walk-ins because of our limited amount that we're getting from the staff. So I would ask, when do you think we can open it up to just walk-ins anywhere? Or when do you think we can open it up to mobile units being able to go to some of our manufacturing locations? Not just our big, like, you know, we have our mobile health mobile that goes to our health center, health days at a park. You know, can we do something like that at an industrial park? So all those manufacturing workers could not have to wait till they get off work to try to go get a vaccine. They could do it on
those are in our consideration right now. Right now, the resources, we have partnered with the faith-based community to do more community focus versus a specific company per se. The only companies that we've really targeted as a priority has been the ag industry, and we'll continue to work through agricultural environments there, both the packing houses as well as the field-based workers there. But we did take that under consideration. We do have that. Similarly, we've done that under testing. We went to some manufacturing environments and other large employers that could guarantee enough volume in order to satisfy the setup of the resources. So we'll look at that. Regarding the walk-ins, my reference were the broader community high volume sites. At this point, we match vaccines with appointments at those sites. As soon as we have if you will, a surplus or a greater supply than the current appointment demands, then we can start considering just open access across the board.
Okay, I really appreciate that. I'm very sensitive as someone who has to work a full day, you know, at the manufacturing location and going to their second job in the evening, trying to just make sure that we can be as accessible as possible. And then just the hard work of our public health in regards to even on the weekends, you know, going to the church Saturday, going Sunday. I just wanted to say thank you for all the efforts. I asked these questions just as brainstorming. How do we get these vaccines as easy as possible to everyone? And I really, truly appreciate it. And thank you to all the constituents that are sending their questions in so that we can clarify things and make sure we're on the same focus to get us out of this pandemic. So thank you very much.
Thank you.
We do have a question also from Supervisor LaVere, so please go ahead.
Thank you, Madam Chair. And I appreciate Supervisor Long bringing up the vaccine passport issue. I received many of those same emails as well, and I'm glad that we're able to kind of provide that clarity to people that that's not something the county is going to be mandating. So thank you, Mr. Zimmerman. My question is with regards to the Johnson & Johnson vaccine. I know there's still a lot of people out there who want that shot specifically because it's the one dose. And so the plan right now is just to spread it among the various clinics, not to have a standalone Johnson & Johnson clinic like we did before.
So we offered it at various community clinics prior as an open appointment system, and then we use it primarily within our mobile environment is the way we used it in the past. We will, as we start up Johnson & Johnson again, we will offer it in our community clinics, probably 2 clinics at this point in time that we're targeting, and then we'll start to utilize it more fully through our mobile unit as we have in the past. this way, I think it will allow individuals, to have choice of if they want a J&J, they will have access for them to receive it.
So we'll just be providing that outreach, letting people know which clinics have that vaccine, and they can go there and request it.
Yeah, it would be through My Turn. I just working with the state and setting up these clinics with the My Turn system. They have not quite turned on the J&J vaccine as an eligible vaccine. So hopefully we hope to open up appointments today, at the latest tomorrow, but that is our goal. And so you'll be able to see the clinics by vaccine there.
Great. Thank you, Mr. Zimmerman.
Yeah, I also very much appreciate the presentation and realize we do still have these vaccines without appointments in some of these cases with our pop-up locations, and
Yes.
was able to be at one on Saturday, and really appreciate the ability to go out to communities that may not be able to get to one of our vaccine clinics. And so that is a very effective program. And also in regards to it's vaccine passports. I know that there are, as you mentioned, like Dodger Stadium, places where if you want to go, they want to see that you have gotten vaccinated, and that's for the obvious reason to protect the public health of the community. But also seeing that some institutions and government agencies, the UC system, I believe, the CSU system, they're all requiring to make sure that their students and their faculty and their staff are protected with the vaccine too. So overall, I think the strong message is we're all safer with the vaccine, and encouraging people to get it.
Very good. I'll just have them click to one more slide, just as an informational slide that I'll finish up. Testing is still a strategy here. We still see a good volume that Mr. Powers indicated that testing is still a priority. Go to our website. We'll give you all the options where testing is available and the timing associated with it.
Great. Thank you, Mr. Zimmerman.
Right, thank you.
Back to Mr. Powers.
Thank you, Chair Parks. Board members, thank you, Barry. Next up, we'll hear from our Public Health Officer, Dr. Levin.
Good morning. Chair Parks, members of the board, Mr. Powers. On April 13th, that's 14 days ago, the U.S. Food and Drug Administration, the FDA, and the United States Center for Disease Control, the CDC, announced that out of more than 6.8 million doses of the Janssen vaccine administered, there were 6 reports of a rare and severe type of blood clot combined with low blood platelet levels that occurred in people after receiving the vaccine. Next slide, please. On that day, the FDA and CDC announced a pause in the administration of the Janssen vaccine. During the pause, medical and scientific teams at the FDA and CDC examined the available data to assess the risk of thrombosis involving the cerebral venous sinuses, which are the large blood vessels in the brain. It sits on top of the brain, and other sites in the body, including but not limited to blood vessels in the abdomen and blood vessels in the legs. If I might, for just a moment, a thrombosis is a clot, and when a vessel has a clot in it, blood obviously needs to be conveyed through that vessel to get to what's beyond it, whether it's a kidney, a lung, a finger. And if there's a clot in that blood vessel that is going to or from a site, that site is basically strangulated. So it's really important, of course, that we not form clots in our body. The thrombosis seen with these vaccinations were unusual in that they were associated with thrombocytopenia or low platelets. Normally, clotting occurs because platelets can contribute to it, come together and form that clot. So this was an unusual kind of thrombosis. The teams at the FDA and CDC also conducted extensive outreach to physicians throughout the United States after the pause in the Janssen vaccine to look for additional cases. As a result of this search, an additional 9 cases were found, which brought the total to 15 cases across the nation of thrombosis among 6.8 million vaccine recipients of the Janssen vaccine. All of these cases occurred in women between the ages of 18 and 59, with a median of 37 years. And I might add, there was only one woman above 49 years of age. So basically all these cases, 14 of them occurred at 50 years of age and younger in women. Reports indicated that symptoms began between 6 and 15 days after vaccination. Next slide, please. Following a thorough safety review, including 2 meetings of the CDC's advisory committee, I think next slide, please, still. Okay, great. Including 2 meetings of the CDC's advisory committee on immunization practices, the U.S. FDA and the Center for Disease Control, they've determined that the recommended pause regarding the use of the Janssen, which is the Johnson & Johnson vaccine, in the United States should be lifted and use of the vaccine should resume. The Independent Western States Scientific Review Work Group, composed of experts from Oregon, Washington, and California, supports the recommendation of the FDA and the CDC to lift the pause on the vaccine. Next slide, please. So in summary, the 2 agencies have determined the following. The use of the Janssen COVID-19 vaccine should be resumed in the United States. The FDA and CDC have confidence that this vaccine is safe and effective in preventing COVID-19. The FDA has determined that the available data show that the vaccine's known and potential benefits outweigh its known and potential risks in people 18 years of age and older. And finally, at this time, the available data suggest that the chance of TTS, the thrombocytopenia syndrome, occurring is very low, but the FDA and CDC will remain vigilant in continuing to investigate this risk. As part of the outreach nationally, the CDC has strived to ensure that clinicians were made aware of the potential for adverse events and could properly recognize and manage these events due to the unique treatment required for these blood clots associated with low platelets. Next slide, please. Now, while these blood clots are indeed very serious, 2 occurrences out of every 1 million doses administered should be considered quite rare and needs to be looked at in context. Like all vaccines, the COVID vaccine safety is based on a risk-benefit ratio. For comparison, let's look at the risk of what this vaccine is preventing. Let's look at the risk of experiencing serious thrombosis associated with COVID disease itself. While there are many research studies that look at this, I'll present just 3 representative studies for comparison. So this is looking at the deep vein thromboses in COVID disease versus the Janssen vaccine. And what we find here is that these first 3 underlined topics, 36 studies, the JAHA, and the New York study, those all looked at COVID disease and the number of deep vein thromboses that were seen in each of these 3 independent separate studies. The 36 studies was what's called a meta-analysis. And these are a group of researchers that will look at maybe 200 studies that have been done. And they pick the 36 or whatever number, maybe there'll be 180 of the 200, but in this case, only 36 qualified as being really good quality studies. And in this meta-analysis, they found that with COVID disease, there was a deep vein thrombosis in 5 out of every 1,000 people who got this virus. And that's whether there were symptoms or no symptoms, hospitalized or not. Total across the board of 5 out of 1,000 people who got COVID had a deep vein thrombosis. In the JAHA, or American Heart Association study, there was a similar number, 8 out of 1,000. And in the New York study of a New York hospital system with many hospitals throughout the state, again, 8 out of 1,000 people. So to compare this directly with the vaccine, the Janssen vaccine, let's multiply that by 1,000 to find out how many people out of 1 million got a thrombosis. And in that meta-analysis of 36 study, 5,000 out of 1 million people got thromboses. So as it turns out, thrombosis is very, very common with COVID disease, very unusually common. With the American Heart Association study, 8,000 people out of every million who get COVID got the deep vein thrombosis, and the same was true with the New York study. Now, with the Janssen vaccine that led to the pause, only 2 out of 1 million people got a thrombosis. So this is intended to give you some perspective about that vaccine and its risks. It's risk-benefit analysis. So,
Dr. Levin,
yes.
if I can just summarize, you're pointing out that the disease itself is more likely to cause deep vein thrombosis than the vaccine.
By a factor of about 4,000 times, yes.
Thank you.
Chair. Chair.
Yes, we have another question. Supervisor Ramirez?
Just very quickly. Dr. Levin, are you indicating that people get this DVT anyway? I know I have friends who fly in planes and got it, et cetera, or women of a certain age get it from birth control pills, they say. But are you saying people would get it anyway?
Well, there are some people who get it anyway. As you say, some people get it from birth control pills or associated with birth control pills. It is unusual enough with birth control pills that the FDA has not stopped birth control pills, of course. It is very common with people who get COVID disease. 5 out of 1,000 people who get COVID disease will get
even if they do not have the vaccine.
Oh, yes, even if they do not have the vaccine. And that is exactly why we develop vaccines, because we have this risky disease, and perhaps the vaccine we develop has some risk to it, but the risks are so much smaller that in comparison, they can prevent this disease that is much worse.
Thank you.
So if you're concerned about deep vein thrombosis, get the vaccine.
Yes, definitely. And just a couple more comments, and then I'll be happy to answer any additional questions. In Ventura County, so we will be restarting the use of the Janssen vaccine. On a risk-benefit ratio, this vaccine should be considered safe. If I did not believe this to be the case, we would not be making it available in our county. It has the significant advantage, remember, of only requiring, as Supervisor Levere pointed out, of only requiring 1 dose. I understand that there are some, especially women under 50 years of age, who might, in spite of the dramatically lower amount of thrombosis associated with the Janssen vaccine when compared with COVID disease itself, feel that they would prefer to have the Pfizer or the Moderna vaccine. If you choose to do this, our county will accommodate you. We will make one of the other vaccines available to you. And those are my comments.
Okay, thank you so much, Dr. Levin, for clarifying that. Seeing any other questions? Thank you very much. Okay.
You're welcome.
Well, thank you, Dr. Levin. We'll move on to our Public Health Director, Rigo Vargas.
Thank you, Mr. Powers, Chair Parks, members of the board. So just a quick update. If we, we have the slide up there. As usual, you'll see that, we're focusing in on the metrics associated with moving to the final tier, which is yellow. Unfortunately, we're a little bit short again in terms of entering the first of 2 weeks that are needed of us meeting the yellow metrics to then go into the yellow tier. And so today we're have some modest improvements, but again, still short in our case rate from entering the yellow. You can see there on the screen that our new adjusted case rate, that is the number of cases per 100,000 resident. And that is about it's going to be 2.4. We expect the state to, when they release around noon, the new metrics, we're going to be at 2.4, very modest improvement from 2.6. Just as a reference point in terms of our unadjusted, because all this is based on an adjustment factor based on our testing volume, our unadjusted was 3.4. It's going to be 3.2. So you can see there that we've pretty much stayed flat with our unadjusted actual case rate around 3.4, 3.6. Today we're going to be at 3.2, and so that's one of the reasons why we're not moving faster into improving our case rate, is that we've kind of remained a little stagnant, if you will, with regard to our actual unadjusted case rate. We do continue to get a favorable adjustment factor based on our testing volume. We've been averaging about almost a 1 point adjustment factor, more precisely around 0.8. And so that's based on our still over the state average testing volume. But, other counties have also kept up their pace with testing relative to ours. And even though ours is, again, still very, very strong, we're not getting the same, larger adjustment factor as we did a previous time. So that's some of the reasons for why we're saying, still good numbers, but not meeting the next tier's numbers. On the good, front news with regard to our other two metrics, positivity rate, as Mr. Powers alluded to, these are really outstanding numbers, because, to have a 1% testing positivity rate for all Ventura County residents that are getting tested and testing at that volume, and having a 1% positivity rate is really, really good. That means, the transmission risk is lower, but clearly we still do have community and person-to-person transmission taking place, but the numbers are really looking good. And particularly proud, of this next number, the health equity testing positivity rate, to be pretty much the same as our overall general population testing positivity rate at 1.1. In fact, we get a preview on almost a daily basis from the state on these three numbers. And throughout last week, there was a couple of times that for the first time ever, the health equity testing positivity number was slightly better than the general population. I mean, just to have this number be that low, it's just a testament to really the resiliency and just the efforts of Ventura County residents as a whole, but specifically in our hardest hit communities, as I mentioned before, roughly corresponding to the Oxnard areas, also Santa Clara areas, and Santa Paula, Fillmore, and Piru. Had higher numbers, but to bring our testing positivity rate in alignment pretty much the same as our overall county is again a testament to the residents. And then the powerful continued partnerships that we have. There's many community-based organizations that we work with very closely, formally, informally, in terms of there being great partners that do their own efforts, and formally through a small subcontracts and agreements we have with some of these CBOs to have dedicated staff of theirs to help us with outreach education and now with vaccination efforts. And so I think those efforts are paying off. Businesses have been very compliant, and just community leaders in each of those areas have been very involved in really helping us bring these numbers down. So I just wanted to highlight that fact that our hardest hit communities are also showing very good improvements. And so all that is left, again, as usual, is our case rate to continue to improve so that we can move to the final of the four metrics or tiers, and that is the yellow one. And so we're so very close. It needs to be less than 2. That equates to about 16 and a half, rounding off to 17 cases on average on a daily basis. But because we expect to continue to get in a favorable adjustment factor still, I would say just also for the rounding off to about 20 cases. If we stay within about 20 cases a day on average, I think we'll hit this number pretty soon because of the adjustment factor, but precisely it's a little bit less than that, around 17. So, we do want and need everyone to still continue to get tested, to continue social distancing, to wear your mask so that we can get to this next tier. If we can go to the next slide, please.
Rigo, if I may, I see Supervisor Ramirez has a question.
Okay.
Thank you very much. Thank you, Mr. Vargas. I want to ask about the ICU bed availability. That includes people who are in ICU who don't have COVID, correct?
Yes. Yeah. This is a total ICU capacity availability. Yes.
Today, could you say how many people more or less are in ICU beds with COVID?
Yeah. So today, I just got the report. It's the same as yesterday. We have one person in the ICU out of 16. Same as yesterday.
16 out of 16 ill
16. Yeah. So this is specific to COVID. We have 16 COVID positive individuals in our hospitals today, same as yesterday. And out of the 16, one of them is in the ICU.
It's amazing. Thank you.
And on that note, if we can go to the next slide, please. Yeah. So as a placeholder, as mentioned before, this is the numbers for yesterday, but I do have preliminary numbers for today. So while we reported 72 new cases yesterday, today it's 52. So clearly, much higher than the 20 or so that I spoke about. But our numbers vary each day, and also it's very important to keep in mind that it's an average, weekly average, and so. There's still opportunity for us to bring these numbers down. And so 52 new cases, and we have a little bit, I believe it's around 2,000 newly tested individuals. So we continue to see good numbers with people tested. Please do continue to get tested. No new deaths, so happy to finally not report new deaths. We do have 1,007 deaths associated with COVID and the virus in our county, though. And that's it for our numbers update for today. Thank you.
Thank you. And having one in the ICU, that is very sad for that individual and the family and all, but we were up over 400 at one point, isn't that right?
Yeah, we had that number in terms of total number of those in the that were hospitalized, and I believe we reached close to 100 that were in the ICU.
It is wonderful to see such a reduction in those numbers. Thank you, Mr. Vargas. Ms. Supervisor Long, go ahead.
Thank you, Madam Chair. Rigo, I just wanted to confirm we have not had any hospitalization for those that had vaccinated and then had COVID. Is that correct?
Well, thank you, Supervisor Long, for that question. I actually we need to get that to make sure that that is the case. I believe that is the case, but I want to make sure, and we have very recent information, so I'll follow up on that.
I appreciate that. I am very sensitive to the fact that we need to do everything we can to get the June 15th just to reopen completely. And if we can do more, that's great. There has been constituents concerned in regards to that, getting COVID after being vaccinated. And so I just wanted to get some information for our community so that they know as well. So I appreciate it. And this is a celebration to have just so low in our county, the health equity, the efforts that our staff and our community have made in our businesses to make sure that that percentage is so low. I just want to say thank you. It's not an easy thing. You've seen the huge numbers that we used to have back in December. And I just want to say thank you to everyone's efforts, because I'm really excited to be at this point where you can tell me how low a percentage we are and how quickly we could reopen based on the state. So thank you.
Thank you, Supervisor Long, for that. If I can make one comment here, reminds me again, I wanted to also acknowledge our public health nurses during National Public Health Week. As you know, our communicable disease nurses have been so fabulous through all of this, even before our first cases, just preparing. We have nurses in various units within public health, in EMS, and those that work with maternal child health. They've been reassigned. Obviously, those that are in the communicable disease, some of our in our California Children's Medical Services as well. So we have usually we have about 85 nurses in our team. The last few months, especially with the surge, we went up to about 125 nurses. So I want to also take this opportunity to thank all our nurses for their fabulous work during this pandemic, pre-pandemic, and I know more to come. They've been very dedicated and providing outstanding service. And on that note, I also want to acknowledge that our mobile team, as your board and our leadership from Mr. Powers and Mr. Zimmerman have acknowledged the great collaborative work of our mobile teams. But I just wanted to put it in context that also it involves various nurses, but various other folks, both reassigned county workers that go out to the fields and these community events. It does take about anywhere from 45 to 60 folks to vaccinate an average of 500 folks in a 4 or 5 hour period. We want to be there, be effective, efficient, but it does take a large operation. Many of them are nurses, many are not, and so it involves the other departments. But from within our own department, it involves various health educators and nutritionists and others from even our women, infant, and children's program. So it's been an all hands on deck, continued approach to this pandemic, and including the mobile vaccination team. So I just wanted to again acknowledge our team and our collaborative approach as a county, always doing what is needed to get things done, and certainly the mobile vaccination effort is along those lines. So thank you again for all your support, board members, and Mr. Powers and Mr. Zimmerman.
Yes, and certainly our whole board is very, very appreciative of our staff. Mr. Powers, back to you.
Thank you, Chair Parks, and thank you, Mr. Vargas. So glad you highlighted public health nurses. When I think of them, I think of their skill sets, their passion, and them being out in the community. They're so trusted, and they're out in the fields, at the businesses, wherever they need to be out in the community, that's where they go, and they love it. Just their spirit is amazing. So, and what a difference they make. And now we can go to our equity efforts, a perfect transition, and I just want to introduce it with and we'll turn it over to Rosa Gonzalez in just a moment if we can go to the next slide. But it wasn't that many months ago when our equity number was very high, and obviously very concerning. But what was important about it was that we were doing a lot of outreach, we were doing a lot of testing, so we knew what the number was. Now we could have made it lower by not testing, but that's not healthy, right? We wanted to go in and find out just exactly what is the extent of the problem in our equity communities, and we saw that there was one. And so I think that outreach effort to really look at the real numbers and to connect with our trusted community partners helped identify the problem and helped the team address it and bring that number down to a point where there's almost no difference between the equity communities and our population as a whole. So with that intro, I'll turn it over to our community liaison, Rosa Gonzalez.
Board of Supervisors, Chair Parks, and CEO Powers, Rosa Gonzalez with the County Executive Office, here to provide you an update on our equity efforts. As you can see on the PowerPoint slide currently, the numbers that we are able to share with you today as far as our farm worker vaccine numbers is a little bit over 24,000 farm worker vaccinations. This would include our mobile team, the 11 county clinics, and also our high capacity vaccine sites that we have. These numbers do not include pharmacy or other vaccination partners such as Clínicas, Ralph's, or Dignity. Also, you can see that the 5,495 number is still reflective of the late March data that we were able to pull. Unfortunately, the reporting tool through the state system is a little difficult. And so what we try to do is at least get some numbers to share with you and the public to show just these efforts. But we would definitely comfortably estimate that this number would be much higher, and hopefully sometime soon we'll be able to really provide a more bigger picture on the number of our farm workers that have been vaccinated countywide. And also, just to add on a little bit of the comments that Mr. Vargas had just commented, it's also, aside from the number of nurses that and the team that goes out to these locations, also the coordinating and the scheduling. That is a huge process. And so also, hats off to the public health team that is connecting with not only our ag industry, but community partners, and now especially reach out with our faith-based organizations and also schools and community partners, and really having to share some of the logistical needs to hold these events, to really make it so that it's easy on those attending and getting vaccinated. So Sara Rivera, Salcedo, and Carmen, thank you very much also for all your efforts with making sure that these are well coordinated in advance, in addition to the logistics of the day of. Our mobile community clinics in our health equity communities, which recently include Durley Park and Oxnard. Santa Paula Community Center has been a regular site. Our Piru Neighborhood Council partners have also been regulars, and also with our Veterans Memorial Building in Fillmore. Currently, we've done just over 8,000 vaccines within these areas, and also this will be expanding as we really branch out more into our community partnerships. And that will be shared in the next slide when we get in just a moment. Also, we have our mobile team vaccinating our homebound seniors at over 1,100 vaccines, and they're also now making these available to the family members at these homes that they visit with our homebound seniors, making it easy, again, thinking of the best way to have our families and our residents vaccinated and maximize that opportunity that we have with them. If I could have the next slide, please. As I mentioned, our community vaccine clinics are expanding our partnerships, and we're really excited. Late yesterday evening, we were able to confirm that we will be having quite a few partnerships out in various parts of the county. We're still working at other parts of the county too, along with our East County partners. Later this week, we should have identified some of these locations and events to start getting those scheduled, and the same within the city of Ventura area. Currently, yesterday, we had an event at Colonia Gym. Today, they're at Garden City Acres Park in Oxnard from 1 to 6. And this past Saturday, our vaccine team was at Mission Produce vaccinating a large number of our farm workers too. Coming up, we will have Parkview Elementary in Port Hueneme on April 30th, E.O. Green Junior High in Oxnard on May 14th. Really excited to have partnership with Our Lady of Guadalupe Church in Santa Paula. That will be on Sunday, shortly after services. So that would allow members of that church after services to be vaccinated. That event will be on May 16th. We also have University Center partnership with Adelante Comunidad Conejo, May 17th, and Our Lady of Guadalupe Church on Oxnard on May 18th. And Revive Church, along with Nyland Promise, will be partnering to hold a vaccine event on June 12th. All of these events, when we advertise and coordinate this to inform the community, these events in their area, we make sure we note what vaccine is being provided, the hours, the location. We work with community partners along, in addition with our PIOs, if we need to advertise these on social media, but we make sure that we really get this information out and inform those residents in advance so that they could also prepare and know that this event is happening in their area. So we're really excited about that, and we'll be reporting some more information on that as we get closer to these events and as they start to happen. We are also excited to share an upcoming event that our Behavioral Health Logrando Bienestar team is hosting this week. They have been regularly holding various community events, and this one is a Pregúntale al Experto, Ask the Expert event, which they additionally had the Pregúntale al Doctor, Ask the Doctor, two past events with Dr. Andrade and Dr. Serrano, all to really address COVID concerns, questions, and engage with the community. The event that they're having this Thursday will be with marriage and family therapist Gabriela Aguila, who works with, and this will be a focus on youth and children. And this will be on supporting parents on how to support kids during COVID, going back to school, stress, anxiety, fear, just ways of explaining situations to them, and also answer parents' questions on how to support their children and also just the family as a whole. The Logrando Bienestar team has been working with various schools and parent groups and CBOs. And additionally, they share this information, and they regularly see anywhere from 30 to 60 parents attend this. And these events are held in Spanish and in Mixteco. They've also been working with our farm worker resource program to truly engage also our farm working community. In addition to this event that they're holding this Thursday at 6 p.m., and you could see there on the screen that we have the flyer along with the Zoom registration link. They've also held 22 other COVID-19 information workshops and also regarding, mental health services. This, along with the various parent groups from a number of schools, which include Oxnard School District, Port Hueneme, El Rio School District, Ventura Unified, Santa Paula School District, and currently they're looking at expanding partnerships with Fillmore and Moore Park school districts too. In addition to all of these events that we're having in the community vaccines, but also just these events, it's going to be really great once we have this partnership going with all the community organizations with the Ventura County Community Foundation's Complete Reach Committee. We're holding our meeting this week on the 28th. We will be discussing a variety of ways for engaging the community with our partners. One would be, providing an update on COVID-19 and vaccinations, dispelling myths, also where to access information and materials and ways for the county, but to support them, but also just the committee as a whole, how we can support our CBOs. So that will be this week, and hopefully by our next meeting, we'll be able to share some more information about that and just the outcomes of how we're going to be moving forward with this effort to really connect with the community and some more accessing vaccines, and especially with the information as that even Dr. Levin shared about the J&J vaccine with some of the vaccine hesitancy, clarifying some of this. This is going to be great with our partners, because as we try some of our efforts, we know the most effective way is really connecting with our community partners and those that within these communities are recognized by their residents. We also have a picture on the top right there of one of the recent videos with the South Winds Neighborhood Area Council, along with some of their partners, including the UFW Foundation. They did a video addressing the city of Oxnard and just the area to try to really encourage people to get vaccines and the importance of vaccines and supporting the community by being vaccinated. And this goes to our PIO team, which includes Ashley Bautista. Gabriel Ramirez has been helping them too. We have Marlene Caniff and also Sonia Croth, who've been helping with a variety of information flyers and videos and connecting and communicating with our community partners on meetings and making this happen, listening to what the community's needs are so that we can make sure that the messaging that's going out is really meeting the needs of the community. And also, we're excited to also have now Jackie Nunez, who joined the team. So we're really excited to have her on board, and looking forward to also having her help with some of these efforts. And finally, we also have, again, which is a great state program, is the Housing for the Harvest program with the UFW Foundation that the county has partnered up a few weeks ago when your board approved that participation in that program. And that is a great support. Again, we continue supporting our farm workers along with our farm worker resource program, who has continued to also create information videos and outreach also for our farm working community, but also partnering within this program to really help support and have a complete team that's really engaging and supporting our farm workers and their needs. And with that, I'm happy to answer any questions.
Great presentation. It is just really heartening to see such good penetration out into these communities. And thank you for your work and staff's. It was great to witness that this weekend, just how grateful the community is to be able to have easy access. Supervisor Long, please go ahead.
Thank you, Chair. I just wanted to say thank you. These efforts are just a follow-up for all the efforts that have been going on, especially in Santa Clara Valley and throughout the county, to ensure that our communities know that there is healthcare available and that we are reaching out to educate and to make sure that our community members are getting what they need. And so appreciate the reaching out and thinking out of the box to go to Our Lady of Guadalupe Church. I mean, it just, like our Blue Ribbon Committee, this just is one more thing in which we can outreach to our community for either our healthcare, behavioral health, vaccinations, public health, food. It just goes right through the same mantra for our county as to taking care of those that need it. And really just wanted to say thank you and appreciate everyone's efforts on it. Like Rigo said, it's not just one person that it takes to do a pop-up, 40, 60 people to do these events, and just want to say thank you so much. Appreciate it.
Thank you so much. If I could also want to ask Rosa to speak to the housing assistance.
Right. So on your agenda for today, also item 32, you will be considering the housing assistance, which would really provide additional support for our farm worker housing assistance program, which was very successful in the first round, but we're also in the second round. But this will just, again, continue supporting our farm workers that we continue hearing day in, day out that they're still impacted from just COVID and some of the ways that they've been greatly appreciative and recognize the county's efforts in supporting them, and also a lot of them seeing just how wonderful Ventura County as a whole has been supporting their farm workers. One of the goals also with the farm worker resource program was, aside from supporting our farm workers, was also enticing that farm workers to see that this is a place for them to work, an ideal location for them to look and work at. And we feel that a lot of our farm workers are recognizing how unique Ventura County is supporting, and also finding that they have these resources available, making them comfortable to stay and settle along with their families here in Ventura County.
Thank you, Rosa. All right. Thank you for that, Rosa. Also, just one note down at the bottom, it says VCCF Complete Reach Committee. That does sound familiar. It used to be the Complete Count Committee, and that's really building off the strength of that Complete Count Committee that worked with over 200 community groups for the great census outreach that was done. So it's just nice to be able to plug back into that group with Vanessa Bechtel and the team over there at VCCF and everybody. So, all right, thank you. Next up, we'll hear from Melissa Livingston on the rental assistance program. Thank you.
Good morning, Chair Parks, members of the board, Mr. Powers. For the record, Melissa Livingston, Director of the Human Service Agency. Well, this week in reporting out, we've seen a slight uptick in the number of applicants for the state's emergency rental assistance program. We're up to just over 2,200 applicants that have registered for the program, just short of requesting about 22 million of that assistance. And just for reference, Ventura County had 50 million that was allocated to Ventura County broadly, as well as the city of Ventura. And so we're about 6 weeks into the application registration process, and have expended or obligated about 43% of that $50 million. We continue to cast a very broad net because we believe there's a greater need, and we'd like to fully expend those monies that are available to meet the needs of those tenants and landlords who have experienced a financial hardship during these times. So we continue to do outreach. We've engaged a number of additional community partners that are embedded in the Simi, Moore Park, Santa Paula, Piru, Fillmore, Oxnard, and Ventura area to continue to get the word out about the program and the opportunity to apply. We also continue to encourage our landlord associations to apply on behalf of their tenants because of the value of being able to be reimbursed up to 80%. And for clarity for the public, this is a grant. It is not a loan. It does not have to be paid back, and it certainly will go directly to relieving any arrearages that you might have for your rental assistance. So in closing, we continue to ask people to go out and register and apply at housingiskey.com. If they need assistance or have questions, they may call the call center helpline at 833-430-2122. It is available 7 days a week from 7 a.m. to 7 p.m. And I'm happy to answer any questions that you may have.
Not seeing any questions. Thank you, Melissa.
Actually,
Oh,
Melissa, I'm
Mhm.
eager to hear. So we're about halfway through on the 50 million that's available. Do we know if it's more tenants that are in the applications versus the landlords? Want to make sure that that money is sent out into our community. So I'm hopeful to get that information however we can as a county, the supervisors help to spread this information.
Thank you, Supervisor Long. I don't have that data available. We have limited data available. We're working to get more access to that data with the state, but we can certainly follow up on that and see if we can report back at the next meeting what that ratio of application is between tenant and landlords.
And then also, is this only residential or is it also commercial?
This is just residential for clarity, yes.
Appreciate the clarity on that. I really do appreciate it. And sending information, I would greatly appreciate it. I want to make sure we get all that funding out into the community. So thank you.
We have heard some wonderful stories too about landlords who have been very kind to their tenants over this time when they have lost their jobs, for example, and also good that they are being recognized.
Thank you, Chair Parks and Supervisors. Yeah, thank you, Melissa. Yes, on this issue of commercial landlords, one thing I'd like to highlight is that the business assistance grants are also helpful to commercial landlords. Very often we hear our small businesses, one of the things that they have is, past due rent. And so, to keep things going, a good bit of their funding goes to pay their rent. And you're right, we have heard wonderful stories of the landlords helping out businesses here. Just big hearts caring for our small business community. But these business programs, the one that your board has already approved and the ones that you will consider shortly, I think really help with those landlords as well. So on that note, maybe we'll turn it over to Mr. Stamper to talk about our business assistance program.
Thank you, Chair Parks, board members, CEO Powers, Paul Stamper with the County Executive Office. It's my pleasure to give you an update on our business assistance. So our current grant program, we've received 2,271 applications submitted. So we're going through the process of reviewing all of those now. As of Friday of last week, just over 500 of those were approved. And so they're kind of in the end stages of the process. We've sent out recipient agreements, and as those come back in, we'll be moving them through the payment process with, depending on the number of those agreements we receive back and the final steps, we will get payments going out starting this Friday and then the following days and weeks to come. So we are still continuing our efforts to move applicants into compliance, which means that, in many instances, despite efforts to clearly publicize what's required and to have the application set up as easy as possible, there's still instances where the wrong document was uploaded or some information was missing. And we just, we want to do everything we can to help these people get the information in that's needed so that we can get them those grants and help them out. So those applicants that are still in the process, they still have access to log in and view the status of their application. We are communicating with them through that in the cases that I just described. And if they want to know status about payment as well, they can check that through the portal, or they can call the call center, which is still active and taking calls at 888-405-1004. And as CEO Powers had mentioned, we will be speaking to your board about a proposal for an additional grant program coming up later today. I did also want to reference a couple of programs that should be on all of our businesses' radar, and we're getting the word out on these. So the Shuttered Venues Grant Program, important to note that the original application period or window had closed, and then that was just reopened. And so that is available for new applications now, and that is at sba.org. Additionally, the Restaurant Revitalization Fund, which is also being managed through the SBA. More information has been published. You can go there to find it at sba.gov/restaurants. There are multiple resources to help people get ready to apply. They've not published an exact date yet, but we're anticipating it could be within the next week or two that they will open for applications. They're actually doing some testing on that application process right now with some previous recipients of PPP before they open it up more broadly. And then on that program in particular, there's also a webinar today at 11:30 and again tomorrow to help answer questions, and you can find that out through their website, the details. And then lastly, the California Small Business Relief Grant Program. Their last round of applications is beginning or opening tomorrow. So it's not too late for any businesses that have not submitted yet. And again, those that had previously submitted an application, those will be considered in their selection process as they move forward. And with that, I'm happy to take any questions from the board.
Thank you, Paul. I'll pause there in case there's any questions.
Paul, I just wanted to say thank you. As our last board meeting, I was asking to make sure that we're really going through those applications that maybe they have a hiccup, and appreciate you addressing that today and making sure that we were doing every effort to get people the grants that they need, and that we're trying to, I just appreciate the efforts. Thank you.
Thank you.
Yes, thank you, Supervisor Long. It is a very labor-intensive effort, very personal, one business at a time, one business owner at a time, helping them get through. You see a lot of numbers, and we throw a lot of numbers and slides and all that good stuff, but that does not do justice to the work that's happening every day by a large team of folks, and with Paul leading it. So, very good. Okay, with that, we'll go to our last slide, and this is just our quick wrap up, as you know, and we're responding on multiple fronts with vaccine and testing resources and rental and business assistance, and focusing on our vulnerable population. And that's our report for today. Happy to answer any questions. Thank you.
Thank you. And I feel like we need to have an agenda item after this, so just say thank you, because as you've heard from supervisors, how much we are appreciative of the hard work of our staff, and thinking about how much they have morphed into these new positions that they didn't have any idea they would be doing when they came on board. So very appreciative of them. And I really think that we are fortunate in Ventura County. The vaccine rollout has been very good. And we look at the state of California and how we are, I think, the best in the nation, if not the top 2 states in the nation for the low COVID rates. And for that, we are all very grateful. And we can, a lot of that has to do with the availability, so that the public who wants to can join and get their vaccines, and it's all showing, and I'm really glad to see that in the numbers. So with that, I believe, is this a receive and file?
Yes.
Okay.
Supervisor Parks, we have 2 public comments to video.
Right. Okay. So let's go ahead and go to our public comments on this item then. Shall we start with, I've got Jill Smith. Are you online there and able to participate?
How much time would you like to give them?
Let's go ahead with the 3 minutes that is on the screen.
Yeah, good morning, everyone. This is Jill Smith here, and I have been listening to you guys. I've actually been listening to the board meetings for a while now. What I'm hearing is, this overwhelming pushing for vaccines. Last week, I believe Ms. Ramirez on the board also made a comment to something to the effect of listening to the negative exposures of vaccines is to let other people make health choices for you. By the same token, as hard as you guys are pushing for vaccines for people, are you not doing the same? Are you not also making the health choices for people? I just want to remind you that in the Ventura Star newspaper just this past Sunday, on April 25th, there's an article about Dr. Stephen Rogers tested positive after second Pfizer shot. And I'll quote here: while data on breakthrough infections in the county are incomplete, they do show at least 10 people tested positive for the virus after being fully vaccinated. About 6,000 of the more than 90 million Americans who received their full vaccinations have tested positive for the virus, according to the federal data released earlier this month. At least 396 of them have been hospitalized, and at least 74 have died. These data is so important for the public to be aware of, and yet not a single one of you has pointed out to the public. As public officials elected into the office, your job is not to tell people how to live. Your job is to lay out all the facts and data available, pros and cons, good news, bad news, for people to make up their own mind, for people to make their own informed decisions, how to live their lives. I would sure hope you guys have read through this. And also, with the information flowing these days, it's not hard to find information recommended and put out there by other professions, by other doctors. These are all scientists. For instance, with Dr. Judy Mikovits in her interview on December 11th last year, all current COVID vaccines are experimental through 2024. What that means is that everyone taking these vaccines are literally lab rats. They make up their mind to do that, and that's fine. I'm not anti-vaccine. What I'm saying is that you guys should put out all the numbers, all the data is available for people to make up their own mind. And Dr. Mikovits also recommended against taking any COVID vaccine because all liabilities for these vaccine developers, manufacturers have been removed since 1986. And that includes all healthcare.
Thank you for that. The vaccines are 95% effective, so that's why we're seeing that 5% roughly. So let's go on with our next speaker. I have a Dr. Witten, and you are on video. Could you please go forward? Go ahead, Dr. Witten.
Oh, can you hear me?
Yes, we can hear you.
Okay. The 95% effective needs to be addressed. That's in only changing people from moderate symptoms to mild symptoms. It has nothing to do with preventing infection. There needs to be a robust discussion. All you're getting is a discussion from one side, from pharmaceutical reps, from people who have, a dog in the fight. The only story anyone listened to is that there's a deadly virus. Anyone could have it and spread it even without symptoms. We need to wear a mask to protect the elderly. There's no effective treatment. Vaccines are our only hope for herd immunity, and they're safe and effective. The only problem is that every statement I just made is provably false. Epidemiology 101 teaches that when there's an outbreak, in avoiding exposure to the young and healthy, you shift the burden onto the immunocompromised. So by isolating the healthy, you delay herd immunity and make things worse for the elderly. This is the opposite of the story that has been told. By only listening to one narrative, a crisis that could have been over in a few weeks turned into a nightmare. SARS ended with no major loss of life, no mass lockdowns, school closures, mutant variants, or vaccine. And now here we are a year later, still wearing masks, suffocating our children, when every study shows exactly what Dr. Levin told you in his report last year. Masks don't stop viruses. The holes in a mask are 1,000 times wider than a virus. And now you're making the same mistake with this genetic experiment they call a vaccine. They only call it a vaccine so that it won't have liability. There's no liability protection for a genetic experiment. Okay, this has already killed thousands. That's on the government's reporting system, VAERS. The shot doesn't stop transmission. Linda, it won't stop deep vein thrombosis because it doesn't prevent COVID infection. There's no long-term safety studies and pharma has no liability. Already thousands who have gotten the shot have gotten COVID. 12,000 in Israel has reported. Return to normal now and make time for a real discussion with doctors like me and Judy Mikovits that aren't paid pharma reps.
Thank you for your testimony. Our next speaker that we have is Judy Bruce. Would you like to go forward?
Chair Parks, that's a read email that we're going to read for you.
Okay, that's right.
Good morning, Chair Parks, Board of Supervisors, and CEO Powers. This email comes from Lorena Saruatari, and it says, on Wednesday, April 21st, Mr. Levin was interviewed by a local radio station where he moaned at the fact that many people in Ventura County are not taking the coronavirus injection. He blamed it on the misinformation circulating on social media. He even ventured to say that the misinformation is nothing more than a Russian conspiracy. Then he urged people to take the injection by assuring that it is safe. The only misinformation circulating from the lying news media, Fauci, Bill Gates, and the government, the corona COVID-19 vaccine is not a vaccine. It is an injection that contains the spike protein part of a SARS-CoV-2 virus. The protein strips the erythrocytes, blood red cells of the hemoglobin. The hemoglobin carries oxygen from the lungs to the rest of the body. The injection clinically poisons the blood. The spike proteins attaches to the receptors of the hearts and kidneys, liver, brain, intestines, sperms, etc., eventually causing organ failure and or infertility or death. The spike protein is a man-made weapon. The vaccinated people are transmitters of the spike protein. People that are exposed to those injected with a corona COVID experimental shot are reporting severe bleeding, blood clots, and longer periods of infections. Therefore, the corona COVID shot is nothing more than a bioweapon to depopulate the world. This is not a Russian conspiracy taken from social media, but logical conjectures done with critical thinking. Stop the injection. Lorena Zaratu, Camarillo resident. And the next email comes from Judy Bruce. And that says, the King virus has no clothes. Shows a link to an article. And then it says, no one has an isolated specimen of the COVID-19 virus. No one has isolated the COVID-19 virus. Therefore, no one has proved that it exists. Regarding the purpose is scientifically debunked, but still abused PCR tests. The CDC wrote the detection of the viral NRA cannot demonstrate the presence of infectious virus or that 2019-nCoV is a causative agent of clinical symptoms. And using this test, the CDC and every public health agency in the world are counting COVID cases and deaths. The government has instituted lockdowns and economic devastation using those case and death numbers as justification. Most people have been fooled by fear propaganda. With worldwide government controlled 24/7 fear porn by mass media, most people have come to believe that there is indeed life-threatening virus that makes people sick much faster than more severely than seasonal flu. This carefully planned pandemic hoax is a monumental fraud. Science is not assumptions. Lastly, how is COVID-19 vaccine possible for a virus not yet quantifiable? It's not. So if this vaccine, why are you manipulating the citizens of Ventura County to inject a dangerous experimental biotech pathogen into their bodies? And that again is from Judy Bruce, Simi Valley residents. Thank you.
Thank you. And I know that some people have different logical thought processes than others, but it is good to know that we have a scientific community of doctors who know more than we do on this. And certainly you look at countries like India, 350,000 cases in one day and a couple 100,000 who have died. You just realize that when they only have a 10% vaccine rate there, how much different it is here in the United States, where we have reach such high numbers of people who have been vaccinated, and as a result, the less cases that we have and the less deaths. So I just have to say the proof is in the pudding on that one, and we definitely need to do all we can to encourage people to not only take care of themselves by getting vaccinated, but also their community. And I like this one quote about to get immunity for your community. So it's not only for you, it's for others. I appreciate the comments that we have. And Supervisor Ramirez.
Back when I was in Oxnard City Council, we didn't address or comment on public comment, except very briefly. So I'd like to just make a brief statement. I was a child when the polio epidemic started, and I remember how terrified my parents of 7 children were of polio. But suddenly a vaccine appeared, and we were able to get protected from it, saving probably millions of children and adults from that horrible disease, which is still out there in the world. I know some countries still have to face outbreaks of polio. Without the vaccine, it could really be just the cause of so much suffering. So while I do appreciate people's logical thinking about things, it's good to be critical and constructive. I'm really glad we've been able to get that vaccine developed and get into people's arms and save suffering and death for so many people. Thank you.
Thank you. And everyone certainly has their opinions, and I just want to make sure that we do what we can for the public's health and safety. With that, this concludes our item on our COVID presentation. And if we'd like to go ahead and take a receive and file vote on this one. Do we have? That's a motion from Supervisor Long.
Yes, and also I just want to close with just saying thank you again to staff. Our county is here to provide services for our community, and people have the right to either take that assistance or not. I've heard some comments today and from the public and from supervisors and so forth. And for vaccines as a choice, we have a choice on everything that we do, and that's important that we really remind people of that. This is not a mandate, and vaccines, whether we get them or not, has been a long time discussion on many items. And so I appreciate the public comments in regards to getting all the information. And you're right, if you Google any of our vaccines, you can hear pros and cons to all of it. And so I want to make sure that our community knows that we are aware of that. The state talks about it, federal. And if you go to any of our vaccine sites, all that information is there as well. And I just appreciate the conversation. This is not an easy conversation dealing with COVID. The last year plus has not been, you don't open up a book and read the directions on how to do this. People change every day. And so don't think that this job is an easy task for anyone, whether you're a person just looking to get the vaccine or not get the vaccine, or go to work or not go to work. These are tough community discussions that we have been going through. And I really appreciate the voices of all. We agree, we disagree, but in the end, I just want to make sure people know we're doing the best we can for our community, and really appreciate everyone's effort, because our community is working together so that we can get out of the pandemic. Our numbers are showing it. And I just want to say thank you to all the doctors, public safety, critical workers, our nurses. I mean, there's just so many people that come to this. And I just want to say thank you. Not one idea is right. We come together as a group to do this. And I've appreciated working with everyone. We don't always agree, but I think that this is an important factor to make sure we talk about. So thank you. And yes, this is a motion to receive and file. Thank you.
Huber, second the motion.
Okay, we do have a motion and a second, and I just comment on Supervisor Long that there is a right and a wrong in many things in terms of what's true and what's not true. And I just don't want to leave a message out there that our county isn't supportive of people getting vaccinated. Motion is second. Could we please go ahead and have the vote?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes. And with that, I would like to ask that we go over to, as requested, I believe 32. Is that right, Mr. Powers?
Great. Yes, thank you, Chair Parks. That would be great.
So with item 32, this is regarding the grants that we had mentioned both to businesses and farm workers. And I'll turn it over to Mr. Stamper and Ms. Livingston.
Thank you so much, Chair Parks, Board Member, CEO Powers, Paul Stamper with the CEO's office. And today, Melissa Livingston and I are going to present a proposal to you regarding a third business assistance grant program, as well as farm worker household assistance program, which Melissa Livingston will speak to. I'd like to cover a few points before handing it off here. So we're asking on the business assistance grant program side for your conceptual approval at this point, that we would come back with more detailed explicit plans for your approval and adoption of the related financial transactions. But here's the outline of what we're looking at: is providing additional $5,000 grants that would go to recipients of both the first and the second business assistance grant programs, which could be up to a little over 6,000 recipients. Again, we say up to because we're still in the process of reviewing our applications now, so we don't know yet exactly how many recipients there will be, but it has the potential of representing $30.7 million in additional assistance. And that would be broken down by continuing to use general fund dollars for the recipients in our second business grant program, because the program was structured in a way that would allow for that, as opposed to the first grant program, which was using the federal dollars from the CRF program. And I'd just like to add that I know that the impact to the general fund is greatly offset by expenses that are typically paid through the general fund that have been able to be funded through the CRF. So I'm sure our CIO can help answer any questions related to that. But I know that that's part of the thought process that went into this recommendation. And again, these programs can be targeted towards these recipients, which your board has already prioritized: minority-owned businesses, women-owned, veteran-owned, disadvantaged communities, and applicants that have employees, which represent jobs and people in our community. So if I could have the next slide, please. I do want to revisit, while that slide's coming up, that remind the board about the previous grant program. So in the first grant program, again, we did $5,000 grants, and there were a total of 3,868 recipients, which was a little over $19 million to those recipients. And it clearly was successful in reaching some of the hardest hit industries like gyms, personal care, child care, and so forth. And you can see here that your board also prioritized small businesses, and the vast majority, 77% of those recipients were in the range of up to $500,000 in annual revenue. And incidentally, the applicants for the current grant program, the numbers are very similar to the chart that you see there. So we're really targeting those smaller businesses, and you can see that we are reaching minority and women-owned businesses as well. And if I could have the next slide, please. So for our second grant program that we're conducting now, I do want to emphasize that, again, we don't have final numbers for recipients. These are applicant numbers, but over 2,000, which has the potential of up to 11.35 million in assistance. And these priority groups you can see here amongst the applicants that, again, applicants demonstrated 45% are women-owned, 45% minority-owned, 46% have employees, 4% veteran-owned, and then again, those categories overlap, and we were very pleased to see when we did the calculation that of all the applications, 87% had one or more of those priority categories associated with their business. And then you can see kind of a listing of the industry types of the applications that we received this round. So I am happy to answer questions, but I think first I'd like to hand off to Melissa Livingston to give you an update on the farm worker household portion, and then we'd be pleased to answer questions.
Thank you. Thank you, Paul. Good morning again, Chair Parks, members of the board, Mr. Powers. For the record, Melissa Livingston, Director of the Human Service Agency. Back in September of last year, your board approved the program design for our first farm worker household assistance program to be administered by the Human Service Agency. And then following in October of last year, you approved the actual contribution of CARES funding to support that, which was a partnership between ag business, private donors that stepped up to wanting to meet the needs of farm workers impacted by COVID, and put up $400,000 of generous donor dollars. In turn, the county leveraged CARES funding, recognizing that there would be probably a large number of applicants for that program. The program recognized in response that COVID had most definitely impacted our farm worker communities disproportionately, creating hardships. And there was lack of access to other types of federal and state stimulus funds that were being distributed throughout the general community. So the program was designed to meet the needs of farm workers, to ensure that they were first residents, was part of the program design, that they could prove that they had been impacted by COVID in some manner. And then the program prioritized the lowest, very low income threshold of 50% below AMI, average median income. The program is very successful. Over almost 3,500 farm worker households applied and were eligible for the program, resulting in not quite 3.5 million in distribution with $1,000 grants. So in recognition that a protracted pandemic event continues to impact our farm worker community and households, impacting hardships and challenges with maintaining employment, housing, childcare, transportation, food security, and other medical expenses. The recommendation before your board today is to provide that same group of individuals an additional $1,000 grant to support their needs. So as Paul, I am available to answer any questions you might have.
All right. Do any members of the Board of Supervisors have any questions, or would they like to make a motion?
Supervisor, Madam Chair, I do have a question. So the process to get the additional funding out, is it very easy for our members to get it? Is it just simply, we're still continuing to use this fund, or yes, our business is still in operation? I just wanted clarification on that.
Thank you, Supervisor Long. I could speak to that, yes. And in fact, that was one of our serious considerations for this approach, is that we've already vetted all of these businesses and we can expedite this process with minimal impact to them. There will be a step where there'll be what we call a recipient agreement, where we're we're confirming some things. You're still in business, still impacted in ability to use these funds on allowable expenses, et cetera. But that process can be much more expedited with this group of recipients.
Thank you. And then also with that, how quickly can we get this out? Are we talking the check will be in their account in 2 weeks, in 5 weeks? What's the deadline or time frame?
Thank you, Supervisor. I'd beg your allowance for us to have the discussions we need to have and bring that back to you. But I can assure you that we all recognize that speed is important, and particularly now, all these businesses are starting to reopen, right? And having this money on hand to help them with the costs associated with that is ideal. And so the faster we can get this out there, the better.
I just greatly appreciate that. I know the CEO's office is probably tired of me asking what else can we do for businesses and so forth when we're not in our board meetings. So I greatly appreciate it. I would like it because it sets expectations as to how quickly we can get it, and I appreciate that. Thank you.
Supervisor Rivera and then Supervisor Ramirez.
And then Bob Huber. I want to make
okay, you too.
Okay. Thank you, Madam Chair. I just want to say that I wholeheartedly endorse this. I think, unfortunately, we have yet to see many of the long-term impacts of COVID. There's obviously going to be a need moving forward. So I really appreciate staff kind of keeping this at the forefront of their priorities and continuing to think about ways that we can still support our local business community. And I would move staff recommendation.
Thank you, Supervisor Rivera. We have a motion. Supervisor Ramirez and then Supervisor Huber.
Well, I'll second that, and I'll try to beat Supervisor Huber to the punch. He's usually ahead of me. I agree with our two supervisors who've spoken about this, and I just want to thank the county for really trying to help our businesses that have been struggling so much with this pandemic. I just want to encourage also people to go out and support your local businesses. No offense to anybody who likes to shop online, but you can't eat online. So support our local businesses. They've really been struggling and have been very heroic. So thank you very much. Glad to say.
Thank you. And Supervisor Huber.
Yes, thank you very much. I want to applaud the County Executive Office team for their continued effort to assist businesses that have been affected by our community response to the COVID-19 pandemic. This third round will result in doubling the assistance to those who have already asked for and qualified for help. Outstanding. It will bring the total to as much as $60 million to affected businesses. Thank you very much.
Thank you, Supervisor Huber. And then also, I just wanted to echo, Supervisor Levere pointed out about the long-term impacts of COVID. And oftentimes we think about that as health impacts, but it is also impacts to these small businesses in particular. So it is wonderful that there are the funds available to do this, and certainly support the motion. So with that, could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you.
If I may, Chair Parks.
Please.
Thank you, and thank you, Chair Parks and board members, for your support. We brought this quickly to your board, but as you know, we've been working on this for quite a while, watching our budget, and because of your board support, we were careful not to use too much of the CARES funding for our ongoing operations, and we've been kind of setting it aside, stocking it away, frankly, for a moment like this. And with the outreach that's happened to get these businesses in need, to identify them, that's what really helps us leverage all that capacity that we built to get this money right back to where it's needed. Our small businesses are the ones that run our economy. It's the vast majority of our local economy, and this is really going to help in a personal way. There's a lot of really small businesses that need this just to pay their rent. As I said, that will help with the commercial landlords as well. And then I want to thank K-Man and Scott Powers and Brian and many of our analyst team, Tina, and who have continued to look at it and examine the complex funding streams that we get and how we can utilize them to help bring us to this day here. As well. And then the VCCF and Melissa on the Farmer Career Assistance Program and the city of Oxnard and other cities who've helped us with the outreach on that, so that, again, we've been able to identify where these funds, these precious funds, can have the greatest impact for those in need in our community. Thank you so much.
Absolutely. And then also Scott Powers and his team and doing that deep dive into the finances and seeing where we can use, for example, public safety grants to be able to, instead of general fund funds, so that opens up more funds available for these kind of programs, and just realize how much back of the room kind of things are happening to get us to this point today. So kudos, and it is always a pleasure to be able to support both programs, certainly here as well as so many others in our community as a result of state and federal funds too. So we do have the motion and the second, and did we get the roll call on this?
Yes, we did.
Good. Let us move on, and congratulations everyone, and we'll love to see those funds getting out into our community. Let's go now to our first, we have a time certain at 10:30, and this is something that I'll turn over to Mr. Powers to
Thank you, Chair Parks. Yes, and board members and community members, and really at the request of Chair Parks, we have worked with our sheriff and district attorney's office, as well as our diversity, equity, and inclusion officer to develop a presentation on the occurrence of hate crimes within our communities and the resources available and other strategies to combat or prevent these events from happening in our community. And really appreciate our sheriff and DA, who, as soon as we asked, they said, great, let's do it. They jumped right on board. And of course, with the coordination of our still relatively new diversity, equity, and inclusion officer, Penn Zampania. So with that, I will turn it over to Sheriff Ayub. Thank you.
Good morning, Sheriff Ayub. We've got you on now. If you can, great, unmute.
I'm sorry, my computer has a gremlin apparently.
Nice to see you.
Nice to see you as well. Good morning, Chair Parks, members of the board, Mr. Powers, county staff, members of the public. Pleasure to be here with you this morning to discuss hate crimes. We've seen over the news reports various incidents of hate-related incidents around the country, and even right here in Southern California. And a lot of questions have been generated about, hey, what is going on in Ventura County? Do we have hate crimes? What do they look like? How often do they occur? And what exactly is a hate crime? So I'm pleased to be here with the district attorney and our diversity and inclusion officer to talk about those things. And I will speak to what exactly is a hate crime, and what are we seeing here in the sheriff's jurisdiction in Ventura County. Of course, the sheriff polices 5 cities and the unincorporated areas of the county, and runs the jails. And so we have a population of about 470,000 that we service. So I wanted to get into what a definition of a hate crime is, and it's defined in Penal Code Section 422.6. And it is any person who by force or threat of force willfully injures, intimidates, interferes with, oppresses, or threatens another person, or any person who knowingly defaces, damages, or destroys the real or personal property of any other person because of one or more of the actual or perceived characteristics of the victims. And that would be a characteristic of disability, of gender, nationality, race or ethnicity, religion, sexual orientation, or association with a person or group with one or more of these actual or perceived characteristics. It's important to note what is not a hate crime would be classified as a hate incident. And that would be some type of damaging speech related to any one of those categories that we just spoke about, that does not rise to the level of a threat of violence, an infliction of violence, or the damage of property. There are a few other examples of hate-related incidents. Penal Code Section 11411, California Penal Code, is a wobbler, which means it could be punished as a felony or a misdemeanor. That addresses an individual who terrorizes someone else with a swastika, a burning cross, a hanging noose, or desecration of a religious symbol on private property. There's also a section related to vandalism in the penal code that's specific to places of worship. And of course, the federal government has federal hate crimes in place as well. Next slide, please. In Ventura County, over the last 5 years, we've had 23 reported incidents of hate crimes. That does not include hate incidents that occur. Those are documented in a different way, but in terms of criminal contact, 23 such incidents. And for perspective, from 2016 through 2019 in California, there were more than 4,100 hate crime incidents reported. So Ventura County is a very small number compared to the rest of our state. And for a larger perspective, of course, that same time period, 27,730 reported hate crimes in the United States. Next slide, please. So as a bit of a breakdown for hate crimes in Ventura County, the graph on the left shows the cities where those hate crimes have been reported. Unincorporated areas would include the county jail system, even though those are in incorporated cities. But the types of hate crimes we've experienced in the sheriff's jurisdiction, of those 23, 7 were acts of vandalism. That's the destruction of property. 6 of the 23 were crimes of battery, and that's the infliction of some type of force or violence on the person or of another. 4 incidents occurred in our county jail system. Those were typically fights that had a hate-related component. 2 of the 23 incidents were assaults. An assault is an incomplete battery. So that's the attempt to inflict some type of force or violence upon a person. And then 4 of the 23 incidents were solely verbal threats. The sheriff does have a hate crimes policy that is crafted specifically to give guidance and direction on the investigation and follow-up and prevention of hate crimes in the community. It's Sheriff's Policy number 323, and it's posted publicly on the sheriff's website at venturasheriff.org. It also addresses the Department of Justice for the state of California's hate crime response protocol. In the event of a large-scale incident, something that would require more resources, the Department of Justice has pledged resources to help combat hate-related crimes locally. Department of Justice also produces a brochure for the public. It's available on their website at the Office of Attorney General, and it addresses hate-related crimes and prevention methods in 9 different languages. So that's a great resource that our deputies hand out to the public and is available for anyone interested in getting a little bit more information. So now I'd like to turn the microphone over to our District Attorney, Eric Nasarenko.
Sheriff Ayub, thank you very much. Chair Parks, members of the Board of Supervisors, Chief Executive Officer Mike Powers, and members of the public. It's a pleasure to be before you this morning. And Chair Parks, I want to thank you and your board for raising awareness, education around this important topic. What I'd like to do is just provide you with a roadmap. I'd like to begin by talking about victim services, assistance, and resources for hate crime victims. Thereafter, I'd like to give you an overview of what we are seeing here in Ventura County in terms of hate crime prosecutions during the pandemic. That is specifically hate crime prosecution for year 2020, as well as for the first quarter of 2021. And then finally, I'd like to share with you a case example of a successful hate crime prosecution. I am proud to announce that earlier this month, we made hate crime victims eligible for Family Justice Center services, assistance, and resources. In the past, the Family Justice Center had been assisting victims of very sensitive, vulnerable crimes, such as sex crimes, domestic violence, child abuse, elder abuse, as well as human trafficking. However, given the very sensitive nature of hate crimes, the fact that they too involve very vulnerable victims, and just the need to heighten awareness around these crimes, we have made hate crime victims eligible for Family Justice Center services, which means they have the ability and the access to the Family Justice Center and the 15 providers in it. And this board has been so instrumental in both supporting and funding the Family Justice Center. And I'm pleased to let you know that when a hate crime victim needs assistance, they can go to the Family Justice Center and they can receive, for example, reimbursement for medical costs and hospital bills. They can seek a restraining order. They also have access to legal aid in the form of civil legal resources. They can also receive assistance in terms of how to navigate the court process. What is an arraignment? What is a sentencing? When will their case be heard in court? And they'll be given a victim advocate to accompany them for all court proceedings and stages of the criminal process. So I'm very proud to announce that that is now available to our hate crime victims. We also have in the Office of the District Attorney a dedicated specialized hate crime prosecutor. He's a senior deputy district attorney by the name of John Poor, and he is overseen by my new chief deputy, Paul Nunez. Next slide, please. To give you a sense of 2020, that is hate crime prosecution during the pandemic. Countywide, we had 4 cases submitted to the Office of District Attorney, 3 of which were filed as hate crimes. And you see on the right-hand side of the screen the demographic characteristics of both the defendant, that is the alleged perpetrator, as well as the victim. So in these 3 cases, Caucasian defendant, Latinx victim, Caucasian defendant, African-American victim, as well as a Latinx defendant and an African-American victim. Next slide, please. Now, what were the underlying crimes? That is, what was the conduct that the hate crime attached to? So in those 3 cases that I mentioned for 2020, the first of which was brandishing of a firearm. The second was vandalism, namely destruction of property. And the third was assault by force likely to cause great bodily injury. In that case, the force would have been applied through an automobile or car. Next slide, please. Now, for the first quarter of 2021, we already have 4 cases submitted, 3 of which we have filed as hate crimes. So within the first 3 months of 2021, we have the same number of hate crimes presented to our office as in all of 2020. Too early to tell if this is an upward trend, but nevertheless, it's something that our office, the Office of Diversity, Equity, and Inclusion, as well as Sheriff Ayub and all police chiefs throughout the county will continue to monitor and assess. So for these 3 crimes for 2021, the demographic characteristics: a Caucasian defendant on someone whom he perceived to be Asian, a Latinx defendant on a Middle Eastern victim, which I will talk about in just a moment, and then finally a Caucasian defendant and a African-American victim. So just kind of big picture, you see in these 6 hate crimes that have been filed, in 4 of them, the alleged perpetrators were Caucasian, but not in all. In other cases, there were other ethnicities that were involved. And you also see from the victim standpoint, a number of different demographic and characteristics that unfortunately are represented. Next slide, please. So again, what were the underlying crimes or conduct associated with the hate crimes for those 3 incidents in 2021? 2 of them were batteries, and the last was an assault and a vandalism. Next slide, please. So I want to just share with you a successful prosecution conducted by Senior Deputy District Attorney John Poor and our office. In this case, just to kind of share with you some facts, a Middle Eastern woman and her two sons were walking back from In-N-Out Burger. This happened in Camarillo. And the Arabic woman was speaking Arabic to a friend while walking, and the suspect overheard the language that was being used, and after doing so, began to launch a number of ethnic slurs. Now, accompanying those ethnic slurs was a physical act of violence, namely the suspect in this case pushed the Arabic woman in the back, hence the battery that was filed and prosecuted in this case. Thereafter, in response to that push and that battery, the victim, the woman in this case, called 911. And in that call, the defendant mocked the caller for her dialect, her language in making that telephone outreach to dispatch. And then finally, while that call was being made, she said some very specific, harmful words that were hate-based. She called the individual an Egyptian and then an expletive, and then also said, "Go back to your country." So the defendant in this case was sentenced to 20 days in Ventura County Jail, a year of probation, and also the statute requires that community service be involved. So in this case, the judge imposed a 10-hour requirement of community service. And I do want the board, as well as the members of the public, to know that pre-COVID, what Senior Deputy District Attorney Poore in our office would do is require, as a component of that community service, that the individual actually go to the Museum of Tolerance, that they undergo an education regimen where they can go and learn about different ethnicities, crimes that have been perpetrated against humanity, all to bring awareness and greater cultural sensitivity, and to ultimately do what is so important in our society, and that's end racism. We hope that once the COVID pandemic lifts, that again can be imposed as a term and condition of probation. So it is it is a pleasure to be before you to speak about our office's efforts. I want to thank you for your ongoing support of the Family Justice Center, as well as the county family providers such as probation, Ventura County Behavioral Health, and the Human Service Agency that are so integral to its success. And it's now my pleasure to introduce Pin, your Diversity, Equity, and Inclusion Director.
So I'll wait for my presentation to come up. There we go. Thank you, CEO Powers, Chair Parks, Board of Supervisors, and Ventura community. My name is Pin Sapanya, and I'm the Diversity, Equity, Inclusion Officer with the County Executive Office. I am here to provide an overview of bystander interventions by Hollaback. This is an organization since 2012 has developed tools to help people intervene. My presentation today is an overview and is not an actual training. Next slide, please. We often witness harassment, but a lot of times we do not act. And we've been in situations like that, all of us have. And here are some of the ways why we don't act. We are scared of the situation a lot of times. We don't even know how to act. We think the incident is harmless. A lot of times it's just, that particular situation is really harmless. I don't want to be involved in that. And we may think it's not our problem and want to stay away out of the other people's business. And we may think it's a cultural thing, or we believe we cannot make a difference with the situation. And lastly, many times we wait for others to act. And I've been in that situation, waiting for others to act. Study from Hollaback has indicated that in most cases, when we act, we make a situation better at least 75% of the time. However, only 25% of us intervene. Next slide, please. The sheriff and DA have talked about hate crimes, and I'm going to kind of talk about hate incidents where it's not an actual crime. And the types of incidents here, I wanted just to mention a few: staring at an individual, vulgar gestures, following someone, making a racist slur, grabbing, touching, and it could be physically or a sexual assault. I also want to lift up the hate incidents happening towards the Asian American community. With COVID-19 has spurred an increase in hate incidents and hate crimes against Asian American communities. These things we have seen every day, such as assuming that Asian Americans have coronavirus or been exposed to it, or calling the virus Chinese virus, Wuhan virus. Shaming, often in terms of jokes. We've seen a lot of verbal harassment, slurs, telling people to go back home. And we heard from what the DA has indicated, one of the examples that he shared. There also have been ongoing online harassment, such as death threats. So lots of incidents that occur with Asian American community. With the Stop Asian Hate campaign, they have recorded over 4,000 incidents since March of last year, and mostly has been verbal harassment, about 6 to 8% of those. Anti-Asian racism has manifested itself in the country's policies and practices since the beginning of the U.S. history. The racist notion that Asian Americans are a threat to the United States goes back to the Chinese Exclusion Act of 1882, the internment of over 120,000 Japanese Americans during World War II, the 1989 schoolyard massacre of 5 Southeast Asian American children in Stockton, California, to the 9/11 of scapegoating Arabs, Middle Eastern, Muslim, Asian Americans, and the Sikh people, to the 2012 mass shooting of the 6 Sikh Americans in the Wisconsin temple, to the latest shooting of the 6 Asian women in Atlanta, and to many of the assaults on older adults, such as in San Francisco, in New York City, that we have heard of, and many, many more assaults and incidents that occur with Asian Americans. Next slide, please. To address these incidents, I am introducing to you the 5 Ds of bystander intervention. This is from Hollaback, an organization working to end harassment, especially for marginalized communities. They have introduced the 5 Ds: distract, delegate, document, delay, direct. The goal here is to de-escalate the situation. This method will inform everyday people the interventions and responses to help address hate. Next slide, please. The first D, that is distract. Distract is about an indirect approach to de-escalate the situation. It is subtle but yet creative. The aim is to derail the incident and to ignore the aggressor. The ways that you can do this: you can get in their way, you can ask for direction, you can make a commotion, you can drop something and talk to the individual about something random. The attempt here is to take the attention off of the person who is harassing. So anything that you can do, create a commotion, do something about that, right? Get in front of them. You should assess the situation, though, and choose your distract method accordingly. Next slide, please. Delegate. Delegate is when you ask for assistance, for a resource, or for help from a third party. It could be a person in a position of power or authority. Here are some of the examples. You can find, if you're in the store, you can find a store manager, a store supervisor, a bus driver, or someone to intervene. You can ask a friend to use distraction to communicate with the person being harassed. You may want to call 911 to request help, but you should check with the person first to make sure that they're okay with this. And also keep in mind that some communities may not feel safe with law enforcement, and they may not want you to call 911. Next slide, please. Document. It can also be helpful to record an incident as it happens to someone. But there are a number of things to keep in mind to safely and responsibly document harassment. So you need to assess the situation, also to keep your safe distance as you're doing this. If it's safe for you, you can start recording, film the street signs, other landmarks to identify the location, say the date and time. So those are the kinds of things you want to ensure that you know the location, you know the date and time as you're recording. Always ask the person once that you finish recording. Always ask the person who has been harassed what they want to do with this footage. Do they want to send it to them? Do they want it, whatever ways that they want to do with the footage? You need to ask them about that. And you should never, this is something that you should never post it online or use it without their permission. There are other factors why people don't want to do that. So consider that. Next slide, please. Delay. Even if you cannot act in the moment, you can make a difference for the person who has been harassed by checking in on them after the fact to make sure that they're okay. So there are things that you can ask them they're okay. You can tell them that you're sorry what happened to them. You can say something like, I can sit with you, I can accompany you to somewhere. What do you need? So the idea here is you delay after the incident, then you check in with the person. You share resources with them if you are aware of the resources. Offer to help them make a report. Sometimes people need some assistance in doing that. You do that only if they want you to help with that. If you have documented incident, ask them what they want you to do with that. Did they want you to send it to them? So ensuring that they get the information they need. If you don't even, let's say you're dealing with a person that don't speak English or don't speak the same language as you do. If you do intervene, making sure that they are safe can be as powerful as anything else. Next slide, please. The last D is direct. You may want to directly respond to harassment by naming what is happening or confronting the harasser. This tactic is risky. It can be risky. Before you decide to respond directly, assess the situation. Are you physically safe? Is the person being harassed physically safe? Does it seem unlikely that the situation will escalate? If your answer is yes to these, then you might choose a direct response. Things you can say, such as, that's inappropriate, that's respectful, that is not okay, what you just did. You should another comment you can say is leave them alone. That's racist. So those types of words that you could use, that is being direct to the individual. You want to keep it short and succinct. Try not to engage in the dialogue, debate, or an argument with the person. Always assess your safety first. Pick lesser intervention if you don't feel safe. So direct is one of those actions that you are dealing directly, confronting the issue. This one, like as I indicated, it's a little bit risky, but it can make a huge impact. Next slide. Keep these things in mind. You need to trust their instincts if you want to be engaged in this process. Notice what keeps you from acting. A lot of times we need to process, and why are we not acting? What is keeping us from that? Decide which one of the D's that you want to use, because you might feel comfortable with one than the other. And all of those are equally important, and they are equally a safe technique to use. Practice resilience. This is not an easy thing to do, and you may not even get it right the first time, but if you continue to work on this, I think we all would be in a different place. Remember that everyone can do something. As bystanders, we need to be especially vigilant and aware of what this disrespect, harassment, and hate violence looks like in order to be able to stand up and intervene at a time when people need it most. You can make a choice to actively and visibly take a stand against hate. Again, please visit hollaback.org to sign up for the official training if you want to learn more about these methods. Next slide, please. I will be coming back to the board and working with the diversity, equity, inclusion to present to you recommendations on additional tools and strategies to assist in the fight against hate incidents, hate crimes. With that, this concludes my presentation, and I believe Mr. Sheriff, the DA, and I would be glad to answer any questions that you may have. Thank you.
Thank you so much, all three, for the presentation, and really appreciate the Diversity Council too. And for those employees that are sitting on that, really appreciate your input and know that you have our board's support on that. Thank you for the presentation today. We are seeing an increase in hate crimes across our nation, and looks like we may be seeing that in our county, though, as our Mr. Nasarenko pointed out, it is too early to tell, but we have already reached the amount we had all of last year in just the first quarter of this year. I want to turn over to our other supervisors for their questions. And Supervisor Ramirez, I see that you have a question.
Thank you. No, I really just want to thank the DA, the sheriff, and our diversity officer for their leadership here. I'm very proud. I'm really proud of our county stepping ahead on these issues that are so harmful to all of us and are so particularly hurtful to individuals who are victimized. But I'm also really troubled that there is such a surge of this at this time in our country and even in our county. It's really just unacceptable. A lot of us think, hey, well, in World War II, if I was in Nazi Germany, I would have done something, I would have said something. Or if I was alive during the time of slavery in our country, I would have said something or done something. But sometimes it's very difficult. It is scary. There can be terrible repercussions. But if we all keep standing together on this, and just, I also think it's very important for people to know their history, know the history of our country and how we need to fix certain things. And Mr. District Attorney Nazarenko, I think your recommendation, I hope we can do it again, and maybe there's a virtual tour that people can do of the Museum of Tolerance. That is such a terrific place to go. Children used to go there, I think, in 8th grade from our county. I know I visited, I went on a field trip once with a friend who was teaching to go there, and it is very universal. You don't have to be of a particular ethnic group to really get the feeling of being singled out because of who you are. So very proud of this. Just keep up the good work, everybody. Thank you so much.
Thank you. And Supervisor Long, and then Supervisor LaVere.
I want to say Ping Wedded and Sheriff Ayub, Mr. Nasarenko, what a great presentation. I appreciate bringing this conversation in the platform of all hate crime, not singling one out, but how does our community deal with this? How do we support each other? I think everyone who's watched this presentation, we've all been in that situation, and it creates anxiety. And what do you do? Do you step in? Do you not? What's your gut feeling? And it's a scary time. And appreciate breaking it down as to a thought process of what to do. I have great concerns with our schools in regards to the hate crime that is going on online, because they're stuck at home or for whatever reason. I'm not going to say that the reason is okay. We see it on a nationwide in our own county. I feel that it's very concerning to me in regards to people being technically, in their homes for so long and now going out, and that anxiety of being with people and can I say something, can I not? So I think that with our behavioral health team and our education with Ping and our diversity, we really need to keep this as a top of mind topic. Because if we can stop, if prevention was able to happen, we would be reducing a lot of the crimes. And it's going to be our community's voice in making sure we stand up for each other. And so I appreciate this conversation. Thank you very much.
Chair Parks for having this as a discussion, and our leadership team, including Mike Powers, in bringing in PIN and making sure that we are talking and making sure we have those tough discussions. Last year, we had the town halls in regard to so many social unrest and so forth. And with Regina and all the different groups coming together to have these conversations, this is one more step. And I really appreciate all of your efforts. Thank you.
Supervisor Levier.
Yeah, thank you, Madam Chair, and thank you for making sure this was on our agenda this morning. It really was an incredible presentation and timely. I think Supervisor Ramirez said it best. I just am so proud that we have this incredible team working on this issue. I keep hearing that racism is overblown in Ventura County, and as we saw today, that's just simply not true. And to have the District Attorney Nazarenko and his team, and Sheriff Ayub and his team, and Ms. Chapanga and the CEO's office, just an amazing group working on this issue, making sure that it doesn't fall to the wayside, that we keep it at the top of mind and keep working towards equity in Ventura County. It's just so important, and I could not be more proud of this team that we've put together that's focused on this important work. So thank you.
Thank you. And I also want to thank the sheriff. Reading the press release, a recent one of the quick action of our deputies and the follow through and into our system with our district attorney. And that really, I think, not only is obviously, what needs to be done, but it also makes other people go, yes, we are standing up for people. And I just am so glad to see that quick reaction. Mr. Nazarenko, you pointed out that it's wonderful that our Victim Assistance Center now assists people who have been victims of this kind of hate crime. I'm wondering, do you have to actually report, an official report to be able to get services?
You do, Chair Parks. What initiates the Family Justice Center services is some type of police report, which is then brought to our agency. So that is a precursor, if you will, for intervention and services at the Family Justice Center. But it's an opportunity that we want the public to be aware of, so that your constituents are aware of it as well. But yes, in order for services to be rendered, there does need to be some report taken by a police agency.
And that does make sense in the sense that we want to be able to get these people who are perpetrating these crimes, and that is an incentive towards that. But obviously, we as a county have services available for anyone who feels that they are being abused too. And then Pin, I also want to say thank you. I had seen some of these presentations on, what do you do? What are the interactions? And you do need to feel comfortable, but I thought it was really interesting, something when you say distract, when you have a very heated conversation going on and, obviously someone's, being, hateful and bullying, but to drop your keys. I just thought, oh, what a thought, it's like you got some, and then it just takes people's attention away for that moment, and it can help diffuse. So those kind of techniques, I think, are really helpful. And I'm glad that, thank you all of you for your willingness and desire to be here and with us this morning and present it to us and by through us, the entire county who are watching. So very much appreciate it. And let me turn it over to Mr. Powers. Would you like to make some?
Bob Huber, I'd like to make a comment, please.
Okay, go ahead, Mr. Supervisor Huber.
Yes, thank you. I just wanted to say I got the paperwork and I read it, and then presentation, which tracked that pretty much. I very much appreciate the thorough presentation. It was very, very informative, and thank you very much for your hard work in putting this together.
Thank you.
Well, thank you, Chair Parks and board members, for the time this morning, and a special thank you, of course, to our sheriff, district attorney, and diversity officer. Just the combination of all of you really helps us address these important, difficult conversations in a really positive and comfortable way. And there's a lot more work to be done, but we've got a great team of people doing it, and you help set the culture that supports it and fosters it. So just deep appreciation. Thank you.
Very much so. And we are also shocked when we see things, a hate crime happen or attacking an elderly Asian, just those things are just so shocking to us. And so I just we put the keys in your hands to help us with this. But it is on all of us as a community. We all have an ability to help this too. So thank you very much. All right. With that, can we have a receive and file motion?
I'll motion to receive and file.
Okay, Supervisor Levere, and we'll go ahead and have Supervisor Long be the second for that motion. And could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And now I'm going to, we have some important folks here. I want to go to item 31 and give it over to Mr. Powers to introduce this memo of understanding that we're looking at doing with the great city.
Yes, thank you, Chair Parks and board members and community members. Really excited to present to your board today a memorandum of understanding proposed with the city of Oxnard, which will outline the details and the conceptual framework for the development and operation of a permanent year-round homeless solutions center in the city of Oxnard. And your board set up this approach, this partnership in October of 2018. And clearly the founding members of this were the cities of Oxnard and Ventura. And they've both been great partners in addressing this issue. And a lot of work gone on behind the scenes to get to this point, and really credit both cities. And the city of Oxnard has just done so much work with their transitional shelter, and at the same time as they're identifying a permanent location. And so we're excited to bring this to you today. This will outline a framework where the county will match both the startup costs, development, as well as the ongoing operating costs, and provide wraparound services. So with that, appreciate we're joined by some leadership from the city of Oxnard today. And I will start it off with our own leadership, Christy Madden, Senior Deputy Executive Officer. Thank you.
Emergency shelter in their community. This document is consistent with the framework that was approved by your board in October of 2018. It is modeled after the document that we executed with the city of Ventura that culminated in the creation of the Arch. That's the 55-bed shelter in a county-owned building on Knoll Drive. The county and cities of Oxnard and Ventura started meeting regularly in mid-2018 to pursue the establishment of a West County shelter system with permanent shelters in each city. We jointly issued an RFP and selected Mercy House as the anticipated operator for both shelters. Oxnard hosted the West County shelter at the former Armory and subsequently expanded that to 24-hour services as they pursued the permanent location. This location also served as the West County shelter when the Ventura location was being renovated. Given the temporary shelter's location within the Oxnard runway protection zone, coupled with the building's deteriorating condition, the city conducted an exhaustive search for a permanent location to pursue their vision of a homeless solutions center, to address not only sheltering, but services and housing to end homelessness for their residents. Oxnard has identified a city-owned property on 2nd and B for the development of a comprehensive homeless solutions center that will have a 110-bed shelter on the first floor, 2,600 square feet of offices for supportive services on the second floor, and then 56 units of housing on the top 3 floors of the building. This conceptual MOU outlines the anticipated roles and responsibilities and the preliminary cost estimates to the county and the city, and it mirrors the Ventura agreement in every material way other than cost being a little bit higher for Oxnard because it's a larger shelter. preliminary estimates that would be offset by any new grant or other funding identified for the project are just over $2 million in one-time capital investment for the county and $1.5 million for ongoing shelter operations. The county's participation in this MOU is exclusive to the first floor only, the emergency shelter portion. A final binding participation agreement would be presented to your board in early 2022 once refined cost estimates are identified and will be presented to each governing body for approval. The MOU was approved by the Oxnard City Council unanimously as part of a larger comprehensive package that included executing a disposition and development agreement with community development partners and appropriating $1.6 million in city funds to move their project forward. We'd like to thank the City of Oxnard for their leadership on this issue by converting the temporary shelter into the county's first 24-hour facility, hosting the West County shelter while the Ventura location was being renovated, and for taking a holistic approach in ending homelessness through the creation of the Homeless Solutions Center. Before closing, I'd like to recognize Tara Caruth, who is disappointed to miss today's proceedings, but she's taking a well-deserved vacation. Her leadership and tenacity around this and all things homeless has been instrumental in bringing this item before you today. As Mr. Powers mentioned, we do have representatives from the City of Oxnard, Community Development Partners, and Mercy House on the line if your board should have any questions for them. Collectively, we are excited about the progress in realizing this vision for a West County emergency shelter system. With that, we recommend you authorize the chair to sign the MOU, and we would be happy to answer any questions you may have.
Thank you for the presentation. It is good to be at this moment back when we were deciding these funds in 2018, realizing that they could very well be turned into shelter for those who need it was just a gleam in our eye, as it were, and then to actually see it come to fruition is very nice to see, and great partnerships with our cities. We have Supervisor Ramirez has some comments or questions, followed by Supervisor Long.
Thank you very much. Would you tell me if my volume's up enough to hear me? Is it better?
Yes.
Okay, I have to yell here. Anyway, I want to. It's great to see my the folks I know from Oxnard, Mr. Ramirez, Elsa Brown's on the call. People that I work with a lot during my time in Oxnard City Council. And I want to particularly salute my former City Council colleagues who voted unanimously for this, and let you know, if you didn't, that not everybody in the city thought it was a great idea. I thought it was, it takes some courage to vote for these things, to move the agenda, to help people living on the streets who we don't want to see people living on the streets. We don't want to see people under the bushes in our neighborhoods, but we do want to see people get the services that every human being deserves. So I really appreciate Oxnard's work here, the county's work with them for all these many years. And I particularly want to single out Gabe Turan, who's a new city council member who was appointed in as I left, he was appointed to represent the district I live in, District 2. But Mr. Turan in particular was the chair of the local neighborhood where the armory was. And he communicated with his neighbors and then to the city of Oxnard that they had no problems at the armory and that the neighbors were okay with that shelter staying there while it was needed until we had a more permanent site. So congratulations to all of us for getting this going. And I look forward to it being up and running. And of course, it's just one step and we need a lot more, but I appreciate the county and the city's leadership here. Thank you.
Thank you, Supervisor. And now Supervisor Long. You're next.
Yes, thank you. I was hoping if we could just have an opportunity for the city of Oxnard just to make any comments. We, as our old board, have been really working hard on this, and to finally see this in fruition is just very exciting. And I wanted to give them just a moment to speak, if possible, Mr. Ramirez or whomever is on.
Thank you, Supervisor. Emilio Ramirez, Housing Director, City of Oxnard. Thank you for the opportunity to speak and address, and for your partnership. I coming here anew from a different area, I am supremely impressed by the level of coordination exists between the City of Oxnard and the County of Ventura, and the amount of dedication that your staff contributes to it. Christy already mentioned, but Tara, and for that matter, your entire Human Services Agency, Healthcare Agency, have been, I don't know how to say, incredibly amazing in terms of how they contribute to this effort. We're happy, we're proud. Thank you. I think it's going to be a good project. I think it's going to be nice. I think it speaks volumes of the City of Oxnard and the City Council that this is in downtown Oxnard, right in the middle of everything across City Hall. It's a commitment to a solution that we're all after. And also, I can't be prouder of my team, of my partners, and of, if I can say this honestly, of the partnership that exists with the County of Ventura and your team. They're just incredible. You should give them all a raise.
Thank you
so much, Mr. Ramirez. I really just appreciate the partnership. And I know that we had many different locations that were in the discussion, and just appreciate the City Council's agreements as well, and opportunity to work together on homeless. We have been with our continuum of care, and today's monumental, and to have this for us, and agreeing, and it is a lot of funding, but for good reasons. And wanted to say thank you to Supervisor Ramirez, both as a City Council and now a supervisor in working with this as well. Mr. Powers and the whole team, Tara and Christy, you did your due diligence to make sure that this is going to be a successful program. And so I appreciate the time and effort in bringing this to make sure it comes and works well. So thank you so much.
And Supervisor Levier.
Great. Hey, thank you, Madam Chair. I just want to congratulate the City of Oxnard on taking this important step. Just great work and really encourage City Manager Nguyen, Mr. Ramirez, the leadership on the City Council. This is really a historic day as we move forward with this shelter in the City of Oxnard. It was the strong partnership between the county and the City of Ventura that was instrumental in making the homeless shelter in Ventura a reality. And here we are today to kind of further that and make it and recommit to this partnership between the county and the City of Oxnard. So just really exciting news, really exciting about what progress we're about to see there. And so congratulations, everyone. And really thank you to our staff as well, Ms. Madden, Ms. Caruth. It's such a strong partnership that makes things like this happen. So thank you.
Certainly, and having this be the second homeless shelter that we've been able to help fund through this program, which was instigated by the Board of Supervisors. So it is good to see. I also am happy that we have found a better location. Previously, making it permanent right there on the flight path, essentially, of the airport, it just wasn't the right place. So I'm glad that we were able to find this location, and appreciate the city's diligence on this, because I know they very much wanted to be able to have this too. So thank you for that. Not seeing any other supervisors with comments. We have an MOU in front of us, a memo of understanding to move forward with this financial arrangement so we can get this permanent shelter.
Move to approve.
I'm sorry, Supervisor Parks, we have one person on Zoom and 3 to read.
Okay, you're right. Let's go ahead and go to our speaker. speakers, and the one individual that we have is that I'm not seeing.
Brittany Seraph.
Okay.
Hi, you have Brittany Seneff on the line.
Okay, please go forward.
Yeah, hi. I was actually part of this item to just see if you had any questions. So I'm with Community Development Partners, and we are the developer. And I'll just take this time to let you know we worked very closely with Mercy House and with the City of Oxnard just to make sure that we helped in any way to get all of the estimates that went into this MOU, that we thoughtfully laid out what the shelter would look like and made sure it really met the needs of those who will be utilizing this space and would just really better the community. So just want to thank you all for, getting this project to this point and for being so open and seeing the end result and how great it will be for the community. So I'll just stay on standby if you have any other specific questions, but just really want to thank you for this partnership.
Thank you. Thank you very much, Ms. Seneff. And then would Ms. Martinez like to read the others?
Yeah, thank you, Chair Parks, board members, and CEO Powers. The first email comes from Kat Selm, and it says, "Hello, I'm writing to support the Homeless Solution Center in Oxnard that will support 110 beds and 56 permanent supportive housing units. As natural resource manager in the Wildland Urban Interface in Oxnard, I can personally attest to the environmental impacts of the human suffering brought by homelessness. The project is a model for meeting the needs of our many unhoused neighbors and will help transition them into stable housing. Thank you for your support on this project." And that is Kat Salm with the Santa Clara River Coast Stewardship Associate. The next email comes from Max Guinness, and it says, "Dear Supervisors, as an Oxnard resident and on behalf of the Ventura County YIMBY, I ask that you support the Homeless Solution Center by providing 110 beds and 56 permanent supportive housing units near jobs, services, and transit. This project is a model for meeting the needs of our neighbors experiencing homelessness and helping them to transition them into stable housing." And the last email comes from Jackson Piper. And that one says, let me make it a little bit bigger. "I ask that you fully fund the county's contribution to the Oxnard Homeless Solution Center. As I am sure you are all aware, homelessness has been an increasingly severe crisis in California within the past decade and has become a visible presence in our Ventura County communities. While some of the homeless have mental health and substance abuse issues, many are families, including children, not earning enough to afford the cost of living in Ventura County and all need our support to successfully reintegrate into the community. That begins with housing, and specifically with sheltered beds and permanent supportive housing with wraparound services to enable the homeless to have enough stability to pursue full-time employment and have a shelter from the hardships of life on the streets. This project will deliver that outcome for a large number of Oxnard homelessness residents and will serve as a model for other communities within the Ventura County that are also attempting to solve homelessness with their jurisdictions. Please support this project by fully funding the county's portion of it. Thank you." And that is all of our public comments for this item for today.
Thank you for that. And now, appreciate the support from the public. Do we have a motion? I think we did from Supervisor Ramirez. Is that right?
Yes.
And I'll second Supervisor Long.
And could Ms. Key do the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes.
Thank you.
And I'm going to take us to our 11:30 time certain, item 40 and then 41. Item 40 is that time of the year where we get the pleasure of presenting our Earth Day Awards, and each supervisor has picked an individual organization in their district to honor as our environmental champions in our communities in honor of Earth Day. And I believe this is the 7th annual Earth Day Award that we've done. And We know that Earth Day really began just one county away in Santa Barbara when they had the tremendous oil leaks and destroyed the coast so much that really kind of united the world in realizing how important it is to respect the earth and be able to appreciate what we have. And sometimes that takes some proactive action to make sure that it is protected for future generations. So these individuals that we are awarding today, we celebrate you, we thank you. In this COVID situation, we can't have this celebration in our boardroom. So we've asked that we get some videos, a little video from each of the awardees so that we could all watch them even though we're not in the boardroom. So with these champions, they really do go above and beyond to support sustainable living and environmentally sound practices here in Ventura County. Each honoree today has contributed to making our world a cleaner and greener place to live, and we celebrate them and their extraordinary work. And we're going to go district by district, and starting with District 1, I'll turn it over to Supervisor Levere to do his district's award.
Great, thank you, Madam Chair, and I'm really excited to be part of this great tradition. And this year, I'm proud to announce the crew of Ojai as the District 1 honoree for this year's Earth Day Awards. This amazing organization has been an environmental leader in our community for over 30 years. Going back to 1991, the crew got its start teaching teens how to work on backcountry trails in the Los Padres National Forest. And through hard work in the outdoors, these crew members learn new skills, confidence, discipline, respect, and the value of hard work. Today, crew members spend more than 11,000 hours in the field each year throughout both Ventura and Santa Barbara counties, working on trails that cover hundreds of miles of both front and backcountry trails. These members also perform critical fuel reduction and fire prevention services for various conservation groups, municipal agencies, and homeowners. And because of the crew's incredible legacy, we have a growing body of restoration projects that support healthy, biodiverse and resilient lands, all the while developing really a future generation of community leaders. So I'm excited to share this quick video about the crew's important work, and please join me in congratulating the crew of Ojai as my 2021 Earth Day champion for the environment.
Hi everybody. I hope you enjoyed this show about the crew, our work, and the excellent young people who make it happen. My name is Jennifer Berry, and I'm the Executive Director. The crew has been an environmental leader in Ventura County for over 30 years. Maintaining trails is one of our specialties. If you're a hiker, cyclist, or horseback rider, you know how important it is to keep our trails open and accessible for everyone to enjoy. As we head into summer, keeping communities safe from wildfire is something that the crew takes very seriously, and we serve our communities with fire prevention work, including defensible space around homes and curbside chipping programs. We also love doing habitat restoration with projects throughout the year, including removing invasive plants and planting young grasses, shrubs, and trees. Our newest program, the Green Valley Project, is focused entirely on giving young people leadership roles in restoring the environment in their own backyards. Because the best part of what we do are the excellent teens and young adults who work as crew members every day. Crew members are anywhere from 16 to 25 years old, and during their time with us, they gain valuable experience through hands-on environmental and community service work with a real impact. Working and learning under dedicated, experienced supervisors and mentors makes the crew much more than just a job. From our base in Ojai to Thousand Oaks, Ventura, the Los Padres National Forest, and everywhere in between, the crew is proud to be a nonprofit youth conservation corps for all of Ventura County.
Congratulations. What a wonderful group. Thank you, Supervisor Levere. And now to District 2, which is my district. And I am happy today to announce that Catherine Kat Darst, who is an assistant field representative from the United States Fish and Wildlife Service. She's a supervisor out there, and she's with the Ventura office. And she evaluated the population status of the western monarch butterfly, which the U.S. Fish and Wildlife Service just recently was able to deem as a candidate endangered species. The western monarch butterfly has gone from 1.2 million of this population just a couple of decades ago to, at last count, only 2,000 of them. Really needs the attention to reverse its likely extinction. And thanks to Dr. Darst's efforts, she is part of that solution. Her work and presentation, for example, at the Santa Monica Mountains Conservancy, actually encouraged them to put forward a grant to also assist nonprofits and agencies to come up with programs to help assist the population. And a lot of that has to do with protection of habitat and restoration. So I'll turn it over to the video now. You can see her out in the field, and now let's hear her on the video.
Hi, my name is Kat Darst, and I work for the U.S. Fish and Wildlife Service in Ventura, California. And I am honored that Supervisor Parks nominated me as her 2021 Earth Day champion for our work to protect and restore western monarch butterflies. For the past 5 years, I've been part of the service's team assessing the status of the monarch butterfly for listing under the Endangered Species Act. As most of you know, monarch migration is an amazing phenomenon. In the spring, adults migrate from wintering grounds in Mexico for the eastern population and coastal California for the western population. Through several generations, they migrate as far north as Canada. Then adults, 3 or 4 generations removed from those that began the trip in the spring, travel the entire distance back to wintering grounds in the fall. These are the monarchs that will then begin the northward migration in the following spring. Monarch butterflies across North America have been in decline for at least the past 20 years. And the wintering monarchs in coastal California have seen the most dramatic decline, from about 1.2 million butterflies in 1997 to fewer than 2,000 butterflies in 2020. Using these data, the U.S. Fish and Wildlife Service determined that the monarch butterfly warrants listing under the Endangered Species Act and has been placed on the candidate list. This map shows the priority restoration zones in California for recovering western monarchs. As you can see, Ventura County falls squarely in the priority 1 zone, where we are asking that we protect and plant pesticide-free, early season native milkweed and nectar plants for monarch breeding and migration. Recovering western monarchs from these really low numbers will take an all-hands-on-deck approach, and we will continue to work at it with you. Thank you again, Supervisor Parks, for the Earth Day Champion nomination.
And thank you, Dr. Darst. And these are the certificates that my assistant, Venice Terry, put together that we've been handing out over the years. Let me now turn it to Supervisor Long for your district's awardee.
Thank you very much, Chair Parks, for just bringing this every year. It's important that we are celebrating the great things that are going on in our districts. And today I bring to you our Piru stormwater capture for groundwater recharge project. This has finally gotten to fruition thanks to the collaboration between the Ventura County Public Works Agency, our watershed protection, and United Water Conservation District. We utilized existing infrastructure, the county storm drain system, and United Piru spreading grounds to really create a low-cost project providing long-term and sustainable source of groundwater recharge to the Piru groundwater basin. And I wanted to say that this project really improves the water quality of Piru Creek, a tributary to the Santa Clara River, which is the largest national river system in Southern California, providing habitat to most of the endangered and protected species. And it also helps the county to comply
with Federal Clean Water Act regulations and the total maximum daily loads. And so it's extremely important, as you know, that our residents have healthy and high quality living conditions, and that is part of the water. And the collaboration of this, like this offer, it offers unique opportunities where common solutions for different problems result in really cost-effective, unique, sustainable solutions. And this project was funded by the Prop 1 Stormwater Grant Program for disadvantaged communities. And really want to say thank you to the United Water Conservation District, because we couldn't have had this happen without them. Just being committed to the agreement of long-term operations and maintenance in the system. The stormwater pollution, groundwater recharge, sludge management, habitat creation are some of the multi-benefits that was achieved through this project. And I want to really say thank you. I know staff is on, but we've got a video to Uina and also Glenn for their work in regards to the collaboration with United Public-Private partnerships are extremely important and really appreciate it. And we have a video. So thank you.
The Piru Stormwater Capture for Groundwater Recharge Phase 1 project is located in the Ventura County unincorporated community of Piru. All stormwater and dry weather runoff generated within the project Phase 1 drainage area of 36 acres is conveyed into the county storm drain system. It was estimated that on average it is approximately 17 acre-feet per year of runoff and nuisance flows. Captured runoff is transported to the 10-foot diameter continuous deflective separation unit where trash, debris, sediment, oil, and hydrocarbons will be removed prior to infiltration at the Piru spreading grounds. The continuous deflective separation unit includes the inlet flume to direct water to a separation chamber to capture floatables, a sump to separate sediment, trash, and debris, and a baffle to contain oil and hydrocarbons. Treated water is directed to the Piru spreading grounds to infiltrate and recharge the Piru groundwater basin. The Piru Stormwater Capture for Groundwater Recharge project will improve water quality in Piru Creek, a tributary to the Santa Clara River.
Thank you so much. And in my background of engineering, I think that's super cool that we can use technology to really just provide clean water for our community and a safe environment for all of our safe environment. So I just want to say thank you very much for all of our staff and all the community making sure this happens. Thank you.
I was thinking that too, that as an engineer, you probably think it is super cool. And, you know, while it isn't as sexy necessarily of a project, you look at this and you're going, wow, look at all the pollutants that they're taking out of this water. And instead of shooting this water out to the ocean, it's recharging. So what a great project, as well as the collaboration. So thanks for bringing that forward. Let's now go on to Supervisor Huber. Do you want to go ahead and do your?
Yes. Yes, thank you very much. The 4th District recipient of the 2021 Earth Day Award is Mr. Hal Ward. Hal is pictured here in his red Rotary Club shirt, which is so appropriate because he dedicates himself tirelessly to improving the environment and his community. His most recent environmental accomplishments include teaching grade schoolers the how-tos of gardening, setting up gardens on campus for them to learn how to grow things. Such an important lesson for our young people. He also provided much needed work at the Samaritan Center, and he is thoughtful in his approach to landscaping, working to naturally preserve trees, water, and plants. He takes the same thoughtful and energetic approach to his work with the Rotary Club, which he's a very strong member of, and many other local nonprofits in our community, too numerous to name today. Hal is truly an Earth Day champion, and his actions in his life embody the true meaning of service. Congratulations to Hal Ward, and we have a video to show you. Thank you very much.
we volunteer to build gardens for elementary schools. So we actually build garden boxes, bring in vegetable amendments, teach the kids how to plant, put in the drip irrigation system so they can water. We also supply a hose bib next to it so the kids can hand water to add extra water. So that was a real fun project. We built four vegetable boxes for them. Also did some work for our local Samaritan Center here. Just general cleanup, built a dog-eared fence for them. So they had a little patio area. It was wide open, and that gave them a little bit of privacy in that area.
That's wonderful. Thank you, Supervisor Huber, and to see all the different ways that we can work with our youth and creative ways of reducing our water use. Let us now go to Supervisor Ramirez for your Earth Day awardee.
Thank you. First, I do want to congratulate all of the other nominees, awardees, and the supervisors, my colleagues, for nominating them. I am very proud to have nominated Shirley and Larry Godwin for this Earth Day Champion Award. I've known them for a long time, and they have always been there for the Oxnard community, particularly South Oxnard, and they have worked very hard to encourage all of us, the residents, elected officials, other agencies, to preserve and protect our precious resources there. They have contributed one of their most precious resources that any of us have, and that's their time. And they have worked very hard to preserve Ormond Beach, to stop toxic industries from polluting our precious beach and environment, and to help all of our neighbors and residents live in a healthier community. So I'm very proud to have nominated them for this award. They are very deserving. We have a video.
When we first came to California, we came to Oxnard. We had never been in Southern California before, and we believed that everybody in California went to the beach every day. We believed every beach was crowded. So the first week after we moved to Oxnard, we went looking for a beach, and the closest beach to our little tiny studio apartment happened to be Ormond Beach. We didn't know the name. When we saw it, we couldn't believe what we saw. There was no people there. There was this beautiful ocean and dunes and a lagoon, and we were just taken with it right away. And so we just kept going back, and with all the various threats to Ormond, it just seemed so important to do whatever we personally could, along with all the other people that we discovered also had these experiences at Ormond Beach. Many of them as children coming there or camping with their families, and what a really special place this was. And so we have just continued all these years. From our home, we can actually see the power plant at Ormond Beach every day, and you look down the street and you look forward to the day when the beach is restored. The power plant's gone and the beach is restored like it was originally.
And And I'll just say that that first photo was with, in fact, the world-renowned Jane Goodall, who did come at the invitation of the community to visit Ormond Beach and the Halico Superfund site. And I'm so glad that I was there to take that photo. And they are the people, the kind of people that make a community great. They really care about their neighbors and their community and really don't expect anything personally in return. So I'm really proud of this nomination, and thank you very much.
And congratulations to Shirley and Larry Godwin, and to all of our awardees. And thank you to the supervisors for and your staff for helping us get this together. And what a wonderful time to be able to appreciate the earth by appreciating the people that are doing good things for it. All right. I don't know if this actually takes a, yes, it is a receive and file. So we'll make it definitely an accomplishment by this motion. Do we have it?
I so move.
Thank you. And second? Supervisor?
I'll second.
All right. Supervisor Long beat you to it. Supervisor Levere and Huber. With that, Ms. Key, can you do the roll call for us?
Certainly. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. And then item 41, I kind of put these together because they are somewhat related in that we both can use Dr. Darst, who is here with the U.S. Fish and Wildlife Service, if there are any questions. But I'm asking that our Board of Supervisors adopt a county policy to help protect the monarch butterflies. As pointed out, we've seen this really drastic decline in their population, and it really is a clarion call. I'm hoping not just the county, but the state and other jurisdictions will get involved. All of those who have the jurisdiction along the coast of California, because that's generally where they are migrating, as pointed out by Dr. Darst. And so what I'm asking specifically for our county properties, and we have lots of different properties that the county owns throughout Ventura County, that on those county properties, when we're doing landscape changes, that we consider putting in native milkweed and other pollinator-friendly plants. Considering how vital this one type of plant is to the ability of this population to survive. And this is something that is kind of a small thing to do, but can make a huge difference. And I appreciate all the backyard gardeners out there putting in a native milkweed and also making sure it's not had pesticides on it. Those are like the two main criteria with what kind of milkweed you put out there. Interestingly, if you use the non-native, the tropical milkweed, you can have problems with the fact that the plant itself blooms more often, so the butterflies don't continue their migration. That sometimes they have some pests associated with the milkweed that can damage and harm the butterflies. That's the tropical milkweed. And then additionally, and I don't know if I have heard that when the butterflies eat native milkweed, they actually don't taste so good to birds, but that may not be the case with the tropical milkweed. But when you think that we've only got 2,000 monarchs at last count, a few hungry birds could take care of that population. So it is really important that we do something. So that's one request, is that we plant native milkweed where practicable on our county property, as well as other pollinator-friendly plants, because they like that. And then secondly, there are areas on our county property where there are groves, these overwintering tree groves, where the butterflies land and stay overwinter. So in those areas, we certainly want to protect those groves and not cut them down. And then finally, that we add to our state and federal legislative platform those measures that we can to support the preservation of this species so it doesn't become extinct, including to support Dr. Darst's effort in terms of making it a candidate, not just a candidate, but actually an endangered species. So it will receive the protections of the federal government also. And we've seen here in Ventura County, the turnaround of the condor, also a federally listed endangered species, but we can do things, and that's so important. And I think a lesson that we have all learned coming with Earth Day too, that we can make a difference. And so I'm asking that our county step up and support this agenda item. Supervisor Ramirez, I see your hand up.
Yes, thank you. And thank you for bringing this forward. I totally support this. And I would like to say that a few years ago, I visited the Monarch Sanctuary in Mexico. It's near Mexico City, near Michoacan. And it was stunning because the trees, which are a different kind of tree than we have here, were literally golden with the butterflies. And you never would have thought that butterflies could be loud, but there were so many wings flapping and little chirps they make. It was loud and beautiful and magical. And I think it's so great to really encourage people to plant the natives because they're relatively easy to grow. They do a wonderful job, and you get to see the caterpillars growing, and you can protect them. It's great for children. And, this is something we can do. You can do it even if you live in an apartment, if you have a balcony or a little plot outside. You can plant it in in a pot, and you don't have to have a big yard. And I'm lucky enough to have some growing in my yard too. And I'm looking forward to the babies coming. So thank you very much. I totally support this. It's great.
Thank you. Any other questions? Not seeing any.
Yes, I do, Chair Parks.
Yes.
Well, just a question in regards to planting the milkweed. So you're asking that it goes on a list of plants that our county could choose to plant, not mandating, right?
It is not mandating, but what it is, it's a county policy that where we can plant it, that we should be planting it. And it's kind of a now or never type of thing. So we want to start getting it in the ground. And I can think of a location right off the bat.
Thank you. I appreciate that. I just want to make sure the community knows that as well, who's watching. Thank you.
And then Dr. Darst, I know she's still on from the last item. Did you want to make any comments before we vote on this? Okay. If you'd like to unmute yourself, Dr. Darst.
Thank you. Can you hear me okay?
Yes.
Okay, great. May I share? I just thought I'd share. Yeah, I think I can. Oh, I can't. Well, what I was going to say is I was going to put the little map of California back up that was in the Earth Day Champion video, just to reiterate the point that Ventura County is really important for recovery of Western monarchs, and that planting the pesticide-free native milkweed in our area is vital for their recovery, and that we have overwintering sites. They're priority 2 overwintering sites, but we have overwintering sites that are incredibly important as well, and that are recommending that we protect and enhance those overwintering sites in terms of trees and nectar sources, but that milkweed should be at least 1 mile away from those overwintering sites, even if it's native milkweed, so that we're not pulling individuals off the overwintering sites onto the milkweed, but that milkweed everywhere else in the county, native milkweed, is really important. And so I'm very much in support of this county's policy to protect monarch butterfly overwintering goves and to support the planting of native milkweed and pollinator-friendly plants on county property. I think it's bold, and I think it's vital if we think we're going to restore Western monarchs at the current low numbers where they are. So thank you so much.
Thank you, Dr. Darst. And it is something that does take bold action, and education too, I think, is also really important. Is there, if there are no other, I guess we believe we have the motion. If not, I'll make it. And Supervisor Ramirez, you were a second, is that right?
Yes.
Okay. And with that, Ms. Key, can you please do the roll call?
Certainly. Supervisor Levier.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And thank you, board. Let us now go back to our 11 a.m. We still have one item there that I want to go to. Does that sound good, Mr. Powers? This is our budget presentation.
Sounds great, Chair Parks. Thank you so much, and board members. So yes, we want to do just a status update on where we're at with our budget development and our targets. And so kind of a check-in. I will turn it over to our CFO, Kay Mann. Thank you.
All right, good afternoon.
Good
Chair
afternoon.
Parks, board members, Mr. Powers, Kay Mand with the CEO's office. I'm here to present the status report on our general fund target budgets. Next slide. Throughout the year, our office presents a number of budget-related reports, and for fiscal 21, we've already presented the first and second quarter updates. Our third quarter budget update will be presented on June 8, and for the upcoming budget year for fiscal 22, back in February, the ISF rates were presented by the various departments, as well as the budget development manual. Next slide. The budget process includes the calculation and development of the general fund net cost target budgets. We then hold meetings with all of the department heads, and now we are having budget presentations by the departments. We started a couple of weeks ago. We had 3 departments present already, and we'll have 4 departments presenting this afternoon, and with the remaining departments scheduled to present at each board meeting through June 8. And today we are presenting a status report on the general fund targets. Next slide. Some key revenue assumptions that were used in developing the general fund target. We're estimating general purpose revenues at $463 million. That's an increase of $17 million. The general purpose revenues represent about 40% of the total general fund revenues. And 90% of general purpose revenues are property tax related. We're estimating an assessed value increase of 3.5%. That translates to $15 million. Normally, on an annual basis, the base values can be increased by about 2%. But per the State Board of Equalization, our inflation factor for 2021 is only 1%. And so that means that we are limited to an increase of the base values to 1%, not our normal 2%. So we've been using the 3.5% of assessed valuation increase, even though home sales and median home prices have been increasing over the last year. Some other revenues that are increasing are our RDA revenues. There are a couple of revenues that are decreasing, and that includes interest earnings revenue and also our cost allocation plan revenue. Other major revenues in the general fund include Prop 172. We're estimating that at $78 million, which is an increase of $8 million. And for realignment revenues, which include both sales tax and also vehicle license fee revenues, we're expecting to be about flat, and this is based on year-to-date activity. We may be looking at about a 1.5% increase on those revenues. Next slide. This just shows a 20-year assessed valuation trend, showing that for our current year, for fiscal 21, assessed value had an increase of 3.9%, and our estimate for fiscal 22 is 3.5%. In terms of what it means in terms of revenues and the relation to assessed value increases, each 0.5% increase in assessed valuation translates to about a $2 million increase in property tax revenues. Next slide. Some assumptions regarding our expenditures at the general fund. Salaries and benefit costs include negotiated salary increases and market-based adjustments. In terms of retirement, this is the second year in a row that we're seeing a decrease in our retirement rates. In the current year, we saw a decrease of more than 5%. For fiscal 22, that decrease is 1.1% for a composite rate of 22.2%. Also decreasing is our unfunded actuarial liability, decreasing from $775 million to $704 million. And our funded ratio has increased to almost 90%. In terms of our services and supplies, as presented back in February, the departments presented their ISF rates, and they showed the following increases. With GSA, a little over 1%, IT, 3%, workers' comp at 2%, and our general liability insurance increasing at about 3.5%. Next slide. Here's some items that we wanted to note that will have some impacts on our future budgets. One of these is, again, retirement contributions. Every 3 years, the actuaries update their demographic and economic assumptions, and that includes assumptions related to inflation, the investment return, payroll growth, and mortality rates. And so the next update is scheduled for the June 30, 2021 report. And so we will be using that, the rates that are identified in that report to prepare not our upcoming budgets, but our fiscal 23 budgets. And in the past, this has resulted in an uptick in the retirement rates normally, but at the beginning of fiscal 21, we did establish a $12.5 million pension mitigation fund. And so if rates do increase, we do have the mitigation fund to help smooth the rates. We're also expecting to lose about $4 to $5 million as a result of the elimination of a number of criminal fees and fines. In the January budget, the state had set aside $65 million as a backfill, but the allocation methodology has not yet been set, so we don't really know how much of a backfill we will be receiving. But if past history is any indication, normally any backfill that we receive will not fully compensate us for the loss. But we'll wait to see what happens with that. Also increasing with relation to in-home support services are the maintenance of effort costs that the county has to contribute.
Okay, if I may, just a moment. I see Supervisor Long has a question.
Oh, sure.
Thank you for the opportunity to ask a question on this. I just wanted to understand, as we talk in the changes in the Department of Justice and so forth, with SB 823 coming through and the realignment of the JJC, wondering if we're looking at potential change in budget on that item as well.
Well, we will be working with probation to see what the impact of that is to make sure that we account for any changes that are needed in the budget.
Thank you. I just want to make sure that that's lined out there because, yeah, it's a new program coming under Health and Human Services for the state. And with this change, I'm sure there's going to be some funding changes as well. Thank you.
Okay. Next slide. Next slide, please. Regarding homeless shelters, that was discussed a little bit earlier this morning. Back in 2019, the county, your Board of Supervisors set aside $2 million as a match for homeless shelters with the cities, and currently we partner with the city of Ventura, and we share the annual operating costs at the Knoll Drive shelter at a cost of about $700,000. And as was mentioned earlier this morning, for the city of Oxnard, the estimate for the county share of a capital investment is $2 million, with the ongoing operating costs estimated at $1.5 million. On Health and Human Services, some impacts related to the Medi-Cal 2020 waiver.
Hey, I think I see another question there, Supervisor Long.
Oh.
Thank you. Mr. Powers knows I have a question on this one because we talked about it yesterday. Just ensuring that we're in discussions with the Spirit of Santa Paula also for a homeless shelter improvement. And so to make sure that as we move forward with that and working with the city, that there is funding for that as well. So potential impact as well. Thank you.
Yes, Supervisor Long, thank you. And I believe the board did give direction to bring that back and was supportive of that. So yes, we will be doing that. Yep.
Next slide. It's upcoming capital investments and capital project needs that we need to look to include the Vestiges project, and that is the system that is used by public safety and also the courts. And so over the next few years, that upgrade is expected to cost anywhere from $24 to $31 million. Also, public safety communication upgrades are required at a cost of about $35 million over the next few years, as well as to broadband at $20 million. Now, funding related to COVID-19, we've had the CARES Act, we have FEMA, and then we also now have the New American Rescue Plan. We are currently waiting for eligibility guidelines from the Department of Treasury as to what can be funded. But just as a reminder that this is one-time funding, and it's not to be used for ongoing operations. In terms of the funding that we have received to date, the majority of it has been dedicated to providing services and programs to the community. That includes the items that were discussed this morning with relation to the business to the business assistance grants, as well as the farm worker household assistance programs, testing, feeding our seniors, and also for vaccinations. Just also wanted to mention that there are a number of labor MOUs that are expiring in the current fiscal year, let's see, in 2021. And so Sean's as a group has some work to do there. Next slide. I think you've seen these before. I said these are just a list of items that will impact the workload and costs for public safety departments. In terms of the state, we expect a revision to the January state budget sometime in May. We normally receive this information around May 10th or so. So we will be looking at that update to see if there are any items that might actually impact the county, hopefully for the better.
You know, if I may, on the just a couple points on that, okay? So I think in terms of the May revise, some of the things that we're watching, we just heard last night from the Department of Finance that the revenues are trending positive. You know, they're so positive that you almost don't want to build your base budgets too much on it. So we want to be very thoughtful as we go into this. But overall, year-to-date revenues are up about 14% year over year, which is pretty striking, which is good. But again, we have to be cautious and thoughtful about that. Corporate tax is up 8.6%, personal up 19%, and sales and use tax up 4.7%. So they're also working on, CSAC is working on two issues that may be addressed in the May revise. We won't know until we see it. One is that the extent of the backfill that Kay referenced earlier on the fee elimination and reductions, as well as IHSS cost impacts going forward. So we'll be watching that closely. And then lastly, I think your board saw yesterday from CSAC just sort of a collective letter to the governor asking for certain priorities, including broadband access for all, homelessness and housing funding, particularly flexibility, because each county is in a different phase of that, disaster recovery, public health and behavioral health, and in particular with that infrastructure, but also ongoing funding, and then county-run elections. As you'll hear when we get to that part, as you can imagine, there's some significant election costs coming our way. Mostly one time, but it is significant. So more to come there. Thank you.
Right, next slide, please. Just in terms of next steps, on May 18th, as it relates to the budget process, on May 18th, countywide rates and fees will be presented for fiscal 22. On June 8th, we'll have the preliminary budget presentation with the budget hearings set for June 21. That completes my update. I'm available for any questions.
I was wondering about the redistricting. Is that something that we see as potentially costly in the future?
Well, there will be, if I may, okay, there will be costs associated with it. As you could see, we did have a letter on your board's agenda today. We pulled that. We're going to enhance the community outreach portion. So it will mostly be one-time costs that we should be well able to fund.
All right. Any other board members have questions? Supervisor Long, your hands is up.
Thank you. Yes, I appreciate if everyone, the supervisors, take a look at that letter that was sent out by Mr. Powers from the CSAC. Our LEDGE conference last week was very in-depth in regards to items, not including COVID, 19. There are so many other items that we have to discuss, and the homeless and housing is going to be crucial as we get through this pandemic. So I appreciate and also the disaster resilience and recovery going into a drought. And if we're having to do more recovery due to fires and so forth, what is that going to be for our county? So I appreciate this presentation today and look forward to the next time we have this discussion because things are changing. They may revise. It'll be interesting to see what other flexibilities we can. I'm really concerned when we have state mandated items, but it may be not as funded. And so I want to make sure that if that's the case, we're making sure that we do get funded for the programs that we serve for our community. So thank you.
Thank you. I see Supervisor Ramirez has a question.
Yes, Ms. Mann, thank you very much for the information, the work. I want to go back and ask about property valuation because you're predicting, assuming certain increases, but just for members of the public, this does not necessarily mean that anyone who's owns a house today is going to get an increase in tax, does it?
Not necessarily. The assessor's office prepares the assessed valuations as of, I believe, January. And so they are working on their rolls, and they will complete their rolls usually at the end of June. And so it is at that time that we will know the exact increase in our assessed value.
So a property could be reassessed based on increased value, not necessarily transfer of ownership?
That would be correct. But as I mentioned, normally the base values increase by 2%. But this year, because of the inflation rate that the Board of Equalization has calculated, those base values will only be increasing by 1%, not by the normal 2%, as has been the case in the past when inflation rates have been higher.
Thank you.
Okay, and the way we have been presented the different budgets of all the departments, kind of bringing them in with each meeting so we can take a more in-depth look at it instead of looking at the whole budget on one day, which is difficult to do. So I appreciate looking forward to seeing what's coming down the line and things that we need to prepare for. But it is remarkable, really, in a time of a pandemic to see our state, for example, doing well. That's good to see. And then a supportive federal administration looking at trying to help with those programs, the kind of programs that our county works with. So that is some good news too, I think.
Yeah, thank you.
So if that completes questions from the board, do we have a motion to receive and file this presentation?
Long, a motion to approve.
Huber, second.
Thank you, Supervisor Huber, Supervisor Long. Ms. Key, could you do the roll call?
Certainly. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. So let us go back to our 11:30 time certains, and we had item 39. Does that sound good?
Sounds good.
Okay. So I will go ahead and open up the public hearing on this amendment to an ordinance on our civil service system and give it over to Ms. Deal and Mr. Otten to do.
Good morning, Chair Parks, members of the board, and CEO Powers. As you know, I'm Marjorie Deal, your manager of classification and compensation. Today, I'm before you for the second hearing on the recommendation of placing the classifications of primary care clinic physician and primary care clinic pediatrician in the unclassified service as detailed in the board letter. We are recommending that your board approve the ordinance and adopt it for these classifications. This is, as we said, the second hearing on this matter, and the ordinance will become effective 30 days from here. I'm open to any questions at this time. Thank you.
Thank you for that succinct report. If there are no questions, do we have a motion? And I'll close the public.
Moved.
Thank you, Supervisor Huber.
I'll second.
Thank you, Supervisor Levere. And while it's a quick one, it is a very remarkable and important one that is rather historic. And with that, could Ms. Key do the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. So I think that concludes the time certain ones in the afternoon, in the morning period. So we can go back to our regular agenda.
Yep.
Do I hear someone? No. Okay. Then let us go to, if we can, to item 9, which is the public comments. And then after that, our board comments, item 10. So for item 9, let's see. Do we have some members of the public?
Yes, we have 4 comment letters to read.
That's what I was thinking there. They submitted them in advance. Could you please read them, Ms. Martinez? I think you're muted. You know what, we could, while Ms. Martinez hooks herself up, we could go on to our board comments. Would that be helpful? Okay, because I don't think that she's able to get her audio going right now. So with that, Supervisor Levere, would you like to give us your board comments?
Okay, great. Thank you, Madam Chair. I would just ask that we close today's meeting in honor of the following individuals who list I provided to the clerk, but it's Jeffrey Gattian, Margaret Bellevue, David Lee Brady, Marion Hooley, Theodore Lindgren, and Rita Sturdivant. Thank you.
Thank you. And Supervisor Long, would you like to go with your board comments?
Thank you very much. It's a privilege to be advocating for our county at the state level with the CSAC, our legislation program. Key issues I wanted to hit on was housing, broadband, homelessness. As we get through this pandemic, that's going to be really important. I sit on the Administration of Justice with SB 823 in regards to juvenile justice coming from the state facilities to the county, and appreciate working with our probation officers to strengthen that program. But with change comes, budgets and so forth. And so making sure that that funding is there. And I wanted to say thank you to Supervisor Carmen Ramirez for serving as a subcommittee on our county, coastal counties, making sure we're advocating for our coast and sand replenishment and work with being on Beacon. So want to say thank you. It was nice to be on Zoom meetings and have a friendly face from our county, so appreciate that. Also, we had a very successful virtual town hall with Commissioner Ricardo Lara and Elaine Himifarb, our executive director for the Ventura Regional Fire Safe Council, in regards to fire preparedness and insurance for your homes. As we know, 4 years of fires in Ventura County. This is extremely important, especially with state changes to the insurance for our owners. It needs to be done. Also, SBA, sitting with the
EDC collaborative, I just want to make sure that everyone for restoration revitalization funds, that you have that information for SBA's Restaurant Revitalization Fund. The website is sba.gov/restaurants. Really want to get our businesses the funding that they need to keep on going and to reopen. Also want to say thank you to Caltrans and CHP. We had a very good meeting in regards to Highway 126 as it relates to Piru. As we know, we want to strengthen the safety of 126. There are many different portions of the 126 that need to be looked at, and appreciate the openness for Caltrans to look at Piru's area with accidents and do a study in regards to that, and what else can we do to keep that area safer. And then I wanted to make sure people saw the Cal Matters article in regards to cost of housing. As we have found, it is basically 24% increase to the cost of housing. And we know that that's happening in Ventura County. And I hope that our supervisors and staff are really looking at that as to how do we build different levels of housing in our county. I know it's with our cities and the partnership, but we really have to look at this. There's got to be a mixture, at least from my standpoint. With prices being so high, the average rent of a 2-bedroom is going to be going up, and that concerns me to make sure that we have housing for our workforce here. So as we look at things, I just want to make sure people are understanding of that. And then also Virginia Gunderson, I'd like to adjourn in memory of her young age of 92, strong advocate in our Santa Paula area with the Santa Paula Museum. And I loved her family's comment was that she lived a good life. She gave back to her community. She did so much. And so just thank you very much. Appreciate everyone's comments today, and I look forward to more discussions on items. Thank you.
Thank you, Supervisor Long and Supervisor Huber.
Thank you, Madam Chair. I wanted to begin my comments by recognizing the passing of Stephen Castro. He was a longtime educator and a founding member of the Reuben Castro Charities. The Reuben Castro Center is under roof of Moore Park and has brought much needed services to Moore Park. Stephen was an educator and taught many subjects for over 36 years, including Spanish, math, and English as a second language. He worked at Juvenile Hall and at the Youth Center and played a major role in the formation of several clubs and organizations whose primary focus was working with at-risk youth and families. He will be greatly missed. On a brighter note, I would like to welcome Tiffany North as our newest county council. Tiffany will be the first female county council that I've worked with, and I'm grateful to have her as the newest member of our county family. Welcome, Tiffany. In closing, I'd like to adjourn in memory of the residents cited on the list I sent to the clerk of the board. Thank you very much.
Thank you, Supervisor Huber and Supervisor Ramirez.
Thank you. And I also join in the welcome to our new county council, Ms. North, and look forward to another closed session with you and shortly. All right, I want to say thank you, Supervisor Long, for mentioning the work on sea level rise in Beacon. Beacon is a joint powers authority of all of the coastal counties in the region. That is Ventura County, Santa Barbara County, and all of the cities with a coastline. I've been working on it for a few years as a city council member. So important because our beaches are not just for our coastal communities. It turns out our beaches are for inland communities who really enjoy coming here. Some of us who live near the coast kind of take it for granted, just like my nominees, Larry and Shirley, discovered. But those who are inland where it's warmer and they don't feel the ocean breeze that we do sometimes, they want to enjoy the beach. It's important for all of us to do what we can to protect it from sea level rise, from pollution, all those things. I also wanted to say that we learned that our county is in extreme drought by designation of the state water agency, I believe. So it's incumbent on all of us to really think about water and preserve it, keep it clean, like the Piru groundwater project is, which is terrific. And just know we need to make some changes in terms of landscaping in general for the benefit of everybody, because water, once it's gone, it really takes away life of humans and the economy. And then finally, I would like to adjourn in memory of Wayne Stevens, Alfonso Gonzalez, John Boyagan, Francis Schill, and I also would like to mention Frances Gagola. She is the mother of Celeste Weingart, many of us know, and she was extremely active in women's affairs, Leave Women Voters, just a wonderful, lovely person who was very active up until her last days. So I would like to adjourn in memory of her.
Thank you, Supervisor Ramirez. My board comments, I have the opportunity to also put up a resolution because April 28th is Essential Workers Day. And I know that there are so many different segments of essential workers that we think about, and from our farm workers to the people who help us in the grocery stores and restaurants. But there's one that we may not think about as much. And so this highlights public transit workers. And when you think about it, it is because of the transit workers that we have out here that some people can actually get to their vaccination appointments, get to their medical appointments. It's a way to connect our residents to their jobs. And particularly during the pandemic, they became free, all the bus services in the county. And knowing that we can always count on these, they are, in a sense, our frontline workers, certainly frontline transit workers, the ones that are driving, the people, that are assisting people to, call in to find out what routes to take. And I know, as all of us sit on the Transportation Commission, we also know that they took the brunt of the COVID infections in our county. We had several employees through our transit departments that did get COVID. So we realized, that they are putting themselves out there and they're doing it for us. And so we want to honor them as part of Essential Worker Day, and knowing that they are out there for the essential workers, but they're also helping people with disabilities, at-risk families and seniors, and really do serve a very diverse community. So thank you to all our essential workers. And this is a resolution specifically for our transit workers. So we'll make sure and share that with Gold Coast Transit too. And then in addition to that, I would just like to comment, I mentioned I was able to attend our pop-up vaccination site in Newbury Park in Thousand Oaks. And what was pretty novel about this is not only did we have 50 volunteers helping with the vaccination clinics, helping to put up the actual, easy up, but also the Safe Passages program was the one that coordinated this. And Safe Passage is a program put together really by deputies, or actually the chief of police in the city of Thousand Oaks, our retired police chief, Tim Hagel, current Jim Freihoff, who worked with the kids out in an area where you had a lot of at-risk children. And the goal is to keep them out of gangs. And they have brought in so many different agencies and service, and like getting on the phone, they know everybody. But, the Canadian Recreation and Park District and Art Trek and Cal-Lu and California Lutheran University, the Kiwanis Club, the Rotaries, they're all out there and they're doing it for the children. And it's so nice to see. And when I was there, so this was going on where they were providing food from Food Share And then at that one, they had Chick-fil-A was giving out free food too for the community. And it was a considerable effort by all of these volunteers, but to also see at the same time bringing the vaccines to this community that may be more hesitant and certainly had higher COVID cases than the normal population. So that was wonderful to see. I actually overheard a conversation with a mother with a retired officer talking about, my son is in the gangs, what can I do? And to see it right before my eyes, how this works, that they have the trust of the community. And as a result of the trust, the community will assist us in our crime fighting efforts too, and help to get people out of gangs and prevent people from getting in gangs. And they are succeeding, and seeing the graduates of the program going off to college, they provide tutoring and also it is just something that is really special about our community when you see we are calling the helper assisting a community segment that is needy and also helping our future by providing services to these kids so they don't get in gangs and they become really productive members of our community and go on to help others. So wonderful to see. I'm also going to ask that we close in honor of the people on my list and also, again, congratulate Tiffany North for coming into our Ventura County family in such a pivotal role. And I know that we're going to definitely see the benefits of your contributions in the near future. So welcome and congratulations again. So now I'm going to turn it over to Mr. Powers for your comments.
Thank you, Chair Parks, board members. Yes, and just to echo, we really welcome Tiffany. She's already hit the ground running and proved to be a great partner. So really excited for her joining our county family. Speaking of family, the VCMC Family Room, the Ronald McDonald Walk for Kids was this Sunday, the virtual one. And top fundraising teams for Pediatric Diagnostic Center, Dr. Landon, Rotary Club of Ventura, and the Passion Family with McDonald's team, as well as the probation department, Dina Rogers and Jack Pollock. Just a great community outpouring. I actually had the privilege of visiting the family room. It's not just a dream anymore. It's actually reality, and it is amazing. Just feet down the hall from hospital beds where parents are dealing with the trauma of a critically ill child, to be able to go to this really homey atmosphere with a kitchen, living room, and desks for kids to study and just to decompress and support one another is great. So excited for that to move forward. This Thursday, the Ventura County Leadership Academy Journey to Leadership Virtual Awards will be taking place from 1:30 to 3, and your county COVID response team, your collective county team, will be celebrated as the Public Sector Leader of the Year. Two last things. During the CSAC Ledge Conference, I heard that there was a really nice compliment given to Victoria Jump by the State Director of Aging, Kim McCoy-Wade, and just the great work that AAA is doing here in our county, as we know. And then lastly, just want to let your board know that on January 26th this year, your board adopted a resolution condemning the actions of those who tried to overthrow the results of the 2020 presidential election. Per Chair Park's request, based upon new information coming from investigations into the events that occurred on January 6th, our office will be bringing forth an updated resolution that we'd hoped to be on today's agenda. We'll be bringing it to your board for consideration on May 11th. Among the items being corrected for your board's consideration are circumstances related to the death of Capitol Officer Brian Sicknick, as well as information concerning the weapons utilized by individuals involved in the attack. And those are my comments. Thank you.
Thank you, Mr. Powers. And with that, we have a couple of other regular agenda items we can go to before our 1 o'clock, though I would also suggest we take a brief break before that 1 o'clock. But let's go ahead and do these, what I think will be pretty quick, 3 agenda items, 28, 29, and 30. So,
Chair Parks, did you want to do public comment quickly? Mia's got her microphone working.
Oh, okay. Yeah, that's right.
Okay.
Please go ahead. Please
Thank
read
you.
other comments.
This is Supervisor Long. Can I just ask a question? I understood, I heard Mr. Powers on that resolution. Based on the resolutions that we have already and the presentation with the hate crime, I'm just wondering if we should just pull that resolution altogether. So if we can take that into consideration too, I'd appreciate that. Thank you.
Ms. Martinez?
Thank you, Chair Parks, board members, and CEO Powers. I have a few emails to read, and I'll start with Jennifer Morrison. And it says, hello there. My public comment today is on the topic of county behavioral health services. It is my understanding that several families have been advised by VCBH that if you have private health insurance that you are not eligible for services. I find this to be perplexing because I know of families that are receiving services with private health insurance. There seems to be some inconsistencies in the way that residents are treated, who decides which families this policy is waived for, and is it discriminatory? The people that pay taxes in the county should be eligible for the same benefits as everyone treated equally. Is it possible for the policy to be made public and transparent? Families are being turned away so that desperately needed help to get services for their loved ones with serious mental illness. I would like to make a comment that we lost a very large voice on the Ventura County Behavioral Health Advisory Board, Mary Hafner. Her absence is going to make a big impact as her knowledge, experience, and advocacy for seriously mentally ill has been invaluable. And the next email comes from Elizabeth Stone.
I'm sorry to interrupt me. Chair Parker, if I may. Since a good question was raised about insurance coverage and mental health services, we do have Dr. Johnson, our behavioral health director, here to respond to that just briefly, if that's possible.
That's great.
Thank you.
Thank you for interrupting.
All right. Thank you.
Ms. Johnson, are you available? And, you know, generally we would be in the boardroom and she'd be out in the audience and we'd have her come up to the microphone. So everything's just a little bit different that we're all on Zoom now.
Let's see. Well, why don't we
continue with the public comments?
Yeah, why don't we do that and we'll come back to that. Yes, thank you.
All right. Go ahead, Ms. Martinez.
Okay, thank you. The next public comment comes from Elizabeth R. Stone. It says, I'd like to thank and congratulate all the supervisors who have made it possible for the VHAB to finally conform its regulatory mandate to have 20% of seated members self-identify as being consumers. Much of the public conflict and, dare I say, even need for crisis services could be averted with the respectful and concerted effort to include the voices and experiences of those who have used behavioral health care services. I would like to clarify an apparent misunderstanding about the confluence of family members' priorities and what is important to those of us who have been diagnosed and received treatment. We often disagree. For example, to assert on her nomination that a mother who has publicly decried her son, the next mass shooter, somehow embodies an understanding of the consumer perspective is an egregious mischaracterization. Perhaps less dramatically, the issues of LPS reform, the changing HIPAA regulations more readily expose the disgrievance of policy. Both are advancing based on argument that family members are suffering. But these laws exist to protect vulnerable people and already have provisions that allow choices and actions when necessary. Wouldn't the best course of action be to work in a partnership with the most directly affected party, the person about whom everyone seems most concerned? Wouldn't it be wonderful if our local affiliate of Family Advocacy Group would focus on helping family members have more meaningful understanding and productive conversations and relationships with their loved ones? And that is at the 250 word limit for that public comment. And I'll go to the next one. The next one comes from Julia Bach, and it says, hello. I'm opposed to any segregation of public or private venues by vaccination status. I came to this area 6 years ago because of its welcoming, family-friendly environment. I would put an unwelcome mat out for me and millions of others. This would drive away both visitors and residents. Please do not install this unfair caste system. And the next public comment for this item is from Denise Pedro. And it says, Dear Ventura County Board of Supervisors, it is unbelievable that we have Americans suggesting that other Americans be treated like second-class citizens just because they choose not to partake in COVID-19 vaccinations. Many people have strongly held religious and personal beliefs against forced vaccinations. Other people have compromised immune systems and that would be harmed by the experimental vaccines. It is inconceivable that our County Board of Supervisors would suggest the show proof of vaccination plan to allow Americans to enjoy the same freedoms as their neighbors. This opens up county to huge future lawsuits. The outcry for recalling one supervisor is building amongst our district. Are each of you really going to vote against freedom for your constituents? Why are each of you not fighting for us? You are clearly marching for Sacramento and mandates that 5 or 7 years ago would have been unthinkable. Have you lost your conscience and forgotten that you swore an oath to safeguard the freedom of the people that elected you? I urge you to eliminate the tiered system, eliminate the plan to make Ventura County a two-caste system based on FDA experimental approved injections. And that completes the public comment for this item.
Thank you. Ms. Martinez?
Yes.
Will be read in 50 words, knowing that they.
I'm sorry, Chair Parks, I didn't hear you. You were cut off.
Internet's unstable on my screen. We have.
I believe you're frozen, Chair Parks.
I think.
It looks like we lost Supervisor Parks.
I think I might be back. Am I?
Oh, there we go.
We can hear you, and I also see Dr. Johnson has joined us now.
Thank you,
Ms.
Johnson. And just in case, in the meantime, if my internet goes out again, I'll look to my vice chair, Ms. Supervisor Ramirez. It's on you.
Good morning.
Yes, we can hear you.
Good afternoon.
Oh, good afternoon. My apologies. Good afternoon, Chair Parks, Supervisors, CEO Powers, and members of the public. For the record, my name is Savette Johnson. I'm the Behavioral Health Director. I'm here to provide information regarding the public comments that were provided, asking about individuals with private insurance being able to receive county services. So as a note, I want to lead with the mandate of the mental health plan. And that mandate is to provide specialty mental health services to Medi-Cal beneficiaries with severe mental illness or severe emotional disturbance. In order to be a Medi-Cal beneficiary for an adult 19 to 64, that individual would have to have an income, a family income of less than $47,000 per year, which is at 138% of the federal poverty level. For a child or someone under 18, that family would need to be at 266% of the federal poverty level. So I want to say that in our county, some counties don't allow individuals that don't have just straight Medi-Cal to use some of our county services. But here in Ventura County, private insurance does not preclude someone from being able to benefit from services. For instance, anyone in our community can call our crisis team 24 hours a day, 7 days a week. If it's determined that the need is there for a field response, the crisis team will go out. Anyone in our community can use the crisis stabilization units, whether it be for children or for adults. And our inpatient psychiatric unit can be utilized by anyone. Doesn't matter if you have insurance or if you do not have insurance or if you have Medi-Cal. You would be able to access those services. Upon your discharge, care coordination would be provided. Now, care coordination is going to look different depending on if you are insured by Medi-Cal or if you have private insurance. For instance, if you have private insurance and you're being discharged from the crisis stabilization unit or the inpatient psychiatric unit, Your insurance would be called and it'd be determined what is the next level of care that is needed. And your insurance would have to authorize that. Now, if someone decided that, well, I don't like what my insurance said, we would say, okay, well, we want to communicate with you and make sure you talk to our billing department so you understand the charges that you would be responsible for because your insurance has denied this is medically necessary. And so at that time, we would give an individual a choice of if they want to move forward with being responsible for a portion of those costs or not. And in that case, we would redirect them back to their insurance provider. It should be noted that we are the safety net. But when it's said that we're the safety net, there's some clarification that's needed there. It means we are the safety net or the provider of services for individuals who are uninsured, meaning they don't have an option. They have nowhere else to go. It does not mean that if your insurance provider denies authorization for a certain level of service that they don't feel is appropriate, that then the county will take on the burden of those costs. So that's an important clarification I think we have to make because oftentimes people do get confused and they say, well, you're the safety net, you should be paying for this. And we have to clarify that no, we're the safety net for those who are not insured, not as a second option if someone is not happy or pleased with their private insurance and the claims they may authorize or deny. So I think I've answered the question regarding can someone access insurance, what happens if they do have private insurance, and what are the qualifications for someone to be eligible for Medi-Cal. But I'm happy to take any questions that your board may have at this time.
Thank you for, and Mr. Powers for suggesting we hear this. And it is important to note that someone who is, in a crisis situation and needs to go to our inpatient psychiatric unit, it doesn't matter, who your insurance provider is, that is probably the number one safety net we have, when people are in crisis. So that's important to note too. All right, and do we have more speakers on our public comments?
No, ma'am, that was it.
That was it then. And okay, so with that, I believe we'll move on then to those last three agenda items. And that would be item 28 with our agricultural commissioner. And this is a resolution for a full-time position. And I believe we have Mr. Williams, our agricultural commissioner, here to present this item. And I'll note that it's the position allocation is to support pesticide use enforcement, and then also to have that important ability to speak both Mixteco and Spanish, where we find many of our farm workers speaking. Mr. Williams, are you available to come on? Because we could trail this and go to item 29. Let's do that while we wait for Mr. Williams. Oh, no, wait, Mr. Williams, I think I saw you just come back on. Okay. Okay, please proceed. Just unmute yourself. Thank you.
Hi, there we go. Sorry about that. My system seems to be complaining a little bit today. Good afternoon, Chair Parks, board members, Mr. Powers, and members of the public. For the record, my name is Ed Williams. I am your County Agricultural Commissioner. I'm here to request that your board adopt a resolution establishing one regular full-time position allocation to support the Pesticide Use Enforcement Division in the Mixtec and Spanish languages. My department is responsible for ensuring the safe use of pesticides in Ventura County. We do this through issuance and review of restricted material permits, pre-application site inspections, inspections of ongoing pesticide applications, checking headquarters and storage locations for proper record keeping and storage of materials, and field worker safety reviews. In addition to these activities, this division enforces structural pesticide enforcement, conducts outreach and recycling events, and enforces both state and local hemp regulations. One of our department's highest priorities is our field worker safety program. There are more than 40,000 farm workers in Ventura County. About 45% of these speak primarily indigenous languages, such as Mixtec and Zapotec. While many speak Spanish and English as well, they are more comfortable speaking in their native tongue. It is critical for us to be able to meet this community where they are to help ensure their safety while working around pesticides. In addition to the field workers' safety work, we anticipate this position to provide communication assistance in disaster situations such as COVID-19 and during wildfires. This year, our part-time trilingual technical specialist was loaned to the Farm Worker Resource Program in the Human Services Agency for most of the year to assist with translations, outreach, and making videos for farm worker safety, outreach materials, rental assistance program, farm worker assistance program, testing and vaccination clinics, and a lot more. Next slide, please. We currently have one intermittent technical specialist who is trilingual that helps our pesticide use enforcement inspectors conduct field worker safety reviews. 7 of our other field staff in the Pesticide Use Enforcement Division also speak Spanish. If approved, the Farm Worker Community Liaison, which you see is in the Pesticide Enforcement Division on the left-hand side of your slide here, would report directly to our Deputy Agricultural Commissioner. In addition to field checks with farm workers, we anticipate the liaison to provide outreach through video productions in Mixtec as well. Next slide, please. The total anticipated cost for this position is $76,762, beginning in fiscal year 21-22. The current cost for the intermittent technical specialist is $16,150 annually. We have enough savings in our current budget to absorb the $5,000 to $10,000 increased costs for the remainder of this fiscal year. The full-time farm worker community liaison position would replace our intermittent technical specialist position. So we'll be doing away with that position to gain the full-time position. This will result in an increased cost of approximately $60,612. We estimate that 70% or more of this cost would be reimbursed through the state mill tax, unclaimed gas tax, and charges for service licensing and registration fees. This chart shows current year funding for the pesticide use enforcement activities for Ventura County. We have estimated the unreimbursed net county cost for this new position to be approximately $18,184 per year. Next slide, please. Thank you for your time this afternoon. I'm requesting that your board adopt a resolution establishing one regular full-time position allocation to support the Pesticide Use Enforcement Division in the Mixtec and Spanish languages. Please let me know if you have any questions for me. Thank you.
Thank you, Mr. Williams. Supervisor Ramirez.
Yes, thank you, Mr. Williams. I want to say I appreciate all this. I think it's great. I just have a question. If the education about pesticides, I did observe a hearing where that was an issue, where the farm worker didn't seem to, I don't know, there was a question about whether or not the farm worker knew how to protect himself from pesticide exposure, et cetera. Is there, so that is part of what is being requested here, that the individual that will be hired is able to give people education about pesticides and protection in the language they're most comfortable with, correct?
Yeah, that is part of this this new position's responsibilities. as well as determining whether or not the farm operators have actually met their obligations to train their staff properly. And that's why we do the field worker safety reviews. It's on the farm operators to actually provide that training, but we will also be providing outreach and videos and that kind of thing as well.
It's my experience in the past that some farm workers are reluctant to report any kind of problem like misuse of pesticides, etc. They fear for their jobs, and as we all know, many of them don't have a stable situation by immigration status, so they feel very vulnerable. Is there retaliation penalties for? Is there protection from retaliation? Is my question.
Wow, that's a good question, Supervisor Ramirez. I'm not completely familiar with that area. We don't have any laws that we would enforce along those lines, but I believe that the law enforcement folks may be able to deal with those kind of situations.
I'll find out.
Yeah, sorry about that. I'll look for that information as well for you to try to get you more information on that.
Thank you.
If I may, Chair Parks, just to chime in there on Supervisor Ramirez's excellent question. That issue of potential retaliation is something that the Farm Worker Resource Program works on. And so that's something that they're very attuned to, handling it thoughtfully. And that's where they try to build trust so that they're comfortable reporting things to us, and that so that there isn't retaliation when those issues are brought up. I'll get some more specifics on that for you from the FRP, but that is something that is very important to that, because that's how we identify problems to fix. And we want to urge people to come forward and build that trust. So more to come on that.
Mr. Powers, also, I believe the Department of Industrial Relations at the state level, CalOSHA, deals with some of those types of issues as well.
Yes, thank you, Ed.
Okay, I'm not seeing other questions. This is a great idea. It's great to have this before us. If there are no further questions, do we have a
motion to approve?
Do we have a second to the motion?
Second.
Thank you. We have a motion and a second. Ms. Key, could you please do the roll?
Certainly. Supervisor LeVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. So now we'll go to item 29. I do see our fire chief is available, and then we'll do board of Supervisor LeVere's appointment on item 30, and then take like a 10-minute break and finish up the rest of that agenda. I think we deserve a break.
Perfect.
With that, let's go to item 29. Hello, Fire Chief Lorenzen. Nice to see you.
Chair Parks, thank you for taking this item. Members of the board, CEO Powers. For the record, Mark Lorenzen, Fire Chief for the Ventura County Fire Department. Before your board today is a request that we originally had in our 2021 budget that we chose to remove until we understood the impacts of COVID and its impact on our revenues. Now that we've seen what the impact is, we are submitting this request to your board today. It's for the addition of 6 allocations, which actually will fill 2 firefighter paramedic positions that will be filled basically 24/7, 365 days a year. This is for a paramedic squad in our Thousand Oaks area, one of the areas that was identified during our 2017 standards of cover study that showed some of, we have 3 areas in the county that have hotspots. So as we have funding, we're slowly addressing these different areas. The first one we addressed was the addition of daytime surge capacity or high volume engines, and now this is our request before your board today. With that, I'm going to open it to questions.
Just a big thank you. And it's good to see that we are able to have the funds to do this important work. Thank you so much. Supervisor Long, go ahead.
Hi, thank you, Chief. I appreciate you understanding hotspots so well.
I wanted to just ask if this is with the smaller engines, will they be driving those?
Yeah,
Just a question.
that's a great question, and that's what it is. We're trying to address some of our infill problems and not adding a new fire station or a fire engine. Instead, it's a paramedic squad. Kind of, if you guys remember back to the show Emergency, it's the same thing that Johnny and Roy staffed up, just a little bit more modern. So it's just basically a 2-person pickup truck with a lot of great advanced life support equipment on it.
And thank you for elaborating on that, because I think it's important our community understands that you ran the pilot, it's running well, it's serving our community, and so appreciate and support this. Thank you.
Thank you.
Yeah, especially when you realize that that's the number one type of calls you go on, or get those out soon. You don't need the whole hook and ladder, as it were. If there aren't any questions, I'd like to make the motion. And do we have a second?
Long, I'll second.
Thank you. With that, Ms. Key, could you do the roll?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber. Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. Thank you. Thank you very much, RT. Do this one quick item here, item 30, and then we'll take a short break.
Yeah.
Supervisor Levere.
Thank you. This will be a quick one, Madam Chair. I'm just bringing this item today, seeking my colleagues' support for the appointment of Genevieve Flores-Haro to the Behavioral Health Advisory Board. Ms. Flores-Haro is the Associate Director of MyCop. She's the President of the Diversity Collective. She's been an incredibly effective community advocate, and I think she will bring some important perspectives and a different voice to the board. So I think she'll be a great addition, and I would seek my colleagues' support. And with that, I would make the motion.
Huber, second the motion.
We have a motion and a second, and I do also want to say thank you. As Ms. Stone said in public comments, this is the first time that I can remember that we've actually met the requirement for having consumers, clients on our behavioral health board, and now really working on the diversity one, which is another one we haven't been able to hit. So she is great. We know her work and throughout the county, and I'm so glad you were able to convince her to be on it. So thank you very much. We have a motion and a second. Supervisor Ramirez and then Supervisor Long, you wanted to comment?
I just wanted to say I know Genevieve very well, and she's a tremendous advocate and brings a lot to her, to the understanding of the community. She's from Oxnard, and Oxnard does have a kind of a disproportionate share of the customers. Customers, no, we say
consumers.
Consumers, yes. I was forgetting clients. So yeah, so I think she's a terrific addition. Thank you.
Supervisor Long, you want to comment?
If I can find the mute button. Thank you. I just really appreciate the openness to have Genevieve be on the board. I think it's crucial. She has shown us that she represents the whole county in the diverse ways, and I just really appreciate it. I can't speak enough for how well she represents. So thank you.
And with that, could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, and let us take a brief recess. Be back at 1:35. Sound good? All right. So let me know when you're ready to begin, Ms. Key.
Will do. I'm going to start you up now.
Chair Parks.
Yes.
Could you recognize me just so I can add a comment to the last?
We're about to proceed to our next agenda item. Let me first call on Supervisor Ramirez with some comments from our last item there. Yes.
Thank you. I wanted to just mention and thank Mary Hafner, who's been on the Behavioral Advisory Board for a long time, representing District 1. Her service was invaluable. I know she'll continue to be involved in helping our community make some very important decisions going forward. So I want to thank Mary. Thanks.
Yeah, and I appreciate you mentioning that, Supervisor Ramirez. I'll echo that. She's been an incredible advocate, a true champion, especially for those suffering from the most serious mental illness. So thank you for raising that. And I do also want to echo that gratitude to Ms. Hafner.
Absolutely. She put in a lot of hard hours there. I was with her on the board when she served too, and very opinionated and intelligent, and worked very hard for her causes and to the benefit of many. So with that, let us go to item 33. And 33 is our General Services Agency, and I believe Marina will be doing the presentation. Let's see. Okay, and I am not actually seeing where Miss Verdina is. I'm sorry, Verdian. So we could trail that.
She's being transferred as we speak.
Okay.
It's just going to take a moment.
I will be patient.
Thank you.
And this item is authorization for Southern California Edison to provide construction services at our Government Center campus.
Good afternoon. Can you hear me? Good afternoon, Chair Parks.
Yes, we can hear you. Thank you.
Chair Parks, board members, and Mr. Powers, and members of the public. For the record, my name is Marina Verdian. I'm Chief Deputy Director for General Services Agency. And I'm here today to request authorization for Southern California Edison to provide construction services at our Government Center campus. We also need authorization for the Director of the General Services Agency or his designee to approve payment of the invoice received from Southern California Edison for construction services, and that's prior to commencement of their work. The invoice is in the amount of $305,107, and also requesting approval and authorization of the site preparation work to be completed under the existing job order contract in the amount of $128,768. So just briefly on the background, on July 10th, 2018, Southern California Edison contacted General Services Agency regarding the replacement of their 6 1,500 kilovolt ampere transformers, which are located beneath the loan area immediately east of the Hall of Justice, which you can see on the picture. This is adjacent to parking lot E. These transformers provide power to the entire Government Center campus, and now they will be replaced with two 2,500 kilovolt ampere transformers, and the new sizing is supported by our historical electrical use to date. So the replacement of these transformers is part of Edison's equipment renewal program. The existing transformers were installed during the original construction of our building, of our Government Center campus in 1978, and the replacement parts are no longer available. That's why Edison is not able to repair or replace these units in case of failure. So as part of their equipment renewal program, Edison will fund the equipment portion of this project, which will include 2,500 kilovolt ampere transformers, and also will include the cabling from SCE pool box on the Hill Street, as you can see depicted in the picture, all the way to the new transformers. The county will pay Edison $305,107 for the cabling work from the existing pit. It's basically a vault, underground vault, to the new location of the transformers on the concrete pads. And the wiring into the main switchgear also, that's in the Hall of Justice. Southern California Edison's current practice is to install transformers above grade to eliminate the hazard to personnel working in confined spaces. The county is also responsible for the site preparation work and construction of concrete pads. They are necessary to install the two new transformers. This work is being performed by the county job vendor, MTM, under a delivery order. And your board's approval and authorization for this work in the amount of $128,768 is requested. That concludes my comments and requests for today. Thank you very much in advance.
Thank you. Thank you very much for the clear presentation. Good graphics there, Ms. Meridian. Do we have any questions or a motion, please?
I'll motion to approve. This is Long.
Huber, second.
Supervisor Long moved the motion and Supervisor Huber seconded it. Could Ms. Key call the roll?
Certainly. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. So now we can move on to our next item. This is with our healthcare agency. It's item 34 on our agenda. And I believe Dr. Cho will be doing the presentation regarding the addition of almost a full-time, a 0.80 full-time fixed-term position. And Dr. Ho, are you? Yes, I see you're on. If you'd like to unmute, you can begin. And I know technology can be a little bit sticky here and there. I know I was actually kicked off of Zoom a little bit earlier today. So
I'm hoping you can hear me now.
We can, thank you.
Great. Good afternoon, Chair Parks, the CEO Powers, and members of the board. I'm Teresa Cho, CEO of Ambulatory Care, and I'm here to request today the creation of a 0.8 FTE position for a behavioral health clinician at the Pediatric Oncology Clinic. This is a licensed social worker who supports the day-to-day work that they do at the oncology clinic for children with cancer. As you know, the work there was highlighted in our moment of inspiration back in September. The work could not be possible without our social worker who provides the psychological, emotional, and social support that children and families need when they're diagnosed with cancer and look forward to cancer treatment, which can be very challenging. So my request today is to create that position, which is grant funded by the Healthcare Foundation for Ventura County with support from the National Charity League Juniors. That funding goes directly towards the support for this role at the Children's Cancer Center. And so we are very fortunate to have a social worker, and we'd like to continue that support in that role. So thank you for your support.
Thank you. And what a big heart, this whole position is that the Charity League and the Healthcare Foundation and your behavioral health department coming in. It's such a great idea. So thank you for presenting this. I'm glad that we are able to do this, and I would anticipate board support on this one too. Go ahead, Supervisor Long.
Thank you. I just agree with you wholeheartedly, Chair Parks, in regards to the hospital association and the National Charity League, Ronald McDonald House, just our staff. Dr. Cho, thank you for just making sure that this happens. Really appreciate it, the efforts for our community, especially those with cancer. Those families are really lucky to have this. So I would motion to approve. Thank you.
Second the motion.
Motion and a second. Ms. Key, could you call the roll?
Certainly. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, and thank you, Dr. Cho, our CEO of Ambulatory Care.
Thank you.
Now we'll move on to item 35. This is with our public health agency, part of our healthcare agency. And presenting is not doctor, but famous Rui Roberto Vargas.
Thank you, Chair Parks. Good afternoon, board members, CEO Powers. So very briefly here, this item is to request your approval and authorization for the county purchasing agency to renew our contract that we have for the medical director for our children's medical services. Dr. Shaw has been with us for 3 years, and so her contract is up for renewal. She's done a wonderful job working with our team to provide case management and medical oversight of services provided to very vulnerable children in our CMS, CCS, and medical therapy unit programs. And so, again, this is to request an additional 3 years and also to further align it to a fiscal year basis. The first year is being extended a couple of months, but after that, it'd be on an annual basis up to 1 year renewal periods. So I'll be happy to take any questions. Thank you.
Are there any questions from our board or a motion?
Huber, move approval.
I'll second.
Okay, a motion and a second. And could we have the roll?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. And it was great to see some of the new equipment that we have from our grants for the public health department out there at our vaccine clinic over the weekend. And I'm just really happy to see that we have funding that is going into that public health department that's so vital, that's going to be able to support people long into the future, past this pandemic and all, even though those were the funds we were able to get for that. But thank you for bringing this approval item before us, and that does pass unanimously.
Thank you.
And that concludes the regular agenda items. I'm sorry that we had to wait for our break, but and that item 40 begins our agenda items before us. And we have several staff members, and I'll start off with Mr. Powers to kick us off on this one.
Yes, thank you, Chair Parks and board members. So we'll get right to it. We'll hear from, I believe, RMA is up with Kim Prilhart, Agency Director.
Good afternoon, board members. There's our presentation right there. So good afternoon, Chair Parks and members of the board, CEO Powers, and of course the members of our public. My name is Kim Prilhart. I'm your Resource Management Agency Director here at the county. And I'm here today to present for you an overview of RMA, our agency's response to COVID, as well as our planning 21-22 preliminary budget. So next slide. I always like to start with our agency's mission because I do believe that it's important that everybody understands what we're here to do, and that is to protect everyone's health, safety, and environment by effectively and efficiently carrying out our adopted laws and policies and educating, assisting, and empowering all of our residences and all of our businesses to make Ventura County a better place. So what we present and what we do this with our mission in mind. And next slide, please. I want to start just with our organizational chart so you can see how we're organized. We have 5 divisions. All of our directors are also on the call today in case you have any specific questions of them. And under these 5 divisions, we administer over 50 separate programs, and they are diverse programs ranging from ocean water safety, our restaurant inspection program, our vector control program. We issue all of the film permits and the unincorporated county. We have a tree protection and mitigation program in the county. We do all of the short-term rentals. So there's a lot that happens behind the scenes for all of these programs, but I wanted to let you know the scale of what happens in our organization. Next slide. And I also want to start out by highlighting how we were able to really transition very quickly and as easily as possible into COVID. So we transitioned to online services for permitting for our building department, our planning department, our environmental health. We transitioned to electronic plan review, which our customers really enjoy. They don't have to print and haul in these big plans anymore. They can submit them all electronically. The plan checks happen electronically. They can pay for their permit electronically. But with that being said, we still have a way for people that is not what they like to do. They can mail in checks. We still have applications that folks can fill out. So between the two, we have not missed a beat in moving forward in processing all of these types of permits for our constituency. We moved very quickly to public hearings, as did our board. We have a planning director hearings, planning commission hearings. We staff the mobile home rent review board, the cultural heritage board, the environmental health appeals hearings. All of those hearings, over 70 in these categories alone, happened in the past year during COVID, and they happened really successfully with a great amount of public participation. So next slide. And in our responses to COVID, a lot of this is familiar to your board. Of course, we stood up and managed the ambassador program for all of our business registrations. And we had those great consultative inspections with our business community, and we coordinated that with all of our cities. And we have today over 16,700 businesses registered on that site. This next number is staggering even to me. This COVID hotline and the emails, we've responded to over 51,000 inquiries for emails and phone calls alike. And your board has waived over $1.6 million in environmental health fees for our businesses. And we're looking at proposing a $2.2 million fee waiver for our next year. That number is not finalized yet. We're still combing through all of our programs to see if there's other fee waivers that we can do. This is for the majority of those businesses that were really significantly impacted by COVID-19, for the businesses that we have the ability to waive fees for. So for instance, we're waiving them for the farmers markets and for food courts and for restaurants and for body art practitioners. Those were all very heavily devastated, but so are gyms, right? But we don't have a fee in resource management agency for gyms unless that gym happens to have a swimming pool. So we're looking at all of our fees, and we'll be back to your board with the exact amounts of what we believe that we can do in that space. Also, for our COVID-19 compliance, so this is through our environmental health department, inspected 900. So our Coupa facilities are our hazardous material, or anybody that stores hazardous material. 5,204 food facilities. That's a lot. There's an actual inspector on the ground at each one of those and each one of those pools and spas that we went out to. We were happily able to have a disaster service worker from our resource management agency work with our AAA agency on that meal delivery to seniors. But we were really grateful for the disaster service workers that we received from the agencies such as probation and fire and harbor, and we're able to have one of our retirees come back and help us because, you know, these 51,000 phone calls, we really needed help from our disaster service workers, and they really rose to that occasion. So overall, over $2 million in staff time for our COVID response efforts. Next slide, please. And now just to our budget, here's a quick overview. We have a $33 million budget. You can see the vast majority of that is in our staffing, $27 million for staffing, 201 allocations, probably about 190 employees right now, including extra help employees. And we have a $6 million preliminary budget for services and supplies. Next slide. This is the way that we look at our revenues. So we achieve our mission largely through permit, licensing, registrations, 64% of our budget for that, 2% into grants. And right now we're looking at this 34% contribution from the general fund. Just for information, last year it was at 29%. So that increase really comes from the fee offset waivers that propose 2.2 million or greater, and also the new planning positions that your board has recently supported. Next slide. When we're preparing the budget, we always like to see where we're at with our surrounding counties. And so we are right in the middle. This is a sample building permit fee for a 2,000 square foot dwelling. You can see Kern on the low side, Monterey on the high side. So this is all of the fees that the building department collects. The one kind of larger fee that isn't in here is the school district fee. Of course, they go right to the particular school district and pay that fee. Next slide. We're also always carefully looking at our hourly rate in our planning department. So you can see Kern still on the low side as expected, Santa Barbara at 242, right? We're at 167 right now, and really this is very much because your board has supported keeping this rate flat for the last 8 years, and so the general fund contribution kicks in here when we have things like market-based raises, and so that rate has stayed relatively flat because your board supports that effort. Next slide. I have a couple of slides that will just highlight. I won't go over all of these individually, but I wanted you to just see sometimes the scope and the breadth of what happens. Here we are constantly looking at our strategic plan. We fit in a lot under this good governance and financial stability. So all of these things that we're doing, I mean, 14,880 inspections for mosquito breeding, right? So this comes from your board supporting 8 seasonal techs to do this work, to go out to these barrancas and making sure that we're taking care of the mosquito breeding sites that happen. We also have 3 full-time staff that do this. 159 foodborne illnesses, those are very important. 10,000 measuring device inspections. That's where our public confidence comes in, that when they're buying a gallon of gas, they're actually receiving that. Same as on the retail scales. If you go through a retail store, that you're actually getting scanned, what the price on the shelf says that you're getting scanned. Next slide, please. This is also just more of the work that we do, 200 temporary rental units. We go out and ensure that those are safe for the public before they are rented out to the public. 2,500 building permits issued. That's great for our economy, right? And 15,000 separate safety inspections are done on those permits. We also issue a lot of zoning clearance. That's ministerial, over the counter. If you want to come in and build a house, a remodel, addition, a pool, remove a protected tree, we want to take a look at that. So that all happens at the zoning counter. Next slide, please. Your board is very well aware of our general plan update. You approved that back in October of 2020, and this fits under the environment, land use, and infrastructure component of the strategic plan. It's a great plan implementing policies for the next 20 years. It was exciting to be able to put a new agricultural element in there, an economic vitality element, as well as water. And of course, that we carefully looked through and put policies in place to address environmental justice, and then your board's healthy communities ordinance that you put through several years ago. And then of course, it also involves a climate action plan. Next slide, please. So here are some of the future projects that we're working on. We have our building official has worked with an architect for these new and improved farm worker dwelling and accessory dwelling unit standard plans. And these are 700, 900, and 1,200 square foot if you want to come in and build a accessory dwelling unit or a farm worker dwelling. And we do those ministerial over the counter, about 40 right now per year. You can have the plans already pre-approved, so you wouldn't have to pay for the plan check process. They'll already be pre-approved. So we're going through those plans. We're going to create a website and do a big press release. So we want people to know that those plans are here free of charge. Also, your board directed that our building official come back to you, and they will later this summer, with new construction provisions to address new building in high fire hazard severity zones. And then your board is familiar with the 2.5-year work plan of the planning department that you recently approved. And what's very important to me and high on my list is this digitizing all of our agency records. And really for the ease of public access, we want the public just to have access to the records without us having to scan them and send them to them. So we're working very hard on that. Our building department is almost complete. Our environmental health department is working, and our planning department is getting started this fiscal year on that project. Next slide, please. And then just our accomplishments, you know, I couldn't be prouder of our staff and their response to COVID. You know, starting with day one with our IT staffs, you know, we sent home 150 staff to work remotely, and that takes 150 laptops or the ability for them to work from home. And within 3 days, we were up and running and business as usual. So very grateful for our staff to have such a great attitude. No matter what we asked them to do, they responded in a helpful manner each and every time. We already talked about the general plan update. Your board recently approved the Somas Farm Worker Housing Project, which was one of the most exciting projects in my career as a planner. 360 beautiful, well-sited, low-income housing for our farm worker community. Very excited about that. They are already in here in the process, working through all of their conditions in order to get the construction started. You recently approved the Toland landfill permit modification. Our construction permits for the new health unit expansion at the Todd Road Jail were done, and we were happy to certify 2 new fire stations for occupancy in the county, both in Thousand Oaks and in Newberry Park. So that's what I have for you. I think the next slide is probably if you have any questions for me.
Wow, that is a lot of positive things happening. And, you know, it's interesting that part of it was expedited because of COVID, you know, the having to, you know, that we had the technology pretty much in place so that it could happen as quick. So it's a real credit to your department on that. Supervisor Levere, you have questions or comments?
Yes, thank you. And Ms. Perlhart, thank you for that presentation. It really is incredible seeing how you and your entire department were able to adjust to our new COVID reality and still keep things moving forward. That's so important and just very impressive. One question with regards to the environmental health department and the waiver of those fees, do we know if any of that can be reimbursed through the CARES Act or other federal programs?
Maybe Mike would know the answer to that. I think that
yes, thank you, Supervisor Levere. Right now, the guidance tells us it is not available. It is not eligible for CARES. Could be ARP, but so on this one, we would be recommending general fund reserves.
Okay, thank you.
All right, good question. Supervisor Long, followed by Supervisor Ramirez.
Thank you, Kim, and all of your staff. Unbelievable work that's being done. I wanted to ask in regards to our IT, as you said, we're putting more and more online, and I'm wondering about the archive of information, if that will be scanned and put up into this cloud world so that permit processes and information can be easily accessible. Is that part of the budget? Are we currently doing that? Do we need to do that? Wanted to ask.
Thank you, Supervisor Long. That's a great question. A lot of that is available to the public through Citizens Access on Acela. So if you're in here processing a permit, you can see where your permit is at every stage. But what we are working on right now is getting all of our boxes out of storage over the old permits that we've issued over the last 70 years, right? And scanning those in and digitizing to make sure that those are available to the public to review through a Public Records Act request, right? They could go and access those documents easily themselves.
Okay, so that is a priority of ours. I just am understanding, I've talked to you in the past about public record requests and how long it takes to get it and so forth, and trying to find some relief for your department in regards to that information.
Yeah, we do get a significant amount, over 600, probably well over 600 Public Records Act requests a year. So we're always in our data, trying to locate and gather that information as quickly as possible for the public. But I do believe this step moving forward is going to, to make it easier and faster for everybody to get the information that they're looking for.
Okay, great. Well, I really appreciate that. I think it's an important step for our department to be investing in scanning all that information together. Thank you. Appreciate it.
Thank you.
All right, and then Supervisor Ramirez.
Thank you. Thank you, Mr. Hart. I was very impressed when I had that introductory meeting. My staff and I met with you and your staff, and it was pretty awesome, the work you're doing and the great work you're doing. And I always think it's so important for the public to understand what it takes to keep our county healthy, people healthy. And sometimes people think of it as just bureaucracy, but there's a reason for it. And I really appreciate what you and your staff are doing. But just following up on Supervisor Long's question about the records, are they going to be destroyed? Are they going to be kept somewhere, the original pieces of paper? Sometimes they have quite a historical value, even though it's some people might just think we should just throw in the trash.
Yeah, I think so. There's a lot of records that we would keep that has historical value, but the things that we can digitize, we will digitize. And so we have thousands of zoning clearances at the counter, that go back from the 40s, 50s, that are just usually one piece of paper and a map. Right. So eventually we pay to store those documents. So eventually we would not be keeping those.
How will somebody will be advising though on what's historical and what's not? I hope. Okay.
Yes.
Thank you.
We're very careful not to get rid of historical documents.
Thank you.
Madam Chair, I had one other question I forgot to ask. In regards to the fees and waivers, I agree with Supervisor Levere that we definitely need to be focused on that. I sent you information on what Santa Clara County is doing, and anything we can do. I know we don't. We have to be very cautious with our funding. I hear Mr. Powers talking about the general fund dollars, and so anything we can do with the ARP funding, COVID, relief from the state or federal, I think we should definitely look into waiving as much as we possibly can. So thank you.
Thank you. It would also be helpful, and I guess it's coming in a future board item, is to kind of get that list of fees that we are waiving and just kind of get that collection all together, because I think that says a lot and would be very interested in seeing that list. Thank you, Ms. Prilhart, and take it back to Mr. Powers on this.
Thank you so much, Chair Parks and Kim. I won't be able to do it justice, but Kim's leadership during this from the get-go of this pandemic has been extraordinary. Her whole department, the Business Ambassador Program, I've said it many times, but I don't know of another county that did this. There are over 16,000 businesses that they personally visited to consult with and help and assist. Ambassador word was chosen for a reason, not enforce, not heavy, but to help and ensure public health and safety. And she partnered beautifully with the city code enforcement people. It was extraordinary and really helped our overall cause. And just the work that they're doing every day is amazing. And also want you to know too that we're keeping our working hard to try to keep those fees at a reasonable level. And so sometimes we put in general fund dollars as well, because we know that has a big impact on our businesses. So it is something that we're mindful of. And I appreciate Kim sharing the comparative rates, because we do check to see, we want to make sure we're in line and being sensitive and thoughtful to our businesses. But just overall, I mean, it says $2 million in staff time for COVID response. That doesn't begin to capture the quality of the work and the support for our entire county COVID response. So just want to say that. Thank you.
Yeah, and Absolutely. Thank you for pointing that out. When Ms. Prilhart moved on to becoming the director of RMA, I thought she was getting an easier position, because she was in the, doing all that hard work in the planning department. And there was a lot of projects coming through at the time too. And it was weekends and the whole thing. And then COVID comes along and she's heading the entire outreach from the county to all our business communities. And it was just pretty remarkable, really remarkable, and a good team that she had behind her on that too. So kudos to you.
I don't think she'd know what to do with an easy job, frankly. So
I thought this has got to be easier.
Yeah, right, she'd be bored, unflappable. But you said something too that just is true of all the departments, but the employees, her staff there at RMA, so professional. Everybody, every business we talked to was so appreciative of the professional way that they were treated. So thank you.
Thank you very much, Board. I appreciate your support.
So I think next we are going to the county library, folks, with Nancy Schramm. Does that sound right?
Yep.
And Ms. Schramm, I see that you're already out there. You're unmuted, and we can move over to you with our key. There you are.
Okay, good afternoon, Chair Parks and Supervisors, Mr. Powers. I'm Nancy Schramm. I'm the Library Director for the Ventura County Library, and I'm here to give you an update on the library and some information about the library's preliminary budget. Just want to make sure you can hear me. Are you able to hear me?
Yes, we are.
Okay, very good. All right. So at the Ventura County Library, the mission is to inspire our community to explore, discover, and connect. Our libraries are cornerstones of healthy communities. They are a unique and valuable core resource that levels the playing field by making information and technology freely available to everyone. Our libraries are key in bridging the digital divide and providing educational opportunities to all. And in 2016, our Ventura County Library celebrated 100 years in operation. Next slide. So through strategic and intentional planning at the library, we have specific goals and objectives that are very much in line with the county's overall goals and strategic plan. But we've also established core values, and these are core values that prioritize the values in delivering services. So it is absolutely vital that we provide excellent customer service. It is the most important thing we do at the library. And in fact, we have established customer service standards for accessibility and courteousness and efficiency. But we also look at the services we deliver through an equity lens. It is very important that we strive to remove barriers to access for library services. And I'm really proud to say that in 2017, our library system established a statement of inclusivity, and we believe that libraries are for everyone. Next slide, please. So our legal service population at the Ventura County Library is just under 250,000, but we have over 300,000 registered card holders and active users. So anyone who resides in the state of California can receive a Ventura County Library card free of charge. And the Ventura County Library system provides services to all Ventura County residents and serves unincorporated areas and cities or areas within cities which are neither served by a city library nor within the boundaries of independent library districts. So that does include 4 cities, Port Hueneme, Ventura, Ojai, and Fillmore. Next slide, please. So where are we located? The map shows our 12 library locations. We also have an administrative office, and we have a virtual library online that's available 24/7, and a mobile library that visits many underserved communities throughout the county. Next slide, please. We have 62 FTEs, so total permanent employees are 83. And we also have 26 extra help hourly as needed employees. So a total of 109 employees at the Ventura County Library System. Next slide, please. The library system offers free access to materials in print and other formats, books, ebooks, audiobooks, e-audiobooks, magazines, music, movies, and videos for checkout. But we also offer many other programs and services. We have computer labs, high-speed broadband for public use. We have Wi-Fi at our library facilities, and we do check out laptops and Wi-Fi hotspots for remote use as well. And those are key for folks who are trying to conduct business or participate in online learning or connect to telehealth and have no access to a computer or the internet to do that. Next slide, please. We also have early literacy and story time classes, homework and tutoring centers, our annual summer reading program that really stops that summer slide when children are out of school in the summer, maker spaces featuring 3D printing and other STEAM equipment and activities, computer coding clubs, and access to more than 50 databases and online resources. Next slide, please. Our libraries provide collaborative workspaces and meeting rooms. We offer a whole array of free programs for our community members, things like financial and digital literacy, small business programs, and we've been working really hard to increase the items in our library of things. And one of those items that we now loan are do-it-yourself home energy savings kits. And these kits were made possible by a partnership with the CEO Office Sustainability Division. And thank you to Chair Parks for her role in making that program possible. And as I mentioned, we do check out computers and internet hotspots for remote use as well. And the library system has numerous community partners and offers so many collaborative programs and services at locations other than branches throughout Ventura County as well. Next slide, please. We have a very robust adult literacy program at the Ventura County Library. This is a program where we offer one-to-one reading and writing instruction for adults. This is really key, especially here in our county, where a study showed in 2017 that we had over 121,000 people who live in our county who read below a 4th grade reading level. This program also has an ESL component, so English as second language instruction. And through that adult literacy program, we also offer the Career Online High School program. This is an online program where adults can sign up and earn a high school diploma. So not a GED, but a high school diploma for free to the student online. This program was implemented in 2016, and I'm just so proud to say that we have 24 graduates to date. And the picture you're seeing on the slide there is a group of recent graduates. Next slide, please. We do have the 24/7 online virtual library available at gincolibrary.org. There's a library mobile app you can download to your device by searching for MyVCLIB in your app store. And we have a tremendous presence on several social media accounts. So please follow us and connect with us there. Next slide. And I want to talk a little bit about the impact of the pandemic on the library. So our library facilities closed to members of the public in mid-March of 2020. And I am just so proud of our library team. They just stepped up and really almost immediately, within weeks, transformed service delivery to meet the community needs during the pandemic. They just pivoted so quickly to adapt to changing needs. Next slide, please. Pre-pandemic, our library buildings across the county were open for a total of 416 staffed hours a week, and we were delivering on average 360 programs of all kinds for all ages each month. Next slide. When the pandemic hit, many of our library staff members were called upon to serve as disaster service workers. So out of our 109 total library employees, 45 served in some capacity as a DSW. That's 42% of our library employees. And I'm told that that percentage is a higher percentage than any other county agency. So again, just so proud of our library team that they stepped up and helped out the community in these critical roles during the pandemic. Next slide, please. And as I said, they transformed services. When our libraries closed in mid-March of 2020, within a month, our team was already delivering programs online in the virtual environment, so people could still connect with the library. So for example, on Facebook, from April 2020 to present, there were 466 storytime programs presented and almost 62,000 unique viewers of those programs. And that's just on Facebook. On YouTube, during the same time frame, staff produced 301 videos for people of all ages, and there were over 18,000 views of those programs. Next slide, please. It was very important for us to provide access to our library collections, our physical collections, as soon as possible. We were able to do that in July 2020. So that was extremely important and heavily used by the public. Just in 7 months from July 2020 to January of this year, there were over 27,000 pickups at our Ventura County libraries. And we circulated an average of well over 15,000 items per month. We also established a partnership with the Ventura County Area Agency on Aging, whereby they provided the library with supplies such as face masks and hand sanitizer, and we were able to take those supplies along with information out into the communities with our mobile library. So in that way, we were really able to respond to the pandemic and reach those areas hardest hit. Next slide, please. In September 2020, your board approved the library to go fine-free on a permanent basis. This is just key in helping us to remove barriers to access to library services for those who need them most. Also, in a direct response to the pandemic, we implemented live online homework help program, and from July 2020 to February of this year, almost 2,000 students were tutored with that program. And that program offers tutoring in both Spanish and English. Next slide, please. We also implemented an online chat service to assist customers. And from March of last year to January this year, we issued over 25,000 people digital library cards, and many of those folks were students who needed to connect to library resources for homework assignments. Next slide, please. We also were able to give out nutritious lunches at the Avenue Library in Ventura. We provided during the summer of 2020, 600 nutritious lunches to children who were out of school, plus those lunches came along with books to build home libraries and increase literacy skills, and we were also able to distribute grab-and-go STEAM activity kits to increase knowledge of STEAM skills and also provide activities for families at home. Next slide. And the usage of our e-book and e-audiobook collections really increased during the pandemic. So during the pandemic, there was a 25% increase in usage of our electronic audio book collection, and our electronic book collection saw an increase of over 75% in usage. Next slide, please. The Ventura County Library System is a dedicated property tax library. So there is that separate property tax for libraries. And that dedicated property tax is the primary source of revenue for the Ventura County Library System. However, we also receive an additional contribution from the County General Fund in addition to support from the city served. And we also receive supplemental support through grants and private donations. Next slide, please. We are showing a balanced budget for fiscal year 2022, and we have funds reserved for one-time key and much-needed library projects, including the Fillmore Library Expansion Project, which is slated to break ground in fall of 2021, and the relocation of the Miners Oaks Library to the campus of the Miners Oaks Elementary School. We do have assigned education fund reserves sufficient to cover these projects. And still a very healthy balance in those reserves at 32%. I do really want to express the fact that the contributions that are coming to the library from the general fund and matched by city served have had tremendous impact on our library collections budget. This was something that was very important over the last couple of years for us here at the library, and we've been working very hard to enhance those collections and update those collections. And through contributions from the County General Fund and the city served, we were able to see a 47% increase in our collections budget over the past 2 years. We also continue to have conversations with all the cities that we serve, and those conversations are ongoing regarding levels of support. Next slide, please. So again, preliminary budget for next year shows it is balanced, and that includes those use of reserves for the one-time expenses. Next slide, please. So state funding, ongoing state funding for libraries has collapsed and is really not available to libraries at this time. And so library funding has been stable, but it's also been very stagnant and generally not increasing as costs increase. As I mentioned, some of the cities served have recently stepped up support, and the county has matched that support. The library has also proactively sought and received one-time grant funding, including $250,000 grant from the state library that we received this year to establish a partnership program with First Five of Ventura County to offer parent and child together classes for families. In this environment, we do use technology and innovation and reorganization to maintain services, create efficiencies, and improve customer services. And our budget is supplemented by additional funding we receive from library support groups. The Ventura County Library Foundation was formed in 2012. Without that foundation, we would not have been able to put the mobile library on the road, for example, and we have tremendous Friends of the Library groups in many of the communities we serve, and we acknowledge them and we thank them. I also thank your board for your support of the Ventura County Library. And next slide, please. That concludes my presentation, and I'm happy to answer any questions if there are any.
Thank you for the presentation, Ms. Schramm. And also thank you for your support for all the innovative things that we're doing with our libraries. Supervisor Ramirez, would you like to ask questions or comment?
Just a comment, Ms. Schramm, you met with my staff a couple of weeks ago, and we were very impressed with the services and how you've all stepped up during the pandemic. Thank you so much. Libraries are so important to our community, to our democracy, and it's like one of my favorite places to go in the world, and since I was a little kid. So I'm looking forward to getting back there. Thank you.
Thank you.
And Supervisor Long, and then Supervisor Levier.
Thank you so much, Nancy. I just really appreciate the efforts. Our constituents in Fillmore just wanted to pass along the gratitude with really working to extend that library so that our community can really use it. And then also your project with the Hill and having off hours where there's a pass where you can go get books. I just think that's just something that we should see if we can do at all of our libraries. I think it was very impressive project and really just support it. So thank you for the continued education of our community and also the mobile buses. Thank you to the Library Foundation for coming together and raising those funds. It was great to see in the community and it was right at the right time. So thank you. Thank you.
And Supervisor Levier.
Thank you, Madam Chair. And I just want to say thank you to Ms. Schramm for two reasons. One, it's incredible your department's commitment to our disaster service worker program and everything you've done to kind of step out of your comfort zone and contribute to that effort. Thank you so much for that. And please pass that on to all of your employees as well. So great to see that. And then secondly, it's a personal thanks. When COVID hit last March, and I have two little girls, a 7-year-old and a 3-year-old. We were looking for stuff to do. And the fact that you were able to transition so much stuff online and give families like mine things to do with our kids during some of those really difficult months. I'm sure many other families feel the same way. So thank you.
Thank you. I was going to comment that too. For a while there was no school at all before the schools came online. And to be able to have the ability to just listen to books being read by our librarians, that story time meant a lot to the little ones, particularly in, saying when you have 62,000 and plus another 18,000 on YouTube, it's a lot of people that are connecting in and really enjoying. And it is something that we lost the ability to go into the libraries. And I agree with Supervisor Ramirez. I really look forward to being able to do that again. It's one of our favorite places for sure. And then just the innovative stuff that you're doing. We love the bookmobile. I'm so glad that it got up and going. And then being able to use that during the pandemic really made the students again feel wonderful. I know out in Somas, which was kind of my vision for the bookmobile when we first put it forward, is like, let's get it to these schools, and how the students just loved it. They weren't in school yet, but they could come together on the front lawn and on a day and pick out books. That was wonderful. And then you You mentioned the do-it-yourself, the DIY do-it-yourself program that we were doing, that you just grabbed the ball on that. Something I recommended from Sonoma County, we're doing it. And here residents can go to the library and get a toolkit that includes, everything from the LED light bulbs, low flow shower heads, weather stripping aerators that you can install, and just some wonderful ways of making your house more energy efficient, more water efficient. And you can, you get these for free and then return the toolkit, when you're done testing your bulbs and all that to find out how much of your use is. So that was wonderful. And you jumped in right there when we were looking for the library program for portable power supplies. That was just about the time when the state stepped in and actually made a law, so the energy companies have to provide those. So we stepped back, but just your willingness. I love your energy and your willingness to do these things. And it's great to hear the good things of our library. We don't often get you in front of our board, so we are lauding you while we can. So thank you.
Thank you so much for your support. Thank you.
If I may, Chair Parks, just to chime in too, it's such a mix of old school and new school, I think, because the libraries themselves are wonderful places, and you've done a great job, Nancy. They're very welcoming and warm and great places to be, especially for kids and story time and all that. But because of technology, the mobile unit and all that, you also take the library out to where people are out into the community. You expand it so much, you expand the reach. And, with the hot spots, and one of my favorite ones, over 300,000 library cards. That's a lot. Right? I mean, it's just stunning. And it's not that she's passionate about it or anything, right? That doesn't have anything to do with it. Last thing I would say is, just as Supervisor LaVere mentioned, your commitment to our COVID response, 42% of your workers, I don't know how many, 45 staff, for months and months on end, helping with the vaccination sites and stuff. This stuff doesn't happen by accident, and just with great spirit. So just deep gratitude. Thank you.
Thank you.
Thank you for the presentation. And next up is it Victoria Jump with the Area Agency on Aging?
Yes.
Excellent. Hi, good afternoon, Ms. Jump.
Hello. Good afternoon, members of the board, Chair Parks, CEO Powers. For the record, I'm Victoria Jump, Director of your Ventura County Area Agency on Aging. Next slide, please. Since we have some new supervisors, but also members of the public that may be watching, I thought I would just give like a quick overview of what we actually do as an agency. So the role of our agency really is to provide the leadership in addressing issues that relate to older Californians, work with community agencies, and really develop community-based systems of care and services that support older adults' independence. And really our overall goal is to keep people in the community and out of nursing facilities for as long as it's possible for them, to live in the community. We are not, against nursing facilities at all. We are incredibly supportive of them, but we believe that there should be an option, and people should have the option to live in the community if they can. One of our other roles is to really enhance and support those existing community-based service provider systems of care, and also to support citizen involvement in planning and delivery of these services. And we have a 39-member advisory council that really represents all of our cities, your board, different agencies in the community, and different populations, because we want to make sure that when we are developing and we're planning and developing these services, that we actually involve people that are going to use them, caregivers of individuals, but also, with the lens that what we're going to develop is what people need. Next slide, please. So this slide should come as no surprise to anybody, but it shows the incredible growth in the older adult population in our county. Last year, we hit the mark where we have, for the first time, have more people over the age of 60 in this county than children under 18. And we will see, through the next 30 plus years, that continued rise of the over adult population and the gradual decline of the number of people under the age of 18. So right now, we're about 24% of our total population is over the age of 60. By 2030, it's projected to be about 29%. And by 2060, we should be about 34%. Next slide, please. So with this growth in the population, it should come as no surprise, really, that we've seen an increase in the number of customers that have come to our agency for services. And these are the unduplicated customer count. And so going back to 2010, so about 10 years ago, up until last year, and this last year numbers are pre-COVID number. So we were serving about 30,000 unduplicated individuals as of the end of last year. We expect the number to be higher this year because of COVID. However, we don't expect it to be like this huge, crazy increase. Really what we've seen is the people that have come to us over the years have continued to come to us during COVID for help, but also we've gained new customers as well. Next slide, please. So our funding that we receive to provide services for older adults and people with disabilities in our community is a mix of federal funding, state funding, and also county funding as well. These are some of the services that we provide directly to the community. So we provide information and assistance, health insurance counseling, like help with your Medicare, and your insurance options. We have a benefit enrollment center where we can help people fill out applications for public assistance. We have one of the 6 aging and disability resource centers in the state, and we do this in conjunction with our independent living resource center that serves people with disabilities. We have a variety of long and short-term case management, and some of these are Medicaid funded, and so they're waiver programs. We provide transportation. We have a very robust fall prevention program, and it's the model for the rest of the state, and this is something that your board provides funding for. We also have a home share program where we match people that have extra space with people that are looking for rooms to rent, and this is also a program that is funded by your board. We provide home modifications, in-home assistance like personal care, homemaker, chore. If people have hoarding issues, we provide services to clean that up as well. We do counseling for individuals. We provide meals, congregate and home delivered. We do nutrition counseling. We have a variety of evidence-based classes, transitioning people out of nursing facilities back into the community. We have a small employment training program for older adults that are looking to reenter the workforce. And we also provide support for caregivers. For these programs that we offer, most of them are just based on the person's functional need, and some of them are income-based, but not all of them are. Many of these are age-based, so you have to be 60 or over, but not all of them are as well. So we do serve, from birth to death. So we have one of our programs, long-term case management program, we have children that are on the program. So really we go about 2 years of age up to 107. Next slide, please. So although we run a lot of programs directly, in some cases we contract programs out with our community service providers. And so some of the programs are, the nutrition program, we have contracts with cities to provide that program. Legal services, our long-term care ombudsman, who really is the watchdog for our nursing facilities. And then we fund the emotional support warm line for the county. We have 3 family caregiver centers. We run the one that serves monolingual Spanish-speaking caregivers directly, but we have one in Camarillo, and then we have another caregiver center out in Thousand Oaks, and they provided a variety of services as well. Next slide, please. So in the earlier slide, I showed you what the growth in the population looked like. And it's also, this is kind of our information and assistance line is really the bellwether of what's going on with the community. And as we see things change and people's needs increase, we start seeing a lot of additional calls. And so going back to 2010 or 11 and 12, we had, about under 7,000 calls. Last year, we closed out last year with receiving over 54,000 calls. In the first 6 months of this year, we already hit 41,000 calls. And so we've seen a significant increase in the call volumes. And it's everything from, I need a ride to vaccine appointments. I need food. I need help in my home. It's just whatever the need is, we have a team of trained social workers that are there to answer the calls. Next slide, please. So this is what our preliminary budget for this coming year looks like. And I should say that this is our baseline funding, and it doesn't include any, COVID related stuff. So this is our Older Americans Act funding, state funding, other program funding. So it's non-COVID. So we have a dedicated team of 44 FTEs plus some extra help. And I really feel privileged to be able to lead this small but mighty team of brilliant, dedicated, caring people who make everything possible. People look at what we do and they say, how can you do this much? It's because I have this team who, when an idea comes up, they figure out how to do it. And really they're dedicated to serving older adults and people with disabilities and caregivers and really providing that choice of where you live and how you live and making sure we have services. So, we do know what our preliminary estimate is. What we don't know is how much additional funding is coming our way, which we think, based on what the state is saying, it could be, significant additional funding that's coming. So we do know that there's additional funding that's coming for the Aging and Disability Resource Center. We are one of 6. We have funding under the Consolidated Appropriations Act. We don't know what that is going to be, and that came in December, and that will be for meals. So more meals. We know that we have money coming under the American Rescue Plan for funding. More meals, which is more money for meals, which is great. There was money set aside for CDC and the Administration for Community Living. They provided $100 million nationwide to increase vaccine access. We will be getting part of that. There is a federal push right now to double the amount of funding for area agencies on aging, which is, long overdue and will be great. And there's also a state push right now to increase nutrition funding as well. We're all aware that you have a great number of people on, Great Plates, these other programs, that it's not sustainable. Given what the need is, unless the state and federal government come up with more money. And so there is the push to do that right now. Next slide, please. So given that we are a small but mighty county department, we are, incredibly lean, and we're always looking for ways to do things, quicker, be more responsive to our population, and to keep our costs down. And so we do Lean Six projects frequently, throughout the year. Some of the things that we are looking at to try to really increase what we're doing is working with GSA on a project to do an automated invoice instead of having to have somebody key in every invoice. The system does it. It comes in and it's automated. We've done an automated phone tree with IT services. Before we had to, each individual call, somebody had to pick it up, and now it's really routed to the expert on the team that can handle that call. We've done redesigning our website and pushing forums and training online. We've done a lot of work around data reporting, putting services online to consumers that can access things online. with our program to get our elder help program provides all of the in-home services. And so we've done a lot of process improvements to reduce the handling time and get help people quicker. We've done work related to some of our case management programs to really streamline how individuals do their job to make sure that it is the most efficient way to do it, and that we're not adding additional barriers that shouldn't be there in anybody's job. Next slide, please. So some of our current and future initiatives that we are working on is really developing a centralized database of all of our customers and programs. And this is something that we are working on with the state. Right now, it's, the state has a different database for every program, which is madness when you're trying to figure out like how people really access services and what the true needs are. We are working on our meal program stabilization and what that transition looks like, and really doing a deep dive into our data and really looking at it and making sure the program of the future is equitable and that we're really getting to those people that are most in need and figuring out, looking at the demographics of the county, if there are a particular group that was not representative, why? Do they not feel comfortable coming forward? Is there a need there? So we are looking at that. Part of that is the gap analysis for determining what the unmet needs are and the underserved and unrepresented populations. We are working on Project Lifesaver with the Sheriff's Office, which would be a tracking system for individuals with Alzheimer's and related dementias. And so they would have a wearable device. They go missing, the device is turned on. They can find them in a matter, in a half an hour versus days of sheriff's time trying to spend finding somebody. We are still working on dementia-friendly Ventura County. It's important to us, and I know it's important to your board that our county is dementia-friendly, and so we continue that work. And then we also have a project we're working on with the library system. So Nancy didn't really mention it, which is good, so I'll talk about it briefly. But so we are going to be providing Chromebooks to the library for older adults and people with disabilities and caregivers to be able to check out. And so they'll be able to access resources, classes, whatever they want, they will be able to do it. And so it will be coming with the Chromebook, but also the Wi-Fi access. And we're looking at making sure that those are equitable throughout the county, but also looking at those areas where that may be most low income that are going to need them the most. So those are some of our current and future initiatives. Next slide, please. So for our COVID response, and this I think shows, really our COVID response shows the best of county government. It really has taken a village to be able to respond. And, I look at, Kim presented earlier, we could not have done Great Plates without those inspections and making sure those restaurants were actually, serving food, using the hygiene guidelines that they're supposed to. We have, library workers that have been here for almost a year as part of our efforts as well as a lot of other county agencies that have freely given of their employees and their time and expertise to help us. So just to highlight some of our COVID response, we've had, the food pantry and restaurant partnerships. We've received more than 70,000 requests for assistance from the community. More than 25,000 people have been served. We've been able to provide porch visits instead of home visits with our social workers to put an eyeball on people and just make sure that, even though that they are, home, that they are not totally isolated, that they actually see somebody, and that, if something is wrong, we know, and we can, make the reports. We've done a lot of community engagement with flyers and videos. We've provided COVID care kits. We have animatronic pets that we've been able to provide our clientele that are part of our long-term case management programs, including those with Alzheimer's and related dementias. We've provided rides to vaccine appointments, rides to testing sites. We have the partnership with the library system. Next slide. So overall, since the pandemic, there have been over 4 million meals served. And this has taken the effort of 63 plus disaster service workers that have been here. We did the calculation, and over all of these organizations and partners are really supportive by over 574 volunteers that have helped out, and 627 plus employees. And the 627 employees are employees from our partners that are doing the actual meal service and delivery. So these are the cities that are providing support for the senior center meal programs, but also all of the restaurants. And so, you know, when we talk about Great Plates and what an economic driver it is, I mean, it truly is, and that you are employing hundreds of people through this program to make all of these deliveries possible. And for these 4 million meals, I think most people forget that about 95% of these meals served are delivered directly to the person's home. And so it's not just come to the senior center and pick up a meal. It's the driver going to somebody's home, you know, sometimes daily, sometimes every other day to deliver meals. And so we are, you know, incredibly appreciative of all of the community support, your board support, the CEO's office, other county agencies that have been, you know, a tremendous help. But this has been, you know, this has been a heavy lift, but it has been possible because of, you know, the widespread support. And know that this is not just us. We're just the face of the program, but there are so many people working behind the scenes that really, you know, deserve the credit. Next slide, please. So what does serving 4 million meals look like? So pre-pandemic, we were looking at about, you know, 20,000 meals a month, which was a lot of meals. We thought it was a lot, I guess I should say. Us pre-COVID was like 20,000 meals is a lot. Now, you know, last month we were at 309,000 meals just in March. So we are serving more in a month than we served pre-pandemic in a year, much more. We are starting to see the trend of the meals. You can see like the surges, right? So you can see, okay, everybody had to stay home, and we had a, you know, tremendous growth in the program, and then it went down, you know, late summer through the fall, and then as the surges started to hit, people that were off the program came back on because they were not feeling safe. And so now we are starting to see a gradual decline. What that totally is going to look like, we don't know. And that's part of the modeling that we're doing, trying to figure out what meal programs look like post-COVID. Next slide, please. Okay, so for anybody that's really listening at home and that, you know, thinks about some of these services and saying, you know, my loved one could use something like, you know, one of these services, I would just encourage you to either call us, email us, or visit us online. And I'm happy to answer any questions. Thank you.
Thank you so much, Ms. Jump. Do any supervisors have questions or some thoughts? Supervisor LeVere.
Thank you, Madam Chair. Ms. Jump, I just wanted to congratulate you. We talked earlier about the state recognition you received the other day from the state AAA, and it's just so well deserved. Everything that you and your department have been doing this past year has been almost superhuman, and the support and the services you're providing to those most in need in our community. So thank you for everything you've done.
Thank you. Superhuman. I like that expression because they truly stepped up. Supervisor Long.
Thank you, Madam Chair. I was thinking back to Brenda's Casamia being highlighted at NACO for our National Association for all the food service they do for the seniors in Piru. And
just amazing that your program would be serving over 360,000 meals every month additional from before the pandemic. That's a lot of organization and restaurants coming together and volunteers coming together to help drive all those food to all the people that need it. And so I just want to say thank you very much. I am concerned in regards to the funding for future as we have our seniors who are housebound and with COVID-19, what that's going to do. So I appreciate you really keeping an eye on that and making sure that the funding is there where we need it. So thank you again. And from handling our very young to our very old, I really do appreciate all the effort that you and your staff and all the volunteers have done. So thank you.
Great job. With that, I think we're down to, yes.
I just have to, I've watched so much of Victoria and her team's action. Thank you, Chair Parks. It is, she makes it easy to collaborate with them. Look at all the people, the county employees, the volunteers, the businesses, that just really, and that helps, it facilitates it, right? I mean, she's a known collaborator, and that's, that's what makes this happen. And the relationships that existed beforehand to just boom, bring all this together and get those seniors fed and have that social contact, that personal contact that really helps their well-being. Her and her team, just can't thank you enough, Victoria. Thank you.
And it is a small but mighty agency. And I know in a decade or so ago, there was discussion of having them join with a different agency and not being separate. And I really like the idea that we have for our seniors this separate agency. And I feel like it provides some nimbleness that we may not otherwise be able to achieve. And particularly in a situation like this, it just really shined. And I so much am thankful for the good work that they do, and even though they are small.
Chair Parks.
So our next item, budget report.
I'm sorry, you couldn't hear me, right?
Oh, I didn't. I'm sorry. I missed you, Supervisor Ramirez. Go ahead.
Just very quickly, I want to thank everybody for presentation and Victoria for her presentation on this. And I always thought, I've said it a few times, why can't we do this forever? You know, take care of our seniors who've given so much and need a meal. So 4 million meals, that is life-saving. And I think it's also saved some restaurants from going under. Some of my favorite restaurants participate. I think we all need to be aware that this county, like many other parts of the country, are facing a big increase in the number of seniors who want to stay home but really can't live alone. And that's going to, I attended the Master Plan and Aging presentation. It's already been a couple of years. That was done in, I think it was done in Camarillo, Spanish Hills. And it was something, it's like an earthquake. You have to get ready for it. You can't be caught looking and get surprised because if we don't, then, tragedies happen. And we don't want to be that kind of county that lets it happen. So thank you very much for this just life-saving work. Thank you.
You're welcome. Yeah, absolutely, having that plan in place. And that was the impetus of our senior summits that we've been doing. I think we've got one more going while I'm in office, but maybe another supervisor will take on those every other year conferences and help us plan for our aging population, and hearing from them is really important. Thank you so much, Ms. Junk. I believe our next, I think we got everyone. I believe our next speaker is going to be Melissa Livingston with our Human Services Agency. See that you're all ready to go.
Yes. Thank you, Chair Parks, members of the board, Mr. Powers. For the record, Melissa Livingston, Director of the Human Service Agency. First, I want to thank you for the opportunity to present HSA's budget overview this afternoon. Really appreciate the importance of educating our board on our program services, as well as our challenges and opportunities as we enter a new budget year. But before I do that, I really would like to extend my thanks and appreciation to your board, to our CEO, and to our CEO's budget team for helping make us whole this current year. As we entered the pandemic, there were great uncertainties about whether federal or state funds would flow, whether we would have the level of realignment to help us meet our base programs and mandates. And by making us whole this current fiscal year, created some level of stability during uncertain times to know that we were made whole to meet our current budget, despite the challenges that we knew that we had ahead of us, as well as the uncertainties. And so I really appreciate the fact that our base was secured so that we could continue to provide the level of services that our community needed and deserved. So I want to thank you for that. And we were very fortunate. In most disasters and economic downturns, we see caseload growth that's exponential. And we were very fortunate that pretty much all of our programs and services maintained pretty much flat growth, other than our CalWorks program. And understandably, food insecurity was and continues to be one of the #1 issues that have been experienced through this pandemic, not only in Ventura County, the state of California, and across the nation. So I just wanted to take the time to first thank you for that. So next slide, please. There is no way in the short period of time that we have with you today to go over all of the programs and services that the Human Service Agency delivers. So I'm certainly offering an opportunity to spend time with you and your staff to learn more about our programs and services. So from a very high level, we have 4 main departments. We have over about 1,350 staff that are positioned regionally across Ventura County that provide a wide array of services. Our base budget's $297 million, and it supports, and it has supported this last year, over 235,000 families in Ventura County. And if we all know the population of Ventura County, that's almost 1 in 4 people in Ventura County are receiving our services. So our Community Services Department administers the public assistance programs that include our CalFresh, our CalWorks, our Medi-Cal, our General Relief, and our cash assistance programs for immigrants. Our Children and Family Services works with youth and families, an array of county and community partners to prevent, respond to, and reduce child abuse and neglect. They also provide for adoption services, resource family recruitment and retention, and services for transitional age youth. Our Adult and Family Services team ensures the safety of older and dependent adults. They provide adult protective services, homeless services, career services, public guardian, public administrator, in-home support services, and the IHSS Public Authority Provider Support Services Network. Our administrative services, which is the entity that holds all of us together and supports us to help us achieve our mission, provides agency-wide support, including fiscal contracts, business technology, facilities, HR, safety, strategic planning, communications, government relations, community relations, data analytics, systems improvement, project management, and disaster preparedness and response. Additionally, our Farm Worker Resource Program is positioned to address prompt resolutions to workplace concerns and building and strengthening relations with our ag and farm community. And the Workforce Development Administration staffs our Workforce Development Board as a major convener and oversight of the Workforce Investment and Opportunity Act funds in support of serving the needs of businesses, adults, dislocated workers, and youth across Ventura County. Next slide, please. So as we heard earlier during our budget update from our CEO and from Supervisor Long, we have maybe gotten a little bit of a sneak peek into what some of the things are that may be underfoot to influence the May revise. The May revise, to this point in time, we haven't heard anything that's going to impact or reduce any of our funding streams, but rather we've heard that there's a potential to enhance support for our vulnerable and disadvantaged communities. And so based on the work that the Human Service Agency does, we're looking forward to the May revise and the advocacy that CSAC has put in place to ensure homelessness, housing, broadband, IHSS funding, disaster resilience and recovery. Those will all benefit the Human Service Agency directly in the work that we do. The Human Service Agency budget is supported by federal, state, and county general fund. Our budget, again, our base budget for 2021 was $297 million. 15% of that was general fund. Our general fund plays an important role in helping us leverage federal and state dollars. By covering our percentage of the cut for those programs, we're able to maximize and bring down a large amount of federal and state dollars. So 85% of the funds that come to the Human Service Agency are from the federal and state government. Our general fund also supports some of our non-mandated programs, such as RAIN, homeless services, and veteran services. You can see from the pie charts that of the $297 million, 48% went to staff salaries and benefits, 36% to direct client financial assistance, and 18% to services and supplies. And in services and supplies, there are services that provide direct support to the clients that we serve. In addition to the direct financial assistance, you'll note that $1.6 billion is the value of the Medi-Cal and the CalFresh benefits that are received by our recipients that are used to meet the most basic needs of health and well-being. Next slide, please. So we learned a great deal this past year. Most specifically, like every emergency event we have seen over the last few years, we learned more about our most vulnerable and disproportionately impacted residents. Each event is different and brings new learning and opportunity to strengthen our service and supports, and to do so from an equity lens. We have seen firsthand how disadvantaged communities are challenged by equal access to information, resources, services, and equity and outcomes. As we do this work going forward, post-pandemic, and in the face of likely recurring emergency events, we can do even better, changing old ways, often embedded in our social service structures, institutions, policies, and practice. Although we begin this equity work with race, it will naturally and appropriately also extend to addressing inequities such as gender, gender identity, sexuality, disabilities, limited English proficiency, and economic status. We most appreciate the leadership coming from our Chief Executive Office and Mike Powers and your board, and the addition of the Diversity, Equity, and Inclusion Office and Officer to help us lead and forge this important work going forward. The rest of my presentation will focus on an equity lens to recovery and resilience, new ways of doing business, and preparedness for change. Next slide, please. So like the other department heads, we are most proud of our pandemic response and the dedicated county workforce and partner networks that came together. The Human Service Agencies, of its 1,350 staff, we are essential workers. Much of the work that we do could be put under the category of first responders. The work specifically that our social workers do in addressing emergency investigations of child abuse and adult abuse are those that are on the front lines. And so the role we play every day as essential worker in delivering life-changing and sustaining services to our most vulnerable residents didn't change during the pandemic. It just became magnified. And we had to modify the fashion by which we provided our services, as well as continuing to provide face-to-face services while mitigating risk to our staff and to those that they served. And I commend the staff. They did this work with great respect, calm, and dignity for those experiencing trauma from the pandemic event. They truly are the heroes of our agency and are worthy of standing alongside the heroes of all of our county workers who stepped up, staying true to the mission. So additionally, the Human Service Agency also had 100 staff who supported disaster service work roles through the entirety of this event. And they did so in another way to expand their sphere of influence and expand their reach and support for our most needy and vulnerable residents. The team was able to support and work not only given their connection to the mission, but due to their long-standing, trusting relationships that they have established in the community, their human-centric and their trauma-informed skill sets, and their ability to be flexible and resilient. So I'd like to just celebrate a few highlights of the work efforts that staff were engaged in while supporting the 235,000 residents that they do on a regular basis. Staff supported $44 million in supplemental CalFresh grants. They supported $1.9 million in CalWorks stimulus grants. A large team assisted in helping get $3.4 million administered through our Ventura County Rental Assistance Program to support 1,700 households covering 3 months of rental arrearages. $3.6 million in support of the Farm Worker Household Assistance Program, benefiting close to 3,500 households. And thank you to your board for this morning approving an additional round of service and benefits to those same individuals. And thank you to the Ag Commissioner, a call out to the Ag Commissioner for leveraging his team to help us with that program. Support of Project Room Key, 430 participants at 4 hotel locations, overseeing the intake and coordination of case management services and support along many other county partners and community providers. Supporting the vaccination registration call center for predominantly older adults and individuals with limited English language proficiency and technology challenges, including coordination of registration for homebound seniors requiring home-administered vaccinations and taking over 40,000 calls. Thank you for the support in managing a call center for vulnerable seniors, making over 26,000 well-being and safety check calls, and the coordination of needed services and resources, with food insecurity being the greatest need. The list could go on, but thank you to your board and the CEO for supporting these initiatives and providing the opportunity for staff to extend their reach and support to our most vulnerable. We learned a lot through this process that will allow us to be better positioned to continue this work moving forward from an equity perspective. And I'd like to also thank our IT team, who quickly moved 800 staff to remote working capabilities to allow us to continue to do our work almost seamlessly. Next slide, please. So looking ahead, as we move into recovery and post-pandemic efforts and continue to ensure equity and access and outcomes, although not inclusive of all efforts in play, here are a few of our most visible and notable. $50 million in the Emergency Rental Assistance Program that's now available to those individuals who have experienced financial hardship enabled in their ability to pay their rent, as well as the ability for landlords to recoup on rent that that tenants have not been able to pay. Support of our Workforce Development Board and all of our service providers through business continuity of industry recognized credentials and employment for our CalFresh participants, non-custodial parents, veterans, those with disabilities, English language learners, migrants, seasonal farm workers, and those with limited digital fluency, and those experiencing homelessness who are justice and those who are justice involved. Support from MyCop and Interface in Medi-Cal outreach and enrollment and retention services for those hard to reach and underserved communities. The launching of a restaurant's meal program for CalFresh clients who are 60 years or older and have disabilities and or who are homeless, and also temporarily expanding our CalFresh eligibility for college students. And recognition of our farm worker household assistance program for households with that have needs that have been impacted because of COVID due to loss of employment, childcare costs, transportation costs, food, medical costs. Appreciate the partnership with our ag business advocates and community in working with us in bringing private donor dollars to the table to assist in meeting the needs of our farm worker households, and your board support in all of those farm worker household assistance programs that we administered. And then additionally, recently launching our Housing for the Harvest program to provide for quarantine and isolation support for farm workers who have tested COVID positive, who have been exposed. And a call out and thank you to Public Health, our Office of Emergency Services, our Farm Worker Resource Program, and most importantly, the UFW Foundation for being our local administrator of that program. Next slide, please. So looking ahead as we lean in, as we have addressed a wide array of vulnerable population equity needs throughout the pandemic, we realize there are and there will continue to be additional impacts that play out over a period to follow post-pandemic. Most specifically, we are poised to continue to lean in and anticipate some of the following impacts. As we have lost our community mandated reporters throughout the pandemic, and with schools moving to virtual environments for instruction, and as youth and families have been isolated for long periods of time, we expect to see an increase in abuse and neglect given this isolation and the financial impacts and hardships placed on families. Additionally, seniors and adults that have been isolated may have endured increased self-neglect and abuse or neglect from others, lending toward likely increased caseloads and abuse and neglect cases, including a recognition of the #1 impact of the pandemic in highlighting food insecurity with our senior population. As we have learned, and as my colleague Victoria Jump has shared with you, we have a more serious problem of food insecurity than we realized. Many seniors, even those that may not be low income, often make decisions between whether they can pay their rent and medical bills or eat. And often the decision to eat or not eat or eat less is the one that's made. And so we have a larger food insecurity problem ahead of us that we need to deal with. Additionally, as the State Master Plan on Aging has identified, our aging population, as Victoria shared with you, is going to be increasing exponentially, approximately 2 million more over the next 10 years. And this is going to lend toward increased caseload and support and service needs for our aging population, inclusive of our in-home support program that continues to grow. And it grows as more seniors are aging and seeking to remain independent and in their own homes, often relying upon and needing quality in-home care provider support. This increased demand will require sufficient IHSS social worker staff recruitment of ongoing pipeline of IHSS providers, and wage increases sufficient to retain a qualified and robust provider care network, caregiver network. Next slide, please. One of the things that we have done as an organization is, as we've learned so much through these past events, and we've learned about how disproportionately impacted members of our community are, and some of the inequities that are born through these events. We have decided that it's important for the Human Service Agency to revisit its mission, vision, and values, and to do that from an equity lens, and to identify places where we can do better in providing our services. And so we've launched a series of surveys to receive feedback, starting with our staff, our management team, extending that to our community partners, providers, stakeholders, and clients. And from that input, we want to listen to that input, and we want to take that input and reimagine who we want to be as an organization and how we want to deliver our services and how we're going to do that from an equity lens going forward. So I'm looking forward to the organization working together as we do that work and bringing the community and lived experience into that process as we do so. We also are concerned that we may see potential growth in some of our public assistance programs, especially as state and federal assistance may start to dwindle. We may see some individuals in the community who still continue to struggle and may need our services. We also recognize that the state and the federal government are also starting to look at how they can relax some of the eligibility rules, recognizing through this pandemic that we saw many inconsistencies between rules and regulations from one program to another. So there is also a potential that that we'll be seeing some relaxation of those rules, and it may have an impact on our caseloads. Next slide, please. So looking at what has worked for us, as we've moved from our old ways to new ways of doing business from an equity lens, we look to piloting and offering new service models. We learned how to provide our services virtually during the pandemic, and we found that many of our clients preferred online and phone services. But we also learned that not everyone has access to technology, nor have digital literacy and fluency. As we plan our reopening strategies, we will offer a wider array of choices as how to access our services and engage our services, prioritizing those that require in-person, as well as looking toward opportunities to address the digital divide in our disadvantaged communities. We have seen how valuable our farm worker resource program is to our farm worker and ag communities alike. And as we have learned more about the needs of the community, our program roles and responsibilities have grown, and appropriately so. We expect to see a need to continue to grow the team to meet the need into the future. We also look to enhance staff engagement, maintaining a large percentage of our workforce working in long-term telework assignments. We have found that many of our workforce actually are more well-suited to teleworking. They like the flexibility, and they've been extremely productive. As we move forward, we will continue to offer this opportunity and flexibility while ensuring that staff stay connected and opportunities for growth and development occur equitably for staff working in the office as well as out of the office. Next slide, please. So as shared, we moved a lot of our workers into the telework environment initially We had over 800 employees that were doing those as that telework assignment, and in evaluating as we plan for our reopening plan, we look to see to support probably about 225 in longer term assignments with teleworking. So next slide, please. So our continuous evolution, we have learned how important it is to be prepared and ready for change. Thus, we are planning for and engaging in intentional work around disaster preparedness, conducting drills and training staff as shelter managers, as workers at temporary evacuation points and sheltering facilities in partnership with OES, public health, behavioral health, animal services, cities, and the Red Cross. We're launching a community needs assessment in conjunction with the newly formed EPC subcommittee that addresses the needs of individuals with disabilities, access, and functional needs, those most likely to be disproportionately impacted by a disaster. We're increasing the HSA team dedicated to preparation, planning, response, and recovery for mass care and shelter. We'll be enhancing our use of electronic case files across multiple programs, including the use of dark data that helps us bring to the forefront critical data and information that can help us make real-time differences in the lives of children and families. We'll be preparing for implementation of the Families First Prevention Services Act, leveraged through the leadership of VCOE, probation, behavioral health, the Human Services Agency, and Tri-Counties Regional, to develop an integrated community-based system of child and family well-being across Ventura County. And lastly, we'll continue to invest in our community, listening to the voice of our clients, partners, and stakeholders as we strengthen our DEI commitments, driving equal access to information, resources, services, and equitable outcomes. Thank you, and I am happy to answer any questions you might have.
Great job, Mel. Thank you. Pause for any questions there.
Melissa, I'm just so impressed by what our HSA department is doing. It's like a hand, so many fingers into everything. Well done. I'm sure there are things that you probably want to improve, but in the overall process with COVID and so forth, I just want to say thank you so much. The process improvement that's been put in place in the last 4 years is really showing, and the community is being well served, and want to really appreciate the outreach into the Santa Clara Valley and all the work that's been done. Just thank you.
You have a question, and we have Supervisor Ramirez and also Supervisor Levere.
Thank you, Ms. Livingston. Pretty comprehensive, pretty overwhelming, actually, what the agency is obligated, or it is obligated. The county's obligated, if people don't know, because the county has the legal obligation under state law to provide for its indigent folks. Under Welfare and Institutions Code 17,000, I've been very familiar with that as a former legal aid attorney, trying to help people get their welfare benefits, now called TANF, or their food stamps, or their Medi-Cal, or other benefits. And one of the things that does concern me, it should concern everybody, is the very limited assistance that disabled people get who have not worked on a regular payroll. They may have been domestic workers, cleaning houses or daycare or that kind of thing. Their income, when they get to a certain age, which is 65, or when they become disabled through the supplemental security income program of the federal government, is under $1,000 a month. Sometimes it's about $800 a month. And it's very difficult to rent a place, to have food, to buy your drugs you need, your prescription drugs, let alone have any kind of extras. So it's something I think we really need to pay attention to, what can be the quality of life when the benefits are so limited. That'll be something that needs to be addressed at a much higher level than the county. But I always want to encourage our county, whenever I've had the chance, to help people apply for the benefits that are federal. And I'm not sure I saw it in there, but in case I missed it, I do think it's important because that is a benefit that people are entitled to, and it's not easy to get. I can say that because I've litigated that a lot, especially for people who haven't reached the age but are disabled and can't work. So just something to think about, along with the large number of people who are going to reach that age where they're not able to, they'll need a lot more care than they can get at home or even with a caregiver. So something we have to be prepared for, like I said, like an earthquake. Thank you. Great work. Appreciate it.
Thank you, Supervisor. Supervisor Livier.
Yeah, great. Thank you, Madam Chair. And I just want to thank Ms. Livingston. Just such a comprehensive presentation. This afternoon, we've kind of highlighted so much of the important social service work this county provides. And obviously, HSA is a critical part of that important work. And, just moving forward, I really appreciate your focus on the needs of those in our community who are most vulnerable, as Supervisor Ramirez mentioned, particularly our seniors, those who are disabled or homebound. And obviously, I like the focus on the IHSS workers as well, because as you say, what they do is going to become so much more important as our senior population continues to grow. So thank you for keeping your focus on those important areas, and looking forward to a lot of this work we'll be doing in the future.
Thank you. Ms. Livingston, did you also, I might have missed it, discuss our foster kids in that program?
Yes, yes, Supervisor Parks, I spoke broadly about that, but most specifically, I think the Families First Prevention Services Act is the opportunity to really move to an early intervention prevention model versus removing kids and then trying to reunite them with their families. The goal is to begin the work from a community-based perspective and to address issues at the early onset before they become challenges that sometimes break up families and create trauma. So that's the partnership that will come together by that collaborative that I mentioned to look at this from a more community holistic perspective, and to listen to the voice of youth and families and their lived experience in order to develop the systems that they need to meet their needs.
And I think we have that same type of preventative effort with people so they don't become homeless. Once they do become homeless, it's just very difficult to, get them back sheltered and all. And the same thing is once a child is taken from a home, it's very difficult, to bring them back together again. So I appreciate that what we can do in our community is to reach out. And I think we've got some contracts coming before us, I think, in the future on this too, to just look at how we can go into the homes and where we're wanted and we can help. So thank you for the presentation. As I think a lot of us were wowed just to have the understanding of all the different things that the Human Services Agency does. And it's good to see that there is some funding out there for some of those key programs.
I made Chair Parks a couple things that you mentioned. I think the HPRP, Homeless Prevention Rapid Rehousing, you were thinking of, and your board, HSA does administer that using some state and federal funds, but also some direct general fund dollars that your board provides as well, because it is so effective keeping people housed and preventing that homeless cycle from starting. I just wanted to take a minute. This is the end of our presentations today, but just to thank Mel. That's a ton of information, as you could tell, really well organized. 1 in 4 people in our community is being helped in some way by HSA. And that's not just made up to sound good. That's reality, which is amazing. You can see all the different programs where they do it. It truly is a hand up. But their COVID response is unbelievable in terms of the direct work they do, but 91 disaster service workers and their social workers, as she said, just like the public safety folks, continuing to go out into the community in the midst of this pandemic, going into traumatized homes with, for child protective, adult protective services, continuing to do that. So brave and so passionate. But you also saw, I think, in these 4 departments, how well they work together. You probably heard some similar themes. There's a lot of crossover. And this is where it happened, and it's the culture your board sets, that you expect that of our departments, that they work across agency lines and for the benefit of our community, and you see it a lot. And you also see, I think, just last I would say, is it's a big employer. These 4 departments represent over 2,000 employees. That's a big employer right there just by itself, just these 4 departments. So there's a lot of engagement that's happening, and you heard Mel touch on that, all of them really. How they engage their employees, our greatest asset in terms of training, supports, issues where we're talking about more about diversity and really engaging. That helps our employees, but it also in turn helps us as we turn and engage the community, because it's naturally what we do, and that's who we serve. So just excellent job, Mel, as always. Thank you. And thank you for your board. I know it's a lot of information in one afternoon, but I think it gives you a good feel for all these 4 mighty departments and all they do for our community.
Yeah, and I think Supervisor Ramirez has another comment too, but to that being the largest agency, and this is the first we've really heard from the director saying, and we can do this work at home thing. It provides some flexibility and we're getting good productivity. So that is something that I think a lot of major employers are all looking at now as we get back into the workplace, at how much of that actually has to be geographical. And then it is a big number to think that 1 in 4 in our county have received services. It made me think, well, maybe our county's bigger than 880,000 or something like that, because it's really hard to imagine that we could possibly have that many people that are in need of services. But what happened to our economy in the last year is a good example of that. And it's certainly something to be said for Ventura County, which distinguishes us in the ability of our different departments to work with each other as well as with sister agencies and such. And one big one is also the healthcare agency and the human services agency. There's a lot of interplay there that is necessary. And you realize after you've been around a bit that the more of that interplay you have, the better the results, right? So kudos to our directors for that.
Right.
And Supervisor Ramirez, did you want to make another comment? No, you're good. Okay.
My hand down.
Well, thank you, Mr. Powers, for bringing this forward and the way that you're doing it. I think it really is helpful to understand it. Budget time gives us all a greater ability to understand what our departments are doing. So it's great to take that opportunity too. So thank you for that.
Thank you. Thank you, board members.
And if there aren't any other questions or comments, could we have a motion then to receive and file these department reports?
Huber, so moved.
Thank you, Supervisor Huber.
Long, I'll second.
Thank you, Supervisor Long. And with that, could we roll call Ms. Key?
Ms. Key's microphone is having an issue at the moment, but we do have a public comment. Would you like me to read that into the record while she's fixing?
Yes, that would be a great idea. Thank you.
All right. This public comment is from Laura Espinosa, president of Santa Paula Latino Town Hall. And it states, this comes to you on behalf of the Santa Paula Latino Town Hall, SPLTH, a 25-year Latinx advocacy group in the Santa Clara Valley. We have a long history of offering public comment on those items affecting local impacts to health and social services in the county of Ventura. We are pleased to offer the following comment as the board prepares to accept county department budget presentation and makes final decisions during our annual budget process. Last month, our organization hosted the county's Diversity, Equity, Inclusion Officer, Pin Zapania, as our guest speaker. Our membership has followed the board's adoption of the resolution declaring racism as a public health crisis and wanted to inform ourselves of the county's plan to address racism. SP Latino Hall felt more informed and educated on the subject of racism following the PowerPoint presentation. We acknowledge the board's commitment. As an organization that works within a low-income community of color, we have felt the impacts of false promises of colorblind policies. We understand there is much work to do in developing strategies for anti-racism, resolving social inequities, and institutional barriers. We have seen new initiatives that raise optimism but are left understaffed, held together by 1 or 2 or 5 people trying to serve hundreds of thousands of people. The County of Ventura and its 27 departments serve your constituents, public employees, and holds the bar high as a model for individual cities and other counties in California, and that is the 250 word limit.
Great comments.
Can
You
you hear me? Oh, good. Sorry. Sorry about that. I am ready for a mover and a seconder because I missed it the first time.
Okay, so I believe the motion was from Supervisor Huber, seconded. Supervisor Long, were you the motion maker?
No,
It was Supervisor Huber that did the first and Supervisor Long did the second. And I think we might have some more public comment. But I wanted to say thank you to the Latino Town Hall for sending in that letter. Much appreciated.
It was some good feedback for sure.
That's the only public comment that I have.
Okay.
So we have Supervisor Huber and moved it, Supervisor Long seconded.
And the roll call?
Supervisor Levere.
Yes.
Supervisor Long?
Yes.
Supervisor Huber?
Yes.
Supervisor Ramirez?
Yes.
Chair Parks?
Yes, thank you. And I think the next item should be the fastest item yet, perhaps. That's item 43.
I don't believe there's anybody on Zoom. I don't think we have to do anything, but I'll defer to Tiffany.
See how fast it is? Do we have a motion on item 40? I actually don't even need a motion either, correct?
That's correct. We don't need a motion for it.
There you go. That was quick. How about the correspondence agenda?
A motion to approve.
Okay.
Stop on it.
And I was going to ask Ms. North, do you agree we don't need to have a vote on that item?
On the correspondence agenda or the public or the hearing that was taken off calendar?
The hearing that was taken off.
Yeah, the hearing that was taken off calendar, we don't need a motion.
Right, thank you. Okay, and we do have a motion then for our correspondence agenda.
Yes, I motion to approve the Supervisor Long.
Yes.
Second.
Thank you. Supervisor Levere, second. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. So that completes the correspondence agenda, and I think then we may have taken care of all of our open session items. And not hearing anything different from those who may know more than I on that, let us then go to our closed session.
Sounds
and
good.
As we do that, I will ask our county counsel, Ms. Tiffany North, if she anticipates that there will be an announcement from this closed session, in which case we'll come back. Otherwise, we'll adjourn from our closed session.
Yes, Chair Parks, there may be a reportable action.
Okay, so we will come back into open session to adjourn.
We are live.
Good evening, and this is our April 27th conclusion of our Board of Supervisors meeting. We have one announcement to make, and then we will adjourn. And so I will turn it over to our County Counsel, Tiffany North, and you have an announcement for us.
Thank you, Chair Parks. Yes, the Board of Supervising, having met in closed session today, there is no reportable action except as to Agenda Item 47, in which the board has authorized County Counsel to initiate litigation on behalf of the county employees by joining in the cross complaint previously filed in the case by a 5-0 vote. Once the litigation is initiated, the particulars of the litigation shall be disclosed to any person upon inquiry. Thank you.
Thank you. And this is on behalf of our Ventura County employees.
That's correct.
And with that, we stand adjourned.
Thank you.
Thank you. Have a good evening.